Order. Questions for oral answer. Mr. Pritam Singh.
Mr. Speaker, the Ministry of Health, MOH, publishes various public health indicators related to the health system and population health outcomes. For example, several capacity-related indicators are available on the MOH website. The annual National Population Health Survey covers lifestyle risk factors and practices such as smoking, screening, and vaccinations. The National Nutritional Survey informs us of the dietary patterns and nutritional status of the population. The annual MOH revenue and expenditure estimates, i.e. the budget book, also published various key performance indicators such as life expectancy, mortality rates from diseases, disease prevalence, medical resources, etc. In addition, indicators on cancer, chronic kidney failure, stroke, and heart attack are also published by the National Registry of Disease Office annually. Health outcomes take time to shape and evolve, and it would not be appropriate to report fortnightly or monthly.
Mr. Singh.
Mr. Speaker, thank you, and I thank the MOS for the reply. My question really starts from the discussion we were having at the debate at the Committee of Supply. MOS referred to the budget book. There are two particular KPIs there, for example. One is the percentage of patients who wait less than or 100 minutes for consultations at polyclinics. There's another one which says the percentage of patients who waited more than or equal to 60 days for new subsidized specialist outpatient clinic appointments. My question was framed with regard to our super-aged society, and the consideration I'm suggesting that the MOH look into is whether there could be a public health dashboard for Singaporeans that gives us a one-stop, identifiable data point on what our public healthcare outcomes are looking like on a bi-weekly or monthly basis. So these two KPIs in the budget book, for example, could potentially be on that dashboard. There are other OECD countries also which have public health dashboards, and my query ultimately is, how is MOH going to look at improving reporting of these public health outcomes in the context of a super-aged society and not prior to this Rubicon that we have now crossed?
MOS Rahayu.
Mr. Speaker, I appreciate the input and insight that the member has raised. Perhaps I could just give some insight also as to how we have framed this. Actually, when we look at how we are tracking and measuring, we look at an end-to-end and a full suite approach to things. We look at the preventive efforts that we're doing, and that's why we're tracking screening rates, enrollment to Healthy SG. We look at the aspect of the systems and the pressures on that, the access to care, so that's also one dimension. And we also look at the larger health outcomes. So there is actually a full range, and in that sense, many of these are already available. That data point is already available to the public to scrutinize and look at. Secondly, I think in deciding what are some of the KPIs or items for us to track, there needs to be an appreciation as to whether or not that is meaningful. So I take note of some of the items that you have raised. There needs to be a balance in what we are tracking, because just providing the information may not provide any meaningful insight or will necessarily encourage the right behaviors. So, for example, when we look at ED timings, the point of it is really that at the end of the day, for emergency department, if it is an emergency case, it will be attended to immediately. So regardless of the median waiting times or whatever, there is already a protocol that's in place. Point is, we also want to then nudge behaviors, and that particular measure may not necessarily reflect the efforts we are taking in that space. There is also costs to tracking and the measuring, so we want to make sure that whatever we decide on to measure must be meaningful, must then lead to better behaviors and the correct approaches to then respond to some of those indicators. But I do take the point, and we are actually reviewing to see what is a meaningful way to put out this information so that public can understand, so that we can all track properly whether there are good health outcomes as a result of the efforts that we're making. I'll take the feedback back, and we will continue to review this.
Mr. Singh.
Thank you, Speaker. Just, I think MOS mentioned meaningful impact a few times. So I'll give an example. The KPI in the budget book, percentage of patients who waited less than or at least 100 minutes for consultations at polyclinics, for example. For each fiscal year, 2023, 2024, 2025, the number is 99%. So very high degree of hitting the KPI. But at some point, we have to ask, is that a meaningful representation of what constitutes a good public health outcome? Is 100 minutes too lax or too permissive a KPI? So I think if you have a public health dashboard, for example, with a little bit more granularity, I believe the public would have a better sense of the stresses on the healthcare system and where improvements can be made and where changes also can be advanced in Parliament and out of Parliament to achieve better outcomes for the population at large.
MOS Rahayu.
I appreciate the members' feedback, and as I said earlier, this is something that we will continue to consider, but we do also have to appreciate that the information that we get is live in terms of waiting times and all that. So you're right in that we will constantly review as to whether that measure is actually a good reflection of the state of the health systems. But as you know this, we give feedback all the time to MOH, and we do respond quite immediately to some of these issues, especially with, say, waiting time in the polyclinics, how they are utilizing perhaps the online systems. And on the go, our healthcare providers, our public healthcare providers are constantly trying to improve and adapt. So I want to give that assurance that we do take note of these. One, in respect of actually making sure that whatever we're measuring is meaningful. Two, there is always a quick response to immediately and promptly respond to the needs on the ground as to the healthcare utilization and to respond to the changing landscape with regards to aging.
Dr. Wan Rizal.
Mr. Speaker, to date, preparations for Hajj 2026 are proceeding as planned. MUIS remains in close contact with Saudi Arabia's Ministry of Hajj and Umrah, MOHU, on the arrangements and will continue to monitor the latest developments in the Middle East. MUIS is working closely with the Association of Muslim Travel Agents Singapore, AMTAS, and the appointed Hajj travel agents and service providers to support our pilgrims for a safe Hajj journey. These include using direct flights to and from Saudi Arabia, choosing ground transport options less susceptible to disruption, and closer coordination of pilgrims' movement in Medina, Mecca, and Jeddah. MUIS is also developing contingency plans with AMTAS and Hajj travel agents to plan for potential travel disruptions and unforeseen incidents during the pilgrimage. Above all, the safety and welfare of our pilgrims remain our utmost priority. MUIS will continue to keep all pilgrims and the wider community informed of the latest Hajj arrangements.
Dr. Wan Rizal.
So I thank the Minister for the reply. I'm glad to hear that Hajj will continue this year as planned. But given the continuing uncertainty in the Middle East, I think many pilgrims and their families are rightly so concerned about this year's arrangements and perhaps also what happens if they are disrupted at a very short notice. Some have also shared that they might want to withdraw in case, for safety reasons. So my first SQ is if Hajj arrangements are cancelled or significantly disrupted this year, or some pilgrims choose to defer due to security concerns, will pilgrims who were due to travel this year be given priority in the following year or subsequent years, and how will this affect others who are already in the queue? My second SQ is that if it happens, can the Minister also clarify, is there some way that they can get a refund or deferment or financial assistance that could be provided and arranged for them so that the affected pilgrims are not unfairly penalized for circumstances that are beyond their control? Thank you.
Acting Minister Faisal Ibrahim.
So I thank the member for the SQ. The answer is yes, the affected pilgrims will be given priority, but this is subject to the annual quota allocated by Saudi Arabia's MOHU. And when that happens, MUIS will work closely with AMTAS to make the necessary arrangements. On his second SQ, we understand that pilgrims will be concerned about their financial impact in the event that Hajj is cancelled or disrupted. So in fact, as I shared earlier, we are in close contact with MOHU and AMTAS, and to ensure that the affected pilgrims receive the necessary support and financial assistance. And also, the type of support that we provide depends on the prevailing circumstances. Right? So should Hajj be cancelled or disrupted, this year we will work closely with AMTAS to allow the affected pilgrims to defer to the subsequent Hajj seasons. MUIS will work with the travel agents and the Saudi-based service providers to explore possible refunds given the situation. So, as I shared earlier, we will continue to monitor the situation and we'll keep all the pilgrims informed on the latest arrangements and support measures in a timely manner. So we know Hajj is a very significant milestone for Muslims, and we want to make sure that while we facilitate, we also want to take care of the safety and the welfare of our pilgrims. And we seek communities' understanding and collective effort to stand together during this time of crisis.
Dr. Neo Kok Beng.
Question 3, sir.
Mr. Speaker, may I have your permission to take questions 3, 4, and 5 filed by NMP Dr. Neo Kok Beng in today's order paper together as they pertain to matters concerning foster parents.
Please proceed.
My response will also address a related question filed by the member for a subsequent sitting, and if the member is satisfied with the response, he may wish to withdraw the question after this session. MSF will continue to grow our pool of foster parents so that more children in state care can be placed in safe and stable family-based settings, which generally provide better social, emotional, and developmental outcomes than institutional care. MSF has partnered fostering agencies, community organizations, religious groups, and private organizations to raise awareness and recruit more foster families. We have also strengthened support measures, such as increasing the fostering allowance for those caring for teenagers from October last year, and removing the minimum household income and educational requirements for applicants from July 2024. On co-parenting, we are open to considering arrangements between foster and biological parents where appropriate, particularly to facilitate reunification of the child with the biological parents, and where it is in the child's best interests. On attrition, about 6% of foster parents have been deregistered each year on average over the past 3 years. The reasons include new family commitments, health or age-related factors, and relocation. We will continue to strengthen support, training, and engagement with foster families to improve retention and build a strong fostering ecosystem. The member may wish to refer to parliamentary written answers on increasing enrollment of foster parents on sitting date 18 February 2025 to learn more about earlier enhancements to foster care. On Child Life SG credits, they are credited to the Child Development Account CDA trustee of an eligible child to ensure that support is directed to the individual responsible for the child's care and upbringing. While it is possible for the trustee to change the CDA trustee through the bank's portal or mobile application, I would like to point out that in designing the fostering allowances, MSF does not assume reliance on these credits. Foster parents receive a monthly fostering allowance ranging from $1,100 to $1,800, depending on the child's age and needs, to help defray childcare and other out-of-pocket expenses. In addition, foster children are eligible for childcare, student care, and medical subsidies.
Dr. Neo.
Thank you, Speaker. I have two SQs. Firstly, we acknowledge that the MFS has done a very good job in reintegration. The percentage is very high for the foster children to the birth families. What I would like to ask is, what is the long-term reintegration rate? How long and how do you measure success of the reintegration? And this is to ensure the long-term safety and well-being of the child. The other SQ is on the, again, I want to follow up on the rights of the foster parents. What is the status right now for them to access the information of the foster children, especially in education, where they need to monitor, but now they don't have access to, and also they need to book the medical appointment online for the polyclinics or hospital, and they don't have access. So what is the status of this right now, as the focus is really for these foster children to be in the care of the foster parents for a couple of years? Thank you, sir.
Mr. Speaker, I'll take the member's second question first. Once a child or a young person has been assigned to a set of foster parents through a court order or a voluntary care agreement, foster parents will be issued a letter from MSF that identifies them as the caregivers under the ministry's fostering scheme. And this letter facilitates communications between the foster parents and the healthcare professionals to ensure that the medical needs are addressed. Also allows them to communicate through the schooling system to take care of the schooling educational needs. However, I acknowledge the member's point. Many of the public agencies' services have gone digital, and therefore we do want to provide this digital access as well. This is also the feedback consistent from what we've gotten from many foster parents. And therefore, MSF is currently working to further enhance our foster parents' experience by providing them access to the foster child's education and healthcare information through Health Hub, through Parent Gateway. This is in progress, and we'll hope to update the member at a later date once these are ready. On the second question, in terms of the long-term success rate, there isn't a single percentage or a single metric that we measure by, and what's more important, success is measured by whether the child is able to safely and sustainably stay with the birth family over time. Some other factors we look at when we evaluate whether this is safe and this is sustainable include whether there's further abuse or neglect. So the lack of it, the absence of it is useful. Stable caregiving arrangements within the family to care for the child. The overall well-being and functioning of the child, especially if the child is in school, as well as health and behavioral aspects. To safeguard the child after reintegration, MSF has post-reunification monitoring protocols. This includes safety checks, at least monthly, by MSF case officers, and these are complemented by inputs from community partners such as schools, social service agencies who know the family well, to ensure that if there's any risk or any concerns, these are picked up early. Children are also monitored for at least 12 months after reintegration, and longer if we need to. depending on the family circumstances and the overall assessed level of risk. Where concerns arise, MSF will not hesitate to intervene promptly to provide additional support to take further protective actions where needed.
Mr. Dennis Tan.
Thank you, Mr. Speaker. Relating to the issue of one issue of co-parenting, and I would like to ask that will the ministry consider granting foster parents synchronized access to the child's health buddy app? Currently, foster parents have no access to the app and require the cooperation of biological parents. Sometimes the cooperation may not be given for various different reasons. And I believe the ministry can help to bridge this gap to ensure better healthcare continuity for our foster children and also better coordination between the foster and biological parents. And if it is not possible to grant access across all fostering cases due to the temporary nature of some of the fostering arrangements, then given that many foster placements last for several years, will MSF at least consider enabling health buddy access to at least the longer-term foster parents, for example, those who are at least 2 to 3 years or upwards? Thank you.
MOSCO.
Speaker, I thank the member for his concern for foster children. I think the question is similar to my reply given to NMP Dr. Neo. In particular, we recognize it's important to give access to foster parents, health information. Those may be on Health Buddy. And like what I mentioned earlier, we are working on providing digital access to foster parents. In terms of what data fields, what information is provided to the parents, these are being looked at because, like you said, the context, the situation for every child, the length of foster care differs, and in some cases, depending on the circumstances under which the child is placed under foster care and the relationship with the biological parents, things can be sensitive, and therefore we have to consider all that when we arrange for what data fields are available to the foster parents. But ultimately, the primary consideration is that we want to make sure the foster parents have the information required to provide the necessary care to the child and make sure that the child's best interests are addressed.
Mr. Tan, short one, please.
Thank you, Speaker. Yes, just a quick clarification. I think, thank you for the answers and the details. Yes, the feedback I receive is pertaining especially to making appointments, because there have been instances where foster parents experience appointments being cancelled without their knowledge and then having to arrive at a hospital unnecessarily wasting their time. Thank you.
MOSCO.
Yes, indeed. So the digital access that we're working on will allow for the appointment booking system and updates to be made available for foster parents to access.
Dr. Harish Singaraju.
Sir, in the planning of schools, the Ministry of Education ensures that our students can access a primary school near their homes, except for a small number, 15, of special assistance plan schools. All primary schools offer the 3 official mother tongue languages.
Ms. Kozuki.
Question 7, please.
From 2024 to 2025, there was an increase of 104 cases of outrage of modesty, OM, from 1,427 cases to 1,531 cases, and an increase of 78 cases of rape, from 401 cases to 479 cases. The majority of the rape cases and more than half of the OM cases involved offenders known to the victims. The proportions of rape and OM cases involving offenders known to the victims has remained stable over the last 5 years. In 2025, of the total number of rape and OM cases, approximately 33% took place in residential premises, 18% took place in commercial premises, and 3% took place in educational institutions. The government takes a firm stance against all forms of sexual offending, and ministries have implemented a suite of measures to prevent offending, encourage reporting, and improve victim support, regardless of where the offence occurs. For example, in educational settings, students are taught to report their concerns and to seek help from trusted adults. In domestic settings, specialist agencies such as the Protective Specialist Centres, specialist agencies such as the Protection Specialist Centres and the Child Protection Specialist Centres provide social and emotional support for victims of intra- and extrafamilial violence, including sexual violence. The police, on their part, also provide victim care services when investigating sexual offences.
Associate Professor Kenneth Goh.
Mr. Speaker, globally, our students from higher socioeconomic status backgrounds tend to perform better academically than students from lower income backgrounds. We have not studied, nor do we plan at this time to study, whether secondary school placement based on PSLE results amplifies this skew, as there are many factors that influence the academic performance of our students. Instead, our focus is to help all students achieve their full potential regardless of background. And this includes providing more support to students from more disadvantaged backgrounds, and also providing porosity in our education pathways, such as through full subject-based banding at the secondary school level to strengthen their education outcomes.
Associate Professor Kenneth Goh.
Thank you, Speaker, and I thank MOS for the response. Given that the SES performance, educational performance gap and the ESCS slope are indicators of educational inequity, and also given this House's commitment to educational equity, especially where we have stated that where you start doesn't determine where you end up in life, would MOE consider tracking and targeting these indicators? And if not, why not? Especially these indicators can give us a sense of whether the measures that have been undertaken by MOE are working. Thank you.
Ms. Law.
I thank the member for his question. We will continue to monitor this trend closely as part of our overall efforts to ensure that all of our students are able to maximize their full potential.
Mr. David Ho.
Thank you, Mr. Speaker. I have two SQs. On social mixing as a leveler, could the ministry share how it is actively strengthening social mixing across different SES within and across schools? And whether do we track the effectiveness of it? That's my first question. The second one is, I would like to check if there's a progress update to my previous PQ where I asked whether MOE will consider a tiebreaker mechanism that gives lower SES background some priority for schools that are oversubscribed.
MOS Law.
I thank the member for his question. I think in response to his first question, yesterday I did explain how our system of posting groups and full subject-based banding now do allow many more of our students to experience social mixing in our schools. Outside of formal curriculum, we also have CCAs and values and action projects that our students can participate in. On the member's second question, we are reviewing. We will also engage the public in our education conversations and update when ready. Thank you.
Associate Professor James Lim.
Speaker, thank you for allowing me to join the debate. While I did not file a PQ on this topic today, I had filed related PQs before and spoke on the issue during this year's budget debate. Now, to follow on from Prof. Goh's PQs, I wonder if the ministry has looked into how much the growing relevance of socioeconomic status may be driven by access to tuition. After all, if a student from a poorer household falls behind in class, they are much less likely to be able to make up for this lost ground with private tuition compared to a family with access to more resources. Relatedly, I recall that when we were going to school, when I was going to school, our teachers would conduct remedial classes for weaker students. May I check how widespread such practice is in schools today, or has it become de-emphasized, perhaps because our teachers are already putting in between 47 to 53 hours a week, around 25% more than their OECD counterparts?
Associate Professor James Lim, actually, you're not entering a debate. You should be asking SQs. But no, I just wanted to make a point that we are not debating about an issue. MOS Law.
I thank the member for his question. MOE does provide additional support to many students with higher educational needs, and we continue to do so in programs, even though the names may have changed from those that we understood and knew when we were students, and those that students experience today. For instance, primary schools do provide very targeted academic intervention for students who need more support to strengthen their foundational skills in reading and literacy and numeracy. And this includes learning support programs, reading remediation programs, and learning support for mathematics. So we want to do this through our schools to ensure that all of our students do have access to support to improve their academic performances. Thank you.
Associate Professor Kenneth Goh, your next question.
Based on our PISA results, Singapore has a steeper slope representing the association between the socio-economic status, SES background, and the performance of our students compared to the OECD average and most other systems. This is because while our students from our lower SES homes as a group performed better than their OECD counterparts with similar SES, our students from higher SES homes outperformed their peers by an even larger margin. This differential gives rise to the steeper slope. One simplistic way to flatten the slope is to stop our higher performing students from doing so well. But that is not educationally sound and goes against our education philosophy of helping all students to develop to their full potential. MOE is committed to uplifting students who need more help without capping the potential of those who can excel. We do so through targeted measures, such as providing additional support to students who come from lower income households or who have higher needs, including school-based after-school programs for students from more challenging home environments.
Associate Professor Kenneth Goh.
Thank you, Speaker, and I thank MOS again for the response. I think one of the concerns is whether the, whether performance, what the ESCS slope implies or suggests is whether performance is driven by income or affected, at least affected by income. I'm not saying that it's caused by income, but whether there's a strong correlation between SES and performance. So it's not about capping potential, but whether or not the folks from higher SES have more opportunities, and because of that, that leads to that increase in academic performance. And my second SQ is related to the one I had asked before, whether or not this is an indicator that MOE will look into tracking, because it can give a sense of whether the measures that have been implemented are working or not. Thanks.
MOS Law.
I thank the member for his question. I think the first question was more of a comment. I didn't really catch the specific question. The first part of it.
Yeah, it's more of a comment about, in response to your point about capping potential of high performance. So by flattening the slope, so you're talking about one way of flattening the slope, which would be lowering the top end. But I don't think that necessarily means depriving people of opportunities. I think what it suggests is that there might be a certain group of people with more opportunities, and because of that, that gives them the chances to do better. And hence, you see that the stronger relationship between SES, or in this case, the ESCS and performance. So it's maybe putting forth a different interpretation of the data, and likewise with that different interpretation, there could be different policy implications as well. So specifically, my question is whether MOE would consider that different interpretation and how that might change policy.
Absolutely. Thank you for the clarification. So yes, we will continue to watch this trend and this indicator closely as part of a suite of overall indicators that we use when assessing the overall educational outcomes for our students. I think on the first comment, my assurance is that we want to make sure that all Singaporean students have as much access to opportunities as possible, regardless of socio-economic statuses. Thank you.
Associate Professor James Lim.
Thank you, Speaker. I'll just reiterate that I agree with the MOS that none of us that argue against early tracking do so because we want to suppress the performance of our top students. However, I'm wondering if she's aware of research by Professors Eric Hanushek and Ludiger Wurzmann. This was published in 2006 in the Economic Journal, that argues that the result of early tracking is that it raises socioeconomic it raises the impact of socioeconomic status on educational inequality, not so much because of allowing those that are high achievers to blossom, but rather by lowering the performance of both groups, even the high achievers, and it lowers the ones of the low achievers even more.
MOS Law.
I don't think I heard a specific question, but if the question is about whether I'm aware of the research, well, after today, I definitely will be. Thank you.
Ms. Yeo Wan Ling.
Also, it's our goal for all Singaporeans to have education, training, or reintegration pathways through life, regardless of when or how they left school. And those who wish to continue their education may approach the school in which they were last enrolled. Alternatively, they can approach MOE's Education and Career Guidance Centre for advice and guidance on suitable education pathways. If they are assessed to be age-appropriate for readmission, they can be enrolled at a secondary school. The receiving schools may assess these students and provide bridging programs to smoothen their transition back into mainstream education. Well, for students who may prefer other education and training options, there are also alternative pathways. So students with minimal academic qualifications can consider the ITE General Education Program, which allows adult learners to obtain their GCE and or O-levels. This in turn then allows them to subsequently enroll in higher NITEC and diploma programs in our institutes of higher learning. Skills Future Singapore also provides subsidies for a wide range of industry-relevant training programs to meet the upskilling needs of Singaporeans throughout their careers, regardless of their education or academic qualifications.
Ms. Yeo.
Mr. Speaker, I thank the Minister for his reply. Could the Minister also share whether there are plans to strengthen early identification and intervention for students at risk of leaving school prematurely, including closer coordination with family and community partners, so that support can be put in place earlier to help them remain engaged in education or to transition more smoothly? I talk about this because I met up with a resident from Punggol whose son was asked to leave school when he was in Sec 3. And because of this, he wasn't able to get any certification. And I think after a year of trying very hard to get into another school, they weren't able to do so. And eventually what they had to do is that they put the son in private tuition. Eventually, after a year, the school did accept him, but after that, he again got suspended. Well, the other thing too, while we're talking about upstream and low stream, is also whether or not the minister could also clarify if the ministry tracks the outcomes of students who leave school before completing their national certifications. In particular, how many have successfully transited into alternative education, like the ones he had pointed out, training or employment pathways, and what additional support is provided to those who struggle to reintegrate. And I think at the end of it all, we just want to make sure that no student is left without a viable pathway.
Acting Minister Teo.
Mr. Speaker, I thank the member for her SQ, and indeed, it is our goal to make sure that all Singaporeans, all students, have good pathways through life. And I think spoke about early upstream intervention. So, yes, indeed, we do early upstream intervention. We do it in schools. And really what we want to do is to strengthen at-risk students' engagement and a sense of certain connectedness to the school. And in fact, once any of our students show any signs of disengagement, they are individually tracked and they are supported. And form teachers and school counselors reach out to our students to understand and to address any of these challenges. A lot of this, like the member pointed out, could be issues at home and otherwise, and every effort is made to counsel and to dissuade these at-risk students from dropping out of school, including engaging their parents to provide a more holistic support. And also to strengthen at-risk students' motivation and a sense of connectedness to school, MOE also provides resources and guidance for schools to create a supportive school environment and also provide a conducive after-school support for the students. And this is usually done in collaboration with many community partners. And depending on their needs, students are also referred to school-based programs where they can be engaged through befriending or mentoring by community partners and volunteers, as well as interest-based activities that build peer support and relationships, which can help improve their social-emotional connectedness. So schools also work very closely with community partners and government agencies such as MSFs, Comlink Plus, self-help groups, social service agencies to provide some of these upstream wraparound support for the at-risk students. And I'm sure the member, also being a very good grassroots advisor, would also have some of these programs for at-risk youths in her constituency, as I do have in Tampines as well. So there's a huge network of youth and social support programs, but in broad, MOE focuses also on that wraparound support for our students to make sure they have a holistic and also very importantly, a good home care environment to prevent dropping out of school. Now to the member's question about tracking outcomes, today MOE tracks outcomes of students, but once they kind of are not in the school education system anymore, we do not track those further, but as part of our manpower statistics, as part of what Skills Future Singapore and Workforce Singapore is doing, we do have some of the other indicators. But as a whole, I think what we do want to do is to make use of a combination of these indicators to make sure that we have all the appropriate programs to really help all Singaporeans continue to upgrade in life.
Dr. Harish Singaraja.
Mr. Speaker, I thank the member for acknowledging SCF's established mental health support system in its PQ, in how we support full-time national servicemen with mental health needs. To recap, then Senior Minister of State for Defence, Mr. Heng Chee Hao, had provided a description of the SCF's mental health support system in his response to parliamentary questions from Mr. Desmond Chu and Dr. Wan Rizal on 7 March 2024. The member can refer to that reply as background info. To the member's question, in addition to the SCF's mental health support systems, the SCF has measures to support NSFs who face psychosocial stressors that may impact their mental health. These NSFs are identified through various touchpoints during their service, such as the basic military training, through surveys and regular commander interviews. When needed, their commanders will provide them with support or refer them to relevant services. So these include the SCF's financial assistance schemes, counselling, as well as rehabilitation services. We recognize that NSFs with psychosocial needs may benefit from the larger social support system. The SCF collaborates with partners on additional avenues of support where appropriate. For example, it works with the Ministry of social and family development social service officers, and the community network of family service centers to help those with added needs. So doing so ensures the continuity of support for NSFs after they complete national service. So we encourage NSFs who require assistance to reach out to their commanders, the SAF Mental Health Office, or the SAF Counselling Hotline. Thank you, Mr. Speaker.
Dr. Harish Singarajo.
Thank you for the reply. I have two SQs, one from the perspective of a public healthcare doctor and another from an SAF medical officer or commander. At this juncture, many NS men who do see us in public healthcare do raise concerns in terms of the social strains they face during these times. And we are aware of social partners that can offer such helps. I wonder if we can strengthen the communication between public healthcare and that of the SAF during the NS times, such that we can inform the commanders that these are gaps that the NS men are facing, and therefore the kind of avenues that we can refer these NS men to. And on the other front, as an SAF medical officer, commander, I recognize that there are avenues to support these NS men in terms of the various social issues they present with. But is such education provided during the commander training or even during the medical officer courses such that once we recognize these psychosocial stressors in terms of who we can refer to within the SAF as well as externally? Because from my understanding, currently it is not in the curriculum. Thank you.
SMB Zaki.
Thank you. On the first one, certainly we welcome that, because today with MSF and the social service officers, MINDEF is piloting Case Connect, where there is direct link between our officers or medical health professionals as well as SSO in terms of being able to manage cases jointly. So that's under pilot, but certainly I'll take it back to MINDEF to study how we can also integrate better with the public health system. So for professionals like yourselves who can also provide feedback back into the system. On the second one, let me check on this one, because generally most of our commanders, the unit commanders who oversee our troops, NSFs, for example, are trained, and they do have schemes and mechanisms to support our NSFs, whether they have financial services, financial assistance requirements, or whether there are external things that they may need, rehabilitation services, counseling, family issues. So we understand that there are different stressors, so which the unit commanders are charged to look after, and they have access to such schemes too. However, I think one possibility is for the mental health professionals to also feed back to the unit. But I take your point. Let's see how we can integrate this better and see how we can work this through in a more efficient way. Thank you.
Ms. Kozuki.
Question 12, please.
Mr. Speaker, sir, can I have your permission to answer questions 12 to 14 together on today's order paper?
Please go ahead.
Sir, there are existing safeguards for gyro. Customers can set transaction limits on their gyro payments, and banks also apply due diligence checks on gyro billing organizations. These include checking that they are properly registered businesses and are not linked to any sanctioned or other criminal activities. However, checks by banks may not always be able to prevent errors and potential misuse of gyro. While such cases have been uncommon so far, we agree that the safeguards should be strengthened. MAS is working with the Association of Banks in Singapore and member banks to strengthen these safeguards. The review will consider measures including enabling customers to set monthly limits on the value and number of transactions, and enhancing transaction monitoring and due diligence on billing organizations. We will also consider suggestions by Ms. Gosuki, Mr. Melvin Yong, and Mr. Sean Low, and members of the public. We also advise consumers to review their current gyro arrangements and to set appropriate transaction limits with their banks and financial institutions. There are also other non-gyro payment options available to customers, including standing instructions to the bank for recurring monthly payments for an amount set by the customer.
Ms. Goh?
I have one excuse. So in the United Kingdom, the BACS system, which stands for the Bankers Automated Clearing Services, operates a widely used direct debit scheme that includes advance notice of payment amounts, a direct debit guarantee allowing for immediate refunds in case of error, and strong consumer recourse mechanisms. So in light of these established safeguards in other countries, could MOS clarify whether Singapore's review of the gyro framework will move towards incorporating such similar features? Thank you.
MOS Tan?
So I thank Ms. Gosuki for her suggestion, and indeed we will look into her suggestion and others as well. I would say also that now some of the banks have, for example, gyro on demand, which allows where each deduction must be authorized individually before the bank processes the transaction. So different banks have different ways of which to either implement safeguards or have different safeguards, but we will look into that suggestion. We'll look into also setting monthly limits for transaction amounts and also the value of transactions, and then also to enhance monitoring of transactions as well. Thank you.
Mr. Sean Low?
Thank you, Mr. Speaker. I thank the MOS for the update. I'm very heartened to hear it that MAS has agreed to do a review because the current level of consumer protections are not adequate. I have two questions. The first one is, how long will this review take? And my second question is, while the review is ongoing, can the MAS also increase public awareness of the protections offered to consumers as well as its limitations? So today, you can only set a limit per transaction, but consumers are not protected because agencies or organizations can have multiple deductions within that transaction limit. So can public awareness be increased prior to the review being completed? Thank you.
MOS Tan?
So indeed, MAS will work with the banks as well as financial institutions to raise awareness and public awareness of these. And the review, we will start with lower-hanging fruits. Some of these may be affected in the short term, but major enhancements which involve system changes will need some time to be developed, tested, and implemented. But we accept and we will take his views into account. Thank you.
Mr. Melvin Yong?
So I thank the MOS for his reply, and we are heartened, and the Consumer Association of Singapore will be happy to work with MAS on consumer protection measures. For consumers, we often use gyro when we want to so-called set and forget recurring payments. And therefore, we acknowledge that while there's convenience of using gyro, it also comes with trade-off, including the possibility of fraud. And many consumers regard gyro as a secure and convenient means of payment, and therefore we must put in place the necessary safeguards. So I want to ask whether there are existing thresholds or guidelines for banks to therefore flag anomalous gyro deduction patterns, and if not, whether MAS intends to introduce such standards for the banks, because when we do gyro, we forget about it, and we expect that the banks protect us by monitoring certain patterns.
MOS Tan?
So I thank Case Chairman and Member Mr. Melvin Yong for working with MAS to also raise awareness about the use of gyro. As he mentioned earlier on, gyro has its uses. For example, if you were to pay your monthly electricity bills, this affords convenience because the bills will fluctuate from month to month. But there are also some downsides, and that's why this review will take into account what he, Ms. Goh, and Mr. Sean has suggested. And that includes also enhanced monitoring of transactions as well. Thank you.
Ms. Yeo Wan Ling?
Mr. Speaker, this
question for oral answer has been addressed by written reply to question 97 on the order paper for 7 of April 2026.
Ms. Yeo.
Mr. Speaker, thank you, SPS, for the reply. Could the Ministry elaborate how the government ensures that platform operators have clearer responsibilities to their workers in such situations, particularly in terms of data transparency and workers' communication, so that our workers can receive timely information on changes that will affect their livelihoods, and so that they can make informed decisions early? And also, in light of such exits, could the Ministry also clarify whether there are plans to put in place a more structured framework, including coordinated support across agencies and industries? I recall for this particular case, we had our SMMW as well as the NDCA from the NTUC coming in, but I do think, right, that it would be good to have better coordination so that there will be proactive measures to support our affected workers to alternative platforms or jobs. And how do we ensure that the workers do not face prolonged income disruption as well as hardship, and what kind of supports that we have for them during this transition?
SPS Wong.
I thank the member for her 2 supplementary questions. In fact, to share more, platform operators and platform work associations should continue their bilateral discussions on the information that can be provided to workers. And this has been done before, especially on the transparency of earnings, etc. And to better guide these discussions, in fact, NTUC has led many of these discussions, for example, with platform work associations, major platform operators, to agree on a set of industry-wide and accepted principles in terms of payment and incentive structures. Some of these things were discussed, for example, fair earnings, visibility on structural changes, incentive schemes, and these were actually announced on 11th of September 2025 by NTUC. So I encourage NTUC to continue with these discussions and use these platforms to do it collaboratively. On the second SQ, in this particular case, I want to share that the food delivery operator had really worked closely with WSG and also NTUC E2I to step in to offer job matching capabilities and also career coaching in times of need. The platform operator also worked, like what you've mentioned, the Singapore Manual and Mercantile Workers Association and the National Delivery Champions Association to facilitate their outreach and transition. And I thank the associations for stepping up and working collaboratively with NTUC on this. In addition, there will always be disruptions when there is transitions, and the platform associations together with NTUC should continue to help. There are schemes out there in terms of, for example, if a platform worker would like to continue to transition to full-time employment or to a different platform, they can always approach WSG with a suite of capabilities, SkillsFuture, as well as the CCPs as well. For platform workers who are of low wages, can also approach their SSOs to help with financial assistance. Thank you.
Mr. Melvin Yong.
Mismatches in the labor market may be driven by shifts in skill requirements. For example, firms are expanding technology functions, driving sustained demand for jobs, like AI engineers and engineering professionals, while restructuring other PMET roles that have become easier to automate. Retrenched PMETs may lack the specific technical skills and experience to fulfill requirements in-demand engineering and technology specialist jobs.
Mr. Yong.
So I'd like to ask the SPS, have we done a study on the profile of those who have been retrenched, the PMETs, and also what are the type of jobs that the market is looking for, and whether the ministry has any plans to improve our job matching and reskilling interventions so that we can better align displaced PMETs with available roles in these new areas, engineering and technology. And how does the ministry then assess the effectiveness of such efforts to date if they already exist?
SPS Wong.
I thank the member for the two SQs. In fact, to better understand the hiring landscape today, actually the hiring demand for PMETs remains higher than the number of PMET retrenchments. And many of the in-demand PMET jobs are actually in finance and infocom. As of December 2025, two sectors with PMET vacancies of 4,100 and also 5,300 respectively. In fact, comparatively, there are only 960 PMET retrenchments across both sectors for the last quarter of 2025. And in these particular sectors, the PMET retrenchments actually remain low relative to entire workforce size, and there remains ample opportunities available. To that point, the government will always continue to provide support for workers to upskill and reskill into these roles. In fact, for your second point, is that actually for Workforce Singapore, WSG, for the CCPs, which is the career conversion programs, we actually support workers to reskill into growth jobs and into longer-term prospects by provision of salary support to the employees. In fact, over the last 3 years, we have placed over 7,300 workers into tech and engineering-related jobs through these CCPs. So I encourage them to take it up. Thank you.
Dr. Neo Kok Beng.
Well, thank you, sir. I would like to ask, in the case of the professional conversion program, especially for engineers and technologists who are retrenched, is it possible for WSSG, the proposed WSSG, to actually work with professional institutions to design programs that are directly relevant to the industry rather than take up courses that are designed by maybe the universities or the polytechnics? Thank you, sir.
SPS Wong.
I thank the member for, sorry, can the member repeat the question, please?
Yeah, my question simply means that whether the ministry or WSSG will consider developing or working with professional institutions for that particular professions or trade to develop programs that are relevant directly to the industries, or rather than actually looking at programs that are developed by the universities or the other academic institutions. Thanks.
SPS Wong.
Yeah, I thank the member for the question. The answer is yes. In fact, WSSG does work very closely with the IHLs to make sure that these courses are industry relevant, especially for the professional societies as well. Thank you.
Ms. Polisan.
In 2025, about 30% of BTO blocks were completed earlier than their estimated completion dates at the point of flat booking. On average, these blocks were completed about 2 months earlier. To assist the buyers with their planning and housing arrangements, HDB notifies them at 3 junctures: 1 year before, 6 months before, and 3 months before the expected completion of their flat. These include any updates to their flat's probable completion date, and the latest probable completion date is also available to buyers when they log into their accounts on the My HDB page. When their flats are ready, buyers are required to collect their keys and pay the balance flat price within a month. Those who face difficulties due to early completions can approach HDB for assistance. HDB may provide key collection deferrals to buyers who need additional time to sell their existing flat or work out their financing arrangements. Thank you.
Ms. Paul.
Thank you, Speaker, and thank you, SMS, for your reply. I have a SQ on such an arrangement for existing flat owners who are require back-to-back sale of their existing homes to finance the BTOs. So if there's an earlier than expected BTO readiness, they do not have sufficient time to sell the flat, especially in the down cycle market. Will HDB further extend beyond the usual 6 months period to allow them a bit more time to do so.
SMS soon.
I thank the member for her question. Earlier, I mentioned in my reply that the HDB notifies buyers at 3 junctures. This is to give buyers adequate time to plan. And that's why it's at the 1 year before, 6 months before, and 3 months before. So this is to give them adequate time to plan for what they should do with their previous flat, their existing flat, as you mentioned. But in situations where they are really in financial difficulty and not able to match the back-to-back arrangements, HDB will step in to see how they can facilitate the arrangements so that both the buyers and the sellers, in this instance, can find an acceptable arrangement that works for the both of them. Thank you.
Mr. Gerald Gill.
Question 18, please.
Mr. Speaker, insider threats are just one of a multitude of threats facing our critical information infrastructure, or CIIs. Under the Cybersecurity Act, owners of CIIs are required to put in place access management controls and processes to monitor for anomalies and suspicious activities in these systems. Upon detection of any unauthorized activity, CII owners are required to investigate such anomalies. These controls mitigate potential insider threats or any other threats. The government takes the cybersecurity of our CIIs very seriously. We will continue to review the standards we require and consider further enhancements that could be effective.
Mr. Gill.
I thank the Minister for the reply. I'm asking more in terms of dealing with the issue upstream in terms of vetting personnel. And given that many technical experts in our telco and energy sectors are foreign nationals, what specific assistance does CSA provide to private CII owners to verify the backgrounds of such individuals? And could the Ministry introduce a tiered vetting system where personnel with super user or administrator access rights to our sensitive core areas of our CII must undergo government-led G50 security clearance, just like public servants and vendors who access our government systems?
Minister Teo.
Mr. Speaker, if we are serious about mitigating against insider threats, we should not assume that any particular profile of someone who is able to access the system is more or less likely to commit nefarious activities. So I think the first point I want to put across, you don't want to have a preconceived idea that this profile would necessarily be safer than another profile. If you want to be able to defend against as many insider threats as possible, you have to assume that every single one that has access to the system, every single person that has access to the system could pose an insider threat. So that's the first thing. Second, we also don't assume that security vetting is a silver bullet. If a nefarious actor is determined to infiltrate the system, and they know that there is a vetting process of some sort, then clearly it would be an effort on their part to overcome whatever it is that would stand in the way of them clearing a vetting system. So a vetting system is also not a silver bullet. Thirdly, I should just say that in cybersecurity, today we operate with the concept of zero trust, meaning that you decide in terms of how you architect the access controls, and you provide what is known as least privileged access, meaning for every single one who has access to the system, you design the access controls in such a way that they only access what they're supposed to access in order to get the job done. And then you need to put in place a robust system so that you never trust, you always verify whether a user is accessing the part of the system that they should access. Then you need a system to monitor. You need to look at suspicious behavior, whether there was a user that attempted to go beyond the access privileges that were granted. And you're very careful about who you provide more access control to. So I think that is the approach that we take, rather than to over-rely and to think that just because upfront, upstream, we have done security vetting, these other controls are not as important, or since they have cleared vetting, then it is safe. We don't make that sort of an assumption. And security by design means that you have all these multiple layers of defenses in order to be able to guard against the cyber risk.
Mr. Giam.
I thank the Minister for her reply. I agree that we should not assume any of these things, and we should not assume that just because someone is security cleared, therefore they are safe to continue using the systems. But in this age of cybersecurity threats and APTs, should we not consider that aligning the security clearance of our CII personnel, especially those with access to sensitive systems, with public servants, because all public servants have to go through this standard security vetting? Why not extend that to CII personnel as well?
Minister Teo.
Mr. Speaker, I think I addressed the member's question, which is that where it is useful and relevant to do so for certain types of cybersecurity accesses, yes, we do have, measures in place to ensure that the persons accessing them fit the right, conditions. Then we have no concerns about that. But we don't publicly reveal all the requirements that we put in place, and that's for obvious security reasons. Because if it was so plain, if you state it so clearly that there is this particular process, and once you clear it, that's it, then that becomes the easiest thing to overcome. So I take the member's point. It is not the case that there is no vetting. It depends on what the activity we're talking about is.
Ms. Gozuki.
Question 19, please.
The National Arts Council, NAC, champions Singapore's arts sector and recognizes that arts infrastructure is key to the development of a vibrant arts ecosystem. In Landscape Singapore, NAC works closely with government agencies and private sector players to unlock and diversify arts spaces. Today, the total arts gross floor area tracked by NAC currently stands at 94,000 square meters, which is a 42% increase since 2010. Affordable workspaces are also key to ensuring our artists and arts groups remain financially sustainable. To support our arts sector, NAC provides such spaces at rates below commercial rental rate. Let me say it again. To support our arts sector, NAC provides such spaces at rates below commercial rental levels. In considering the need for any rates adjustment, NAC takes into account rising operation costs for the maintenance of these spaces and the need to ensure that the revised rates remain affordable compared to other commercial spaces in the vicinity and other arts spaces. Goodman Arts Centre, or GAC, provides a total of 77 units across both short-term venues and longer-term housing options. These include 26 project studios for flexible short-term tenancies of up to 12 months for artists who have project-specific needs, and 51 units under the Framework for Art Spaces scheme, which supports arts groups up to 9 years and is subvented by NAC at up to 80%. The rental rates for project studios were last reviewed in 2012, and Arts House Group, or AHG, the appointed operator for GAC, has absorbed rising operational costs since then. Although AHG had begun to engage arts tenants on the rate increase for greater sustainability, it will defer rate increases in 2026 to support arts tenants during this period of heightened economic uncertainty arising from the conflict in the Middle East. NAC and AHG will review the rates at the end of this year for 2027. In parallel, NAC is studying the sector's longer-term needs and has been engaging and consulting the arts sector on their spatial needs and affordability of art spaces. In planning for the future, NAC will take steps to ensure that art spaces remain accessible and affordable for artists and arts groups. NAC also supports artists and arts groups through existing grants such as the Creation Grant, Presentation and Participation Grant, which funds the creation, production, and presentation costs of our artists and arts groups. Thank you.
Ms. Goh.
Sir, Mr. Speaker, so I note that the premises at the Goodman Arts Centre are ultimately government-owned and leased to the Arts House Group, a non-profit under the National Arts Council, which also operates other arts places such as the Aliwal Arts Centre and the Stamford Arts Centre. Given this, I'd just like to ask, for the other centres, are there that are facing similar costs, pressures or viability challenges? And if so, whether there is a broader review underway to ensure that such government-supported creative spaces remain affordable and sustainable for arts practitioners over the long term. Thank you.
MOSB.
I thank Ms. Goh for her concern of the arts groups and artists. Indeed, it's part of our commitment to provide affordable and accessible spaces for artists and arts groups. We have announced last year that we are doing a study on how the art spaces provision can be better improved. And the study is ongoing, and we will be sharing the findings and recommendations when we are ready. Thank you.
Mr. Chang Tso.
Mr. Speaker, MSF reviews the ComCare per capita household income benchmark regularly. The current gross monthly per capita household income benchmark of $800 and below is an indicative benchmark and not a qualifying criterion. Families who are above the benchmark but have valid needs may still be assisted with ComCare on a case-by-case basis. The ComCare assistance rates are also regularly adjusted to ensure adequate support. The ComCare short to medium-term assistance quantum accounts for projected inflation. For cost of living concerns, there is also support in other forms, such as the assurance package, which has been enhanced with additional cash, USAVE, SNCC rebates, and CDC vouchers over the years. MSF is monitoring the situation closely on how the low-income families are being impacted by the current economic situations and conditions. We are prepared to make adjustments as needed.
Mr. Tsai.
I thank the MOS for the clarification. My SQ is similar to the $200 cash disbursement for platform workers to cushion rising fuel prices. Can we also consider some immediate stopgap disbursement for ComCare recipients, especially those with young children who have very little buffers to begin with? Thank you.
M.S. Sukanian.
Mr. Speaker, I thank the member for the SQ. Now, our reviews take into consideration data on expenditure for basic living needs, projected inflation, and also views from social service professionals who work closely with our low-income families. The benchmark itself is not a criterion, but that automatically qualifies or disqualifies a household from ComCare. It approximates the gross monthly income at which households may qualify for assistance. As mentioned in yesterday's clarification by my colleague, Minister of State Goh Pei Ming, yesterday during the ministerial statement relating to the Middle East conflict, it was clarified that ComCare PCHI benchmark was reviewed only a year ago, and MSF had already factored in some inflation assumptions that the threshold is still within the buffer. Now, besides this, there are also other general support for and measures announced yesterday as well to provide enhanced support for Singaporean families, not just the lower income households. For example, CDC vouchers of $500 will be brought forward to June 2026. The cost of living special payment has also been enhanced, and eligible Singaporeans can receive up to $400 to $600 in September 2026. And for families who are on ComLink Plus, they are also eligible for the enhanced payout measures that have already been announced in this year's budget and COS as well.
Ms. Mariam Jaffa.
Vacancy rates for HDB rental shops have remained low and stable over the past 5 years. Some amount of churn is healthy as it allows less competitive businesses to exit and new businesses to enter, which provide products and services that can better meet the needs of residents. HDB uses trade mix controls for HDB rental shops to ensure a good variety of shops to serve residents. When there are vacancies, HDB will assess the trade designation and tender them out as soon as possible. Thank you.
Ms. Haslina Abdul Halim.
Question 22, please, sir.
Speaker, may I have your permission to answer questions 22, 23, and 24?
Please proceed.
Today, the government publishes lists of individuals and entities for specific purposes related to national security. For example, certain foreign organizations designated as terrorist entities are listed in the first schedule to the Terrorism Suppression of Financing Act, or TSOFA. There are no plans to make public a broader list of foreign organizations that may pose concerns to Singapore's national security. Such a list may give rise to operational and security risks. Regular publicity and outreach efforts are conducted to raise public awareness of security threats, including from foreign organizations of concern such as foreign terrorist groups. We have also publicly stated that Singaporeans should not participate in foreign armed conflicts and should exercise particular care in dealing with organizations with links to foreign militaries or foreign security and intelligence agencies. There are also restrictions and responsibilities under various statutes, such as the Foreign Interference Countermeasures Act, in relation to membership in a foreign legislature or foreign political organization, or the United Nations Act, which includes prohibitions against providing technical advice, assistance, or training to designated foreign persons, entities, and organizations. Where necessary, the government will issue travel advisories on overseas developments that may have security implications. Singaporeans should exercise due diligence and err on the side of caution when in doubt. It is ultimately every individual's responsibility to ensure that they comply with our laws and not act in a manner prejudicial to Singapore's national interest.
Ms. Haslina.
I thank the SMS for the clarification. There were a lot of interest with regards to the two individuals who were found to be volunteering with an Israeli-linked military or rather Israeli military-linked organization. That points to the interest and the requirement for increased awareness. SMS earlier talked about awareness campaigns. Could we have a bit more color and a bit more sharing on the partnerships, whether it's an interagency approach, whether it's an approach with community organizations or going upstream to schools, so that this awareness can go upstream, and it is with clarity that we understand while we are looking for international experiences, that national security is always a key concern. Thank you.
SMS.
So we have a national movement to prepare Singaporeans against terrorism, SG Secure. And this is one way through which we disseminate important information so that Singaporeans are aware of security risks. Also, when there are cases that the member, Ms. Haslina, has raised, we have also amplified existing messages through the media. And ultimately, it is very important for Singaporeans to have a good grasp of what our national interests are. And this is something that we have discussed repeatedly in this House.
Mr. Dennis Tan.
Question 25, sir.
The Early Childhood Development Agency, or ACDA, funds both early intervention programs for infants and children, EPIC, delivered by social service agencies, and EPIC-P, delivered by appointed private providers. Means-tested fee caps are established to ensure that operators provide quality services at an affordable fee. A median income family pays up to $210 a month for EPIC and $360 a month for EPIC-P. Both EPIC and EPIC-P programs are delivered by a transdisciplinary team of professionals, including EI educators, speech and language therapists, occupational therapists, psychologists, and social workers. Under these programs, each child, including those with a confirmed or suspected autism diagnosis, has an individualized education plan tailored to their developmental needs and goals. This plan is developed and regularly reviewed by EI professionals in consultation with allied health professionals and families. Enrolled children typically receive 5 to 12 hours of intervention conducted over 2 or 3 sessions every week, with the frequency and duration of the sessions tailored according to the level of support the child needs. Families may consult their EI professionals on their child's individualized education plan to address the needs of the child. Parents who wish to seek supplementary intervention beyond those provided under EPIC or EPIC-P may also tap on the child development account to pay for additional EI services by EI providers registered with ACDA.
Mr. Tan.
Thank you, Speaker. I thank the MOS for his reply. Would the Ministry consider a tiered co-payment model for private providers, similar to the EPIC-P scheme, where middle-income families can pay a regulated rate for a fixed number of additional private therapy hours to supplement their child's public intervention? 2, given that EPIC typically offers only 2 to 4 hours intervention weekly, many children may require additional private sessions. Will the Ministry consider allowing the use of the Child Development Account funds for a wider range of accredited private therapies without depleting the basic EPIC subsidy? Thank you.
MS, go.
Mr. Speaker, I thank the member for his question. Actually, I think there are 2 parts to his question. I think first, in terms of private providers, I think from ACDA's perspective, we strongly recommend that parents go with the list of service providers registered with ACDA. I think this is also the government's way of regulating services and controlling costs. So I think that's the first point. And if there are gaps within the list provided by ACDA, based on what the member has gotten feedback from, we'll be open to reviewing it. But based on what we know, the list of service providers under ACDA's list is comprehensive, and we stand guided by what the member has to feedback. Based on the number of hours that each child receives in terms of early intervention, it is based on what, like I mentioned earlier, the EI professionals meeting together with the families, taking into account all the professionals' inputs to deliver an individualized plan. And based on that plan, there's a certain guideline in terms of how many hours and what's the frequency of the dosage of treatment. And I think that is what the professionals deem as required. Of course, sometimes parents may choose to do even more, but that is not what the professionals will say are cardinal, and therefore, if parents choose to use additional sessions, they can use the CDA accounts to pay for those. But what the individualized plan recommends is the required dosage based on the professionals' input, and based on the list of providers that ACDA has engaged, all services, all specialized services that are required will be fulfilled through that list and will be catered under the individualized plan.
SPS Wong, you have a clarification to make?
Thank you, Mr. Speaker. Regards to my PQ16, I'd just like to clarify that career conversion programs provide salary support to employers. Thank you.
Order, end of question time. Clarification by Coordinating Minister for National Security and Minister for Home Affairs.
I would like to make a clarification in relation to a written answer that was made on the 3rd of February 2026. In response to a parliamentary question filed by Ms. Valerie Lee on the number of traffic accidents linked to vape or drug abuse, I said in our response that between 2023 and 2025, 77 accidents were suspected drug and/or etomidate use, and that 25 of these were suspected of drug use. The remainder were suspected of etomidate use, and 2 of these cases included suspected drug use. So I would like to clarify for the record that 38 traffic accidents were linked to drug and/or etomidate use, 19 were drug cases, 12 were etomidate cases, and 7 involved both drugs and etomidate. Thank you, sir.
Order. Introduction of government bills. Minister for Manpower.
Mr. Speaker, on behalf of the Minister for Manpower, I introduce a bill entitled An Act to Establish the Skills and Workforce Development Agency to repeal the Skills Future Singapore Agency Act 2016 and the Workforce Singapore Agency Act 2003, and to make consequential and related amendments to certain other acts.
Skills and Workforce Development Agency Bill.
Second reading, what day?
At the next available sitting.
So be it. Order, the clerk will now proceed to read the orders of the day.
Item 1, resumption of debate on the second reading of the Energy Conservation Bill.
The question is that the bill be now read a second time. Mr. Yip Hong Wing.
Mr. Speaker, sir, today as we debate the bill, the world is being reminded of how fragile energy security is. With the escalating war in the Middle East threatening the Straits of Hormuz, a lifeline for nearly 1/5 of global oil, volatile markets and rising prices are not distant news. They are immediate reality. We cannot control global supply, but we can control our dependence on it. As Chair of the Defence and Foreign Affairs GPC, I see energy security as inseparable from national security. Conservation is no longer just climate policy. It is essential cost of living and economic policy. Every watt we save is a watt we do not have to import for. I support this bill because it closes a critical gap. Today, our minimum energy performance standards and mandatory energy labelling scheme apply only to local suppliers, leaving goods imported directly for one's own use unregulated. A gap in policy becomes a liability in crisis. It allows inefficient equipment to be locked into our system and lets those who bypass the rules undercut compliant businesses. Even if direct imports are less than 10% today, we must close this gap before it grows. What we allow into our system today determines the bills we pay tomorrow. The principles of this bill is sound, but its success depends on implementation. To ensure it works fairly and affordably on the ground, I have 4 areas of clarification. First, Mr. Speaker, sir, affordability. We know that energy-efficient products are cheaper over time. A commercial refrigerator can have life cycle costs about 30% lower than a non-compliant one. However, most energy-efficient products come with a premium. Households and SMEs do not live in life cycle calculations. They live with immediate budgets and cash flow constraints. Are we doing enough to help households and businesses bridge the gap between higher upfront costs and lower long-term savings? Are existing schemes such as the Climate-Friendly Household Program, the Energy Efficiency Grant, the Resource Efficiency Grant sufficient for those most affected? If direct imports are currently less than 10%, what is the projected cost impact on households and SMEs when these amendments take effect? Will compliant models remain competitively priced, or will a persistent green premium emerge? How will the Ministry ensure that grants and subsidies remain responsive to market price fluctuations so that no household or SMEs is left behind? The right choice must also be the affordable choice. Second, Mr. Speaker, sir, consumer protection in the digital marketplace. The bill empowers the government to regulate online advertisements, require energy efficiency information, and take down non-compliant listings. Will enforcement be proactive rather than reactive? Will platforms be required to screen listings before they appear, rather than only remove them after a breach is reported? Will consumers have a simple and accessible way to verify whether a product is compliant before making a purchase? If a non-compliant listing is removed after payment has been made, what protections will consumers have? Will marketplace operators be required to facilitate refunds or stop deliveries? How will responsibility be allocated amongst marketplace operators, sellers, and importers? Consumer protection must begin before checkout, not after complaints. Third, Mr. Speaker, sir, implementation and transition. The transition timeline is short. 3 months may not be sufficient for households amidst renovation, SMEs amidst procurement, or businesses with goods already in transit. With the new requirements, importers must register goods, maintain records, and potentially provide samples for testing. How onerous will these compliance requirements be, particularly for individuals and SMEs importing for their own use? If compliance is too complex, compliance will fail. Fourth, Mr. Speaker, sir, transparency and proportionality. The bill grants the Director General the power to impose, modify, or revoke conditions even after registration. What principles will guide the exercise of these powers, and will they be clearly communicated to businesses? Why do such decisions take effect immediately even when an appeal is filed? As new offences are introduced, including cases where goods are later used in ways that would have made the original import non-compliant, how will the government distinguish between deliberate circumvention and genuine misunderstanding? Will the Ministry provide regular reporting to Parliament on waivers granted, appeals outcomes, and enforcement trends? Strong powers must come with strong accountability. In conclusion, Mr. Speaker, sir, this bill is necessary but insufficient because energy conservation does not begin and end with regulation. The International Energy Agency has outlined practical measures to reduce demand quickly, including working from home, reducing unnecessary travel, improving driving efficiency, and encouraging public transport use. The cheapest energy is the energy that we do not use. So we must go further. Will the public sector lead the way by institutionalizing air conditioning temperature standards across government buildings? Are we promoting operational efficiency across our fleets and industries, such as incentivizing eco-driving certifications for commercial fleets? Does the ministry have a playbook for temporary targeted conservation measures, such as remote work arrangements or speed limit adjustments should supply disruptions worsen? Because energy security is built not just by policy, but by behavior, incentives, and collective discipline. We began this speech with a world in crisis where conflict far beyond our shores can disrupt something as fundamental as energy. We cannot control that conflict. We cannot control global prices. We cannot control supply shocks, but we can control how we respond. Today, I asked 4 things: whether this bill will remain affordable, whether consumers will be protected in the digital marketplace, whether implementation will be fair during transition, and whether enforcement powers will be exercised transparently. I've also suggested that beyond regulation, we must act decisively to reduce demand and strengthen efficiency. Because if we get this right, energy conservation will not feel like a burden. It will feel like relief. Relief from rising costs, uncertainty, and vulnerability. And let us be reminded that this is not just an energy policy. It's a test of how we prepare Singapore for an uncertain world. Because in a world that we cannot control, the strength of Singapore will depend on what we choose to control, what we choose to conserve, and what we choose to secure. Mr. Speaker, sir, I support the bill. Thank you.
Mr. Pu Zhexiang.
Mr. Speaker, in today's world, the case for energy conservation could not be stronger. Many of us are familiar with the minimum energy performance standards as well as the mandatory energy labeling schemes. They facilitate choices towards more energy efficient appliances such as refrigerators, televisions, and air conditioners. This bill seeks to extend the MEPS and MELS requirements to importers of regulated goods such as the appliances I mentioned earlier, including for those for own usage. This will ensure consistent application of the requirements while also not overly restricting consumer choices. I would like to raise a few points and seek clarifications from the SMS. First, I would like to highlight 2 clauses in the bill. Clause 7 amends the Energy Conservation Act to require an importer of regulated goods for their own use to register the regulated good, even if another importer has already so registered the regulated good. Can the Minister clarify why this is required? Is the intent to keep track of the identity and the number of importers of these specific regulated goods, even if it has already been registered by another importer? Regardless, would the agency consider a more streamlined approach for subsequent importers of already registered regulated goods? For example, can the agency update the specific model or type of regulated good in its database of registered goods for general awareness that it has been registered and waive certain requirements for subsequent importers, such as the requirement to provide test reports, ISO certifications, and etc., which would already have been provided by the original importer? This will reduce the regulatory burden for subsequent importers. Next, Clause 12 of the bill amends the ECA such that the Director General may require an individual importer of regulated goods for their own use to provide free of charge samples to the Director General for the purpose of testing or analysis and any other document that the DG requires. Now, it is quite likely that for importers who are importing for their own use to only import one piece of the good. So it could perhaps be challenging for them to provide free of charge samples to the DG for the purposes of testing and analysis. So I seek a clarification again on the need for this. Next, I would like to highlight 2 points in relation to the implementation of the amendments in the bill. First, the extension of the MEPS and MELS requirements to importers will likely rely on existing processes for the registration of the regulated goods. However, the existing processes, as I understand, are designed for suppliers, retailers, importers and manufacturers that supply or sell regulated goods. These are typically companies or businesses. It is important, therefore, that the registration processes be modified or streamlined to be relevant for individual importers, including individuals or households that do the same. For example, the current ELS portal for registration relies on COPPAS, which are for businesses and companies. It may also need to be adapted to allow for the use of SingPass for individual importers. Second, the application for the registration of regulated goods involves fees that are chargeable between $70 to $85 depending on the type of regulated good. I urge the agency to consider whether these charges for individual importers can be waived or whether there can be a tiered registration system. Mr. Speaker, notwithstanding my clarifications, I support the bill. Thank you.
SMS Channel.
Mr. Speaker, I'd like to thank members for their support, their questions, their comments on the bill. All the members who had spoken had indicated their support for the bill and its intent to extend the minimum energy performance standards, the MEPS, and the mandatory energy labeling scheme, MELS, to regulated goods imported by end users for own use. In answering their questions and comments, I'd like to begin by clarifying that only certain common appliances, such as air conditioners and refrigerators, are covered under the ECA and this bill. As mentioned in my opening speech, equipment such as EV chargers are not currently covered under the ECA. NEA's website has a list of regulated goods. The volume of regulated goods imported for own use is small for now. And especially if you consider appliances such as air conditioners and refrigerators. The concern is that this could increase over time, given the proliferation of online marketplaces, making it easier for consumers to import such regulated goods for their own use. We've also noticed that some businesses are also directly importing regulated goods, such as commercial storage refrigerators for their own use. And so that is part of the need to introduce the Energy Conservation Amendment Bill, to ensure a level playing field for both users and suppliers of regulated goods in Singapore, many of which are small and medium enterprises and which are already complying with the ECA, and for us to also improve our overall energy efficiency in Singapore. Several members have asked about the government's plans to reduce the compliance burden for end users arising from the proposed amendments, and have made suggestions to streamline the registration process and user journey, such as waiving test report requirements for regulated goods if these goods have been demonstrated to be MEPS compliant by prior importers. So MSE and NEA have conducted public consultations regarding the proposed amendments. The stakeholders we've consulted, which range from the local suppliers of regulated goods, businesses, technical experts from our institutes of higher learning, have all been broadly supportive of the proposed amendments. They've also provided feedback to reduce the compliance requirements and ensure practicality for end users, and we've incorporated their feedback into this bill. For example, we have excluded lights from the bill because regulating them would impose a disproportionate compliance burden on end users, such as households that occasionally import a few lights. Lights are less energy intensive compared to other regulated goods and typically consume 10 times less energy than appliances such as refrigerators, and constitute less than 6% of household energy consumption. We'll continue to monitor the import of lights for own use and, if needed, explore the extension of regulations to cover such imports. Sir, the new compliance requirements are not expected to be onerous. Currently, local suppliers are subject to a registration fee of about $70 per model to register their models for local supply with NEA. We've taken in the feedback to reduce the compliance burden on end users who are importing regulated goods for their own use. And they typically cannot spread the registration costs across multiple units. So therefore, the registration and renewal fees on end users who import regulated goods for their own use will be waived. Similar to local suppliers, all end users importing the regulated goods for their own use would be required to register them with NEA to demonstrate the MEPS and MELS compliance, regardless of whether another importer or manufacturer has registered such goods. The reason for this is there needs to then be an assignment of responsibility for the act of importing this particular good, and that this particular report matches the good as declared. And so it is the person who's conducting that import for own use who has to take on that responsibility. NEA can accept test reports provided by equipment manufacturers for registration of regulated goods. Suppliers and end users are not required to obtain additional independent test reports beyond those provided by the equipment manufacturers for registration. To avoid incurring unnecessary import costs, end users are also encouraged to register their regulated good prior to import to ensure that the good is MEPS and MELS compliant. As I previously explained, to do so prior to import incurs no cost for the end user importing for their own use. We will continue to review and streamline the registration process as needed. NEA will upgrade the Energy Labeling Scheme portal for a better user experience for those applying to register their appliance. End users will be able to use SingPass, similar to how businesses currently use CorpPass, to access the ELS portal and register, and NEA will provide more information in due course. Mr. Fu Zhesiang highlighted challenges for individuals and households in providing free samples of the regulated goods imported for their own use, which the Director General may require under Clause 12 of the bill for the purposes of testing or analysis. The Act does provide levers for NEA to obtain samples too, such as in the case of a business that may bulk import regulated goods for their own use. But I'd like to assure Mr. Fu and members of the House that testing and analysis is only conducted on regulated goods on a needs basis and only where it is feasible to do so. Mr. Yip Hon Weng and Mr. Mohamed Malik asked about the government's approach to allow the Director General to exercise powers to impose, modify, or revoke conditions after registration and the approach for appeals. I'd like to assure members that the government would only invoke these powers on a needs basis, and a reasonable time period will be accorded for the review, allow for rectifications, and to process the appeals. There will be instances where the government would require swift rectifications to prevent the further circulation or further sale of non-compliant regulated goods. As set out in Clause 7 of the bill, the Director General must, before imposing or modifying any condition for registration, give written notice to the holder of the registration, stating the proposed condition or modification, and provide time for the holder of the registration to make written representations with regards to the proposed modifications. The Act also expressly allows any importer or manufacturer aggrieved by the decision to file an appeal with the Minister. Mr. Dennis Tan asked how the government would ensure regulated goods would remain MEPS compliant after import, particularly those controlled by the manufacturers or third parties through software embedded within the regulated good. To balance the regulatory burden and energy efficiency outcomes, we've adopted a practical approach to apply MEPS and MELS requirements at the point of import only for own use, similar to the current regulations that apply requirements at the point of local supply. And I would emphasize this point that this is the regime that is in place currently for local suppliers, and the opportunities and hypotheticals that Mr. Tan had provided within his speech potentially exist today, but they don't appear to be a material problem at this point. Nevertheless, we will continue to monitor the situation, and if NEA has information that approved regulated goods have low energy efficiencies during actual operation, we will investigate, conduct additional tests and audits, and follow up as necessary. SMEs may import regulated goods for own use through intermediaries, such as contractors or interior designers. And in such cases, it is the intermediary importing the regulated good for subsequent supply to the SME that would be responsible for compliance. And like all other end users directly importing regulated goods for their own use, franchisees must ensure that the regulated good that they import for their own use comply with the MEPS and MELS requirements. NEA will issue press releases and circulars to inform end users and businesses about the new regulations, and will also engage key stakeholders, including the food and beverage businesses, through industry associations, such as the Restaurant Association of Singapore, to ensure that businesses and industries understand the new regulations and their responsibilities. NEA will also conduct checks on business establishments as needed and conduct enforcement in response to whistleblowing reports. We've assessed that there is no need to introduce controls at the point of import at this time. So the questions around customs and integration with ICA. We've assessed that there is no need for these types of controls at this point. The number of regulated goods imported for own use is expected to be small. And if there were such controls, as some members had asked, they would apply to all regulated goods imported for local supply or own use. And this is potentially increasing significantly the administrative burden, the friction, the compliance cost for the importers. And today, the vast majority of regulated goods brought into Singapore, meant for local supply, are already MEPS and MELS compliant. And what we're trying to do is close the loophole for a small number of goods. The proposed amendments will empower the Minister to make regulations to compel online platforms in Singapore to remove or rectify listings of non-compliant listings of regulated goods. This ensures that the non-compliant goods, such as those that don't carry the MELS labels, are not offered to end users in Singapore. The actual operationalization of removal of these listings will be done by the platform. It is NEA providing an enforcement instruction, and it is the platform then will have to comply about how these are taken down. Consumers can verify compliance by checking for accompanying MELS labels when purchasing regulated goods through online platforms. The new regulations will only apply to new regulated goods imported into Singapore for the purposes of own use. The new regulations also exclude second-hand or used regulated goods, whether it is online or in the physical marketplace. Notwithstanding this, second-hand regulated goods imported into Singapore for resale as brand new would be subject to the MEPS and MELS requirements. NEA will conduct surveillance and investigations to enforce compliance as required. We intend to effect the new regulations from the 1st of July 2026 to give platform operators time to adjust to the new regulations. Since 2023, NEA has also been engaging online platforms such as Shopee and Lazada to remove adverts of non-compliant goods. The online platforms engaged have also cooperated with NEA's instructions and have taken down the non-compliant listings accordingly. Moving forward, we will continue to work closely with online platforms to enhance surveillance of the online space and to encourage the proactive removal of listings of non-compliant regulated goods. The platforms may implement manual or algorithmic systems at their discretion to proactively remove these listings. If NEA discovers online listings that are non-compliant, we will work with the platforms to manually remove such listings. And we hope that this will minimize the purchase of non-compliant regulated goods, unintended or otherwise, by individuals and households. We have assessed the accompanying penalty framework to be a sufficient deterrent. Penalties will be imposed on a per-import basis, with fines of up to $10,000 per import of non-compliant goods for own use. The MEPS-compliant equipment delivers life cycle energy savings compared to energy-inefficient equipment, and this actually already intrinsically incentivizes end users to import compliant equipment. So the risk of reputational damage from the legal proceedings also discourages businesses from importing non-compliant goods. So put all of that together, we think this is likely to be quite effective. A penalty framework on a per-import basis is also consistent with penalty regimes in similar legislation, including the Environmental Protection and Management Act 1999, which imposes a fine not exceeding $10,000 for each contravening supply or import of non-compliant GHG goods, such as commercial chillers. Members had asked how the government would provide support to businesses and households to adopt more energy-efficient equipment and to build energy management capabilities. We have a suite of measures that businesses and households can tap on to strengthen their energy resilience. Companies can tap on the Energy Efficiency Grant, the EEG, to co-fund investments in energy-efficient equipment. the EEG already covers a wide range of regulated goods, including air conditioners, refrigerators, clothes dryers, motors, and water heaters today. As announced by SMS Finance, the EEG base tier will be expanded to all sectors, and support will be extended for another year to the 31st of March 2028. This is a part of the measures to support more businesses in purchasing energy-efficient equipment through the increasingly uncertain global climate. I encourage businesses to use the EEG to adopt more energy-efficient equipment. For households, the government has provided eligible households with $400 of climate vouchers in total over the last 2 budgets under the Enhanced Climate-Friendly Households Program, the CFHP. This helps to offset the initial cost of purchase of more resource-efficient household appliances and fittings, which are expected to yield recurring energy and water savings over their lifespan. Households that have yet to use their $400 climate vouchers can do so up to the 31st of December 2027. More recently, we expanded the list of products under the enhanced CFHP to include induction stoves and 5-tick clothes dryers. From the 15th of April 2026, households can tap on climate vouchers to access a wider range of resource-efficient products and achieve greater resource efficiency. We do also want to invest in the development of a pipeline of energy management professionals to support energy-efficient initiatives. Mr. Lee Hong Chuang suggested that government strengthen cooperation between industry and higher education institutions to develop more professional courses in energy efficiency and energy management. The member will be pleased to hear that this is already happening and that the government has programs in place to help businesses build a pipeline of energy management professionals to support our resource efficiency initiatives. For example, in February 2026, NEA, the Singapore Institute of Technology, and the Energy Efficiency Training Center launched the new Energy Efficiency Training Facility. This supports the delivery of programs such as the Energy Efficiency Upskilling Program and the Singapore Certified Energy Manager Program to develop a pipeline of local energy management talent and to build local energy efficiency capabilities. Members made several suggestions to strengthen public education and incentivize the adoption of compliant goods, and were concerned about the cost impact to end users when the amendments take effect. NEA maintains an online database of compliant regulated goods with product information, including estimated annual energy consumption and energy costs. Energy-efficient appliances typically offer lower life cycle costs through energy savings, even if they may have higher upfront capital costs. For example, life cycle costs of MEPS-compliant commercial storage refrigerators are on average 30% lower than non-compliant models. Mr. Speaker, sir, energy efficiency is an economic imperative that strengthens our energy resilience, that delivers cost savings for consumers and businesses, and contributes to our national climate targets. The Energy Conservation Amendment Bill is a necessary step to ensure that all regulated goods in Singapore are held to the same MEPS and MELS requirements and deliver greater energy efficiency outcomes for end users. I thank all members who have spoken for their support on the bill, and with this, Mr. Speaker, I beg to move.
Clarifications for SMS General? Ms. Poh?
Thank you, Speaker, and thank you, SMS Janil. I believe my questions in my speech were not addressed in your reply. I asked at the end of my speech regarding in the F&B sector alone, with the large numbers of restaurants and F&B establishments and the high churn, there must be a lot of freezers, chillers, refrigerators, and what would be the estimated annual consumption. And with this transition to all MEPS compliant equipment, what will be the reduction like in terms of the energy savings? And secondly, with these large numbers of end users and end equipments, what is the process that's needed to actually enforce this new requirement? And I hope that this process and the requirements will not be too onerous. Otherwise,
it will just end up conserving energy on one part and expending more energy in terms of human resources to carry out all the enforcement. Thank you.
SMS Janil.
So I thank Ms. Poh for her question. The answer to the first part is we don't yet know, because the extension of the ECA is to now goods that are currently not regulated. So we have engagements with the sector, with the Restaurant Association. We have information that the behavior is happening. But until we regulate the sector, these goods, I beg your pardon, we will not have a handle on exactly how many there are coming into the space. So at a future time, we should be in a better position then to think about what is the total estimated annual consumption to include what today would have regulated and unregulated goods. And so the reduction in energy savings, we can make an estimate, and we've estimated that there is about a 30% reduction in costs and, over a life cycle of the regulated good compared to the compliant good compared to a non-compliant good. So is that overall energy reduction in the sector? I think you can't draw a straight line because it's not the only consumption of energy within the sector. But the short answer is the current issue is that we don't regulate the goods that we are going to regulate, and so we don't know exactly how many there are on the market. The second part of a question, that this involves a large number of... Actually, this is not the case. Today, most of the businesses involved are already engaged with MEPS and MELS compliant suppliers and are already involved with purchasing from the suppliers. The suppliers are already MEPS and MELS compliant. So it's not a huge number that will have to then come onto the scheme. We've engaged with those that we can find, and we have worked with them to then shape the operations of this scheme to ensure that it's not too onerous, as I described in my speech.
Mr. Dennis Tan.
Thank you, Mr. Speaker. Just one clarification for the SMS. I thank the government for acknowledging the gap regarding the software-driven energy degradation and for the commitment to monitor and test where necessary. However, if a software update is found to significantly degrade the energy performance of hardware already in use, what specific enforcement action will the NEA actually take? Specifically, would the registration of those regulated goods be retrospectively revoked, and would this result in a mandate for the user to cease usage or for the manufacturer to force a software rollback?
SMS Journal.
So this is a hypothetical situation that we've not encountered yet. The Act provides for the Director General and NEA to exercise a range of measures should they come across a good which is non-compliant or which was declared to be compliant and is now subsequently non-compliant. And that can arise for a number of reasons. Software modification is one, but physical hardware modification is also another. The assessment would have to be made as to whether the problem was rectifiable. This goes to an earlier question about the time that was given and the actions that are taken. And if the problem was rectifiable, then a reasonable period of notice together with instructions to rectify. Failing which, warnings, fines, all are possible. Whether the action would be taken against the person who imported or the manufacturer, the answer is potentially both, because now that you know that this business or this person may have deliberately done it, we would have a higher level of scrutiny. If we're aware that a particular model or a particular manufacturer may engage in such practices, when further models from that manufacturer are submitted for review and registration, certainly we would have to take this into account. And so we would have a range of possible responses to such behavior. But I would encourage businesses, end users, please don't engage in such behavior. The intent of these regulations is to improve our energy efficiency, and by doing so, we will end up lowering the costs for all the businesses and the households that are involved. And that's the important outcome that we want to achieve.
Looks like there are no further clarifications. The question is that the bill be now read a second time. Those who agree say aye. Aye. Those who disagree say no. I think the ayes have it. The ayes have it.
Energy Conservation Amendment Bill.
Committee stage what day?
Now, sir, on behalf of the Minister for Sustainability and the Environment, I move that Parliament will immediately resolve itself into a committee on the bill.
The question is that Parliament will immediately resolve itself into a committee on the bill. Those who agree say aye. Those who disagree say no. I think the ayes have it. The ayes have it. The question is that clauses 1 to 17 stand part of the bill. Those who agree say aye. Aye. Those who disagree say no. I think the ayes have it. The ayes have it. Bill to be reported. Minister for Sustainability and the Environment.
Mr. Speaker, sir, on behalf of the Minister, I report that the bill has been considered in committee and agreed to without amendment.
The question is that the bill be now read. Sorry, third reading what day?
Now, sir, on behalf of the Minister, I move that the bill be now read a third time.
I wasn't trying to conserve my energy. The question is that the bill be now read a third time. Those who agree say aye. Aye. Those who disagree say no. I think the ayes have it. The ayes have it.
Energy Conservation Amendment Bill. Item 2, Veterinary Practice Bill, second reading.
Minister for National Development.
Mr. Speaker, sir, on behalf of the Minister for National Development, I beg to move that the bill be now read a second time. Sir, the Veterinary Practice Bill establishes a new professional regulatory body, the Veterinary Council, to register veterinarians or vets, and to regulate the practice of veterinary medicine in Singapore. Today, vets in Singapore are licensed under the Animals and Birds Act, or ABA. Now, this framework has served us well in safeguarding animal health and welfare, and in protecting human health from animal diseases. However, our vet sector has evolved and matured significantly. Our pet population and demand for vet services have grown. Over the last 2 decades, the number of licensed vets has increased by more than 5-fold. There are close to 700 licensed vets as of end 2025. Now, the range and sophistication of vet services and treatment have also expanded. In particular, there has been a rise in the number of vet specialists and breadth of vet specializations available here in Singapore, offering specialized surgical and medical services. Public expectations of professional standards and accountability have also risen. And against this backdrop, MND and NParks had signaled the move to establish a vet council in 2023 to oversee professional matters for the vet sector. Coupled with a robust professional regulatory framework, this aims to raise professional standards and uphold public confidence in our vet sector. Now, in drafting this bill, we conducted extensive consultation with the vet sector, sought views from the public, and studied models governing other human healthcare professions in Singapore and those of reputable vet statutory bodies in other jurisdictions, including Australia, Hong Kong, and the UK. Let me now elaborate on the bill's key features. Part 1 lays out the fundamentals of the bill. Clause 2 defines the practice of veterinary medicine, which comprises the range of professional activities regulated by the bill. Clause 3 defines who is regarded as a duly qualified vet. And while only vets are required to be registered at the outset, we plan to eventually extend regulation to other veterinary professionals, such as vet nurses who are currently not licensed, with an appropriate transition period to allow the sector to adjust. We will share more details when ready. Now, Part 2 of the bill establishes the Vet Council and sets out its functions in Clause 5. This includes registering vets, setting standards for professional conduct and requirements for upskilling, and appointing necessary bodies for disciplinary proceedings against the misconduct and negligence of vets. Clause 4 provides for the Council's composition, which will comprise a mix of public and private sector members. Now, this may include ex-officio members comprising the Director General for Animal Health and Welfare, who is a public officer, and the elected President of the Singapore Veterinary Association, or SVA, or their nominees, and the appointed Registrar of the Council. Now, the Registrar will be a public officer or an officer or employee of a public authority. The Council will also comprise at least 4 other vets and at least 2 other non-vets. And members will serve a maximum term of 3 years and may be reappointed. The Minister for National Development will have powers to appoint and remove members while taking into account the Council's prevailing operating needs. Clause 13 empowers the Council to appoint committees, which will advise the Council on nascent issues, such as reviewing the Code of Ethics for veterinarians, to provide up-to-date standards on professional conduct. And besides providing fair and adequate representation of the vet sector, which was a key feedback we received during our engagements, we also designed this framework to safeguard public interests. It will ensure that professional regulation is grounded in practical experience with appropriate public oversight while addressing emerging issues faced by the sector. Part 3 of the bill sets out structured registration and practicing certification framework for vets. Clauses 17 to 19 provide for the registration of vets under 3 classes of registration to better differentiate a vet's foundational qualification, training, and practice experience. Clause 24 requires the registrar to publish on the Council's website certain particulars of the registered vets. Now, this enables the public to search for and verify a vet's registration status and place of practice. Now, let me elaborate on the 3 classes of vet registration. First, full registration. Now, this is for vets who either hold a prescribed qualification or hold a qualification in veterinary medicine that is not lower in standing than the prescribed qualification and possess the necessary knowledge, skill, and experience. The prescribed qualifications mirror AVS's current licensing criteria, which are accredited by well-established accrediting organizations. The second class is vets with restricted registration. Now, vets with restricted registration will be subjected to certain restrictions, such as to practice only under the supervision of vets with full registration or in specific establishments. Now, these vets must hold a qualification in veterinary medicine that does not qualify for full registration but has provided them with adequate training. They must also possess the necessary knowledge, skill, and experience and must be selected for employment in establishments recognized by the Council, such as the zoo or research institutes. This allows the Council to address manpower gaps in niche domains of practice without compromising animal health and welfare or public confidence in the sector. The third class of registration is specialist registration. Now, this is for vets with full registration who additionally hold an approved postgraduate qualification or have acquired special knowledge, skill, and experience in a particular branch of vet medicine. Such vets will be allowed to use specialist titles, such as vet ophthalmologist or vet pathologist. Now, a full or restricted registration has no expiry but may be cancelled by the registrar or council on any relevant ground set up in Clause 26, 38, or Part 5 of the bill. A specialist registration is subject to renewals by the council. Now, to ensure vets continually improve and update their knowledge and skills, registered vets must also obtain a practicing certificate, or PC, from the Council to practice veterinary medicine. Vets must regularly renew their PCs and fulfill mandatory continuing professional education requirements. These requirements ensure ongoing competency and are already in place today for AVS licensed vets. The Council will provide more clarity on these requirements when ready. With these new frameworks, the public can be better informed of the VET's professional standing and competency. Now, to minimize disruption to the sector and to ensure continuity of VET services, Clause 90 will provide an arrangement for all AVS licensed VETs to transit to the new framework seamlessly. Existing VETs holding a license under the ABA will be temporarily deemed to be duly qualified VETs. For instance, the majority of existing VETs will be placed on full registration as they currently hold a full license. Existing VETs will then need to obtain registration and a practicing certificate within a stipulated grace period to continue practicing veterinary medicine. The bill also ensures that services provided by certain non-VETs will not be disrupted. For instance, Clause 29 does not prohibit vet nurses from practicing veterinary medicine so long as they act under the supervision of a duly qualified vet and in accordance with prescribed conditions as they do today. As we have observed a growth in the range of animal-related services offered by non-vets that may pose a risk to animal health and welfare, Part 4 of the bill will introduce various offences and penalties to safeguard against unlawful practice and misrepresentation by or about authorised persons. Sorry, I say that again, or about unauthorised persons. The bill will raise the maximum financial penalty to $50,000, a $4,000 increase compared to the current level of $10,000 provided under the ABA. Now, this strengthens deterrence against profit-driven motives and was benchmarked with penalties applicable in human healthcare professions. And apart from prohibiting unauthorized persons from practicing veterinary medicine or falsely implying that they are vets and qualified to act as a vet, it will also be an offense for other persons, such as business owners and employers, to make false claims that their employee is qualified. The prohibition of the practice of veterinary medicine by unauthorized persons garnered strong support from stakeholders and the public. It also aims to better assuage, it also aims to better assure the public that their animals are receiving treatment from duly qualified vets. Now, Part 5 of the bill introduces a robust disciplinary framework for vets, which is designed to be proportionate and impartial. Clauses 44 and 45 establish clear thresholds for escalating disciplinary cases brought against registered vets, whereby the registrar will first triage a case against a registered vet before recommending to the Council on the action to be taken. The registrar can recommend dismissing the case if the complaint is frivolous, so vets are not unduly burdened by unmeritorious cases. Now, if there's evidence of physical or mental health issues which impair the vet's fitness to practice, the registrar can recommend the Council to cancel, suspend, or impose conditions or restrictions on the vet's registration with the vet's agreement. The registrar may also recommend to the Council to refer the case to various committees, which are the Complaints Acceptance Committee, or CAC, to review the conduct of or services provided by the vet, a disciplinary committee, or DC, if the vet has been convicted of an offence involving fraud, dishonesty, or implying a defect in character, and 3, an interim orders committee, or IOC, to review whether to make an interim order against the vet pending inquiry into the case. Now, this approach ensures proportionality to the issue at hand. Committee members will be drawn from either a complaints panel appointed by the Council or from both the complaints panel and the Council. The intent is for a wider pool of experienced vets to be part of the committee to contribute their clinical perspective. The CAC must include a layperson, and a DC must include 2 laypersons, namely a legal professional and an observer, to represent public interests and ensure accountability. Members involved at earlier stages of a disciplinary case must not sit on a subsequent committee for the same case. And these safeguards mitigate potential conflicts of interest and ensure impartiality in reviewing disciplinary proceedings. Now, I'll highlight next key actions or orders that may be taken by the different committees. For minor complaints, Clause 50 allows the CAC to recommend referring a case for mediation by an appointed mediator. This is one of the key features which promotes conciliatory mediation and conciliatory resolution. This may be applied to cases involving miscommunication between vets and their clients and allow for both parties to reach a resolution through facilitated dialogue. And for more egregious cases of misconduct or negligence, Clause 56 empowers the DC to take stronger disciplinary action against a vet, including cancelling or suspending a vet's registration or PC, and imposing a penalty of up to 50,000, which is aligned with that for the human healthcare professions. Now, as these inquiries may take time, Clause 66 empowers the Interim Orders Committee, or IOC, to either suspend or impose conditions or restrictions on a vet's registration for a period not exceeding 18 months while disciplinary proceedings are ongoing. The cases where such interim orders may be needed include those involving serious or immediate risks to public or animal health. Interim orders allow for swift responses to protect or secure certain interests while disciplinary proceedings are ongoing. Clause 71 provides that interim orders will cease to be enforced either at the end of the period specified in the order, when the order is revoked, or when disciplinary proceedings continue. Or when disciplinary proceedings conclude. Clauses 51, 52, 62, and 70 provide a mechanism for appeals against certain decisions of the Council or its committees to be heard. The Minister will hear appeals against the Council's decisions, and the General Division of the High Court will hear appeals against the DC or the IOC's orders. Now, this disciplinary framework broadly aligns with that for the human healthcare professions and aims to uphold public confidence in the vet sector. Lastly, Part 6 of the bill provides powers for the Council to make regulations on qualifications for registration, continuing professional education requirements, and professional standards. The Minister's approval must be sought when regulations are made by the Council. Sir, we will commence the bill in 2 stages, starting with establishing the Veterinary Council this year, followed by the remaining provisions of the bill, including the registration regime and disciplinary framework for vets next year. This will give the sector sufficient time to adapt to the bill's requirements and to strengthen their processes. We will share more details in due course. Mr. Speaker, sir, we need highly skilled and professional vets in our evolving pet landscape. This bill marks an important milestone in the maturation of our vet sector. It will strengthen professional accountability, support better animal health and welfare outcomes, and uphold public confidence in the sector. The Vet Council will benefit the veterinary profession, which has provided support for the bill. It will lead to better treatment outcomes, to better safeguard animal health and welfare. It will also benefit the public, who can be more assured of the competency and quality of veterinary services and better veterinary client relationships. Mr. Speaker, sir, I beg to move.
The question is that the bill be now read a second time. Mr. Henry Kwek.
Mr. Speaker, sir, I rise in support of this bill. This is a timely and necessary move. As the pet population in Singapore grows, and as the vet care becomes more complex, it is right that we strengthen professional standards, clarify the scope of regulatory services, or regulated vet services, and put in place a robust disciplinary framework. I support the direction of the bill. At the same time, I'd like to raise one central concern on behalf of many pet owners, which is how do we strengthen professionalism in the sector while ensuring that vet care remains affordable and accessible? For many Singaporeans, pets are not incidental. They are part of the family. This is especially so in an aging society where pets can be an important source of companionship, comfort, and emotional support. To many people, their pet is a source of joy, comfort, and sometimes their daily closest companion. So as we improve standards and professionalize the sector, we must exercise care that the new rules, guidelines, and expectations do not unintentionally drive up the cost of care. Put simply, caring for a cat, or dog, or any pet must not be the preserve of the wealthy. So I do not say this to prejudge the work of AVS or the future VAT Council. I support the direction of this bill. But because affordability matters so much for the ordinary pet owners, it is important we state this concern early and watch implementation carefully. With that in mind, I'd like to make a few suggestions and seek several clarifications. First, while the VAT Council is a useful and necessary institute, its role under the bill is primarily to regulate professional standards, registration, conduct, and discipline. My suggestion, therefore, is that MND and AVS make clear and affordable and accessible animal care be an important part of the policy objective in how this framework is implemented, including the development of standards, code, and requirement over time. In other words, as standards are raised, affordability should not be treated as an afterthought. Second, I suggest that the Council or one of its committees should have a stronger channel for the voice of the animal welfare and pet owners' interests. This could be done either through including 1 or 2 individuals with strong standing in the animal welfare community or through a dedicated advisory committee on affordable and accessible animal care. This would help ensure that the system does not only hear from providers but also remain attentive to the life reality of pet owners. Third, I will encourage AVS to begin tracking broad trends in the cost of vet care and share this regularly with the committee and the council. I'm not suggesting anywhere as elaborate as the healthcare sector's fee benchmark or the procedure-by-procedure guidelines, but some basic monitoring of care and costs of care would be helpful. Without data, we will not know whether the improvement in standards are being achieved in a way that remain sustainable for ordinary Singaporeans. And if care rises in the years ahead, we should at least be able to distinguish between whether it's driven by inflation, manpower costs, or more advanced treatment norms or regulatory and professional requirements. Fourth, I'd like to seek clarification on the disciplinary and appeals framework. I agree that VATs must be held accountable for misconduct and negligence, and I support having meaningful powers to act against serious wrongdoing. But we should also ensure that the process do not inadvertently encourage frivolous complaints because that can have real consequences. If professionals feel constantly exposed to weak but career-threatening complaints, they may respond by practicing defensive medication, over-ordering procedures, or face higher professional indemnity costs. And in the end, those costs may be passed to pet owners. So I appreciate clarifications from the MND on how the framework will guard against misuse while preserving confidence and fairness for complainants. I note that the bill allows frivolous or misconstrued complaints to be dismissed, and I welcome that. I also welcome the inclusion of mediation, and these are sensible features. But it would be helpful to understand whether AVS expect to publish workflows, aggregated data, or guidance over time, so that both the public and the professionals can have confidence that the process is balanced, transparent, and not easily abused. Fifth, as the Council develops codes, standards, and professional expectations, I hope there can be a deliberate attempt and attention on practical and tiered care options. In concrete terms, financially stretched pet owners should still be able to receive clear advice upfront on what constitutes a basic, safe, and affordable cost of treatment as distinct from more comprehensive or more advanced options. Likewise, when an animal is gravely ill and recovery is unlikely, owners should not be left without an affordable and dignified path, including euthanasia, where appropriate for the animals. Different owners will make different choices, and many will want the best and most extensive treatment possible for their animals. That is entirely understandable. But a well-functional system should always and be able to make room for realistic, humane, and affordable options. 6, I urge some caution before we expand on the regulatory framework to other vet professionals and allied animal care providers. The intent is clearly well-meaning, and I understand that this may eventually be necessary, but I hope we at least first observe how the establishment of the Vet Council affects the sector, especially in terms of manpower, service delivery, and cost, before extending this regulation more widely. And finally, I hope that MND and AVS initiate a serious effort to examine the broader costs of caring for animals in Singapore to ensure that care remain affordable and accessible. These issues may sit outside the four corners of this bill, but it sits very much within the concerns of pet owners. Many residents, volunteers, and animal lovers active within my constituency of Kebun Baru, including myself, would be happy to contribute to such engagement on affordable and accessible pet care. So, in conclusion, the formation of this Vet Council and this bill is a natural next step in the evolution of vet care in Singapore, and I certainly support it. But as we professionalize this sector, let's keep faith with the ordinary pet owners. Let's make sure that the better standards do not come at the cost of accessibility, and affordability remain a central and real consideration in how this new framework is implemented. Thank you.
Mr. Louis Chua.
Mr. Speaker, as a proud parent of a fur kid, I relate to the stress faced by pet owners when bringing their pet, often with much resistance, to the vet for medical treatment or checkup. I'm sure many pet owners can relate to how they can somehow figure out whether they are being taken to the dog run or being taken to the vet for a medical appointment. However, no matter how anxious or rebellious the patient may be, it is the patience, skill, and professionalism of our veterinary corps that often place both the patient and its owner at ease. In Singapore, demand for veterinary services is booming, owing to the rise in pet ownership and how pets are now often regarded as a member of the family and not just a pet per se. The bill introduces a new three-tiered registration framework for veterinarians based on one's qualifications, namely full, restricted, and specialist. Establishing the Veterinary Council as an industry's professional body is therefore instrumental towards upholding the high standards expected of the profession, and a move I strongly support. Nonetheless, this bill arrives against a backdrop of stretched veterinary manpower, mounting public concerns about care costs, and an overall pet care ecosystem that still has significant gaps. Allow me to touch on these topics in turn in my speech. In addition to regulating the veterinary industry, I hope that the Council would strengthen the pipeline of registered veterinarians to ease Singapore's shortage of veterinary professionals. According to the Singapore Veterinary Association, there are approximately 898 pets per vet as of 2022. Currently, there is no university course in veterinary science available locally. While Ngee Ann and Temasek Polytechnic offer vet-related diplomas, they do not provide students with the prerequisite qualifications to become a full-fledged licensed veterinarian. To apply for a license to treat birds and animals under the present system, one must study overseas at a veterinary school recognized either by the American Veterinary Medical Association, the Royal College of Veterinary Surgeons, or the Australasian Veterinary Boards Council. If they hold a veterinary degree from a non-recognized university, they could also sit for and pass either the RCVS statutory examination, the North American Veterinary Licensing Examination, or the Australasian Veterinary Examination. This is a costly pathway only open to those who have the means to do so or are awarded a scholarship, discriminating against many potential veterinarians with the love and passion for helping animals from pursuing such a noble profession. In February 2026, a PQ was posed to the Minister for Education on whether the Ministry will work with autonomous universities to introduce a locally offered veterinary degree in view of growing demand and reliance on overseas trained vets. The reply was that MOE will continue to work with the AUs and sector agencies such as MND and NPARKS to monitor and assess how best to meet Singapore's long-term veterinary manpower needs. I find the answer to be quite inadequate. I understand the arguments that Singapore's small land area means limited farm animal populations and that there may not be sufficient scale to justify the opening up of a new program. But the question is not whether the current supply is sufficient, which increasingly appears to be insufficient, but whether the pipeline is resilient. A profession whose entire intake depends on Singaporeans willing to bear the cost and disruption of overseas education with no guarantee of returning is a profession with a structurally fragile supply chain. Moreover, we can always start with a partnership model for starters. I'm reminded of the double degree program offered by NTU in Biomedical Sciences and Chinese Medicine with Beijing University of Chinese Medicine, which began in 2005. Today, NTU is launching its own 4-year Bachelor of Chinese Medicine degree, which enrolled its first class of 25 students in August 2024, with plans to go up to 40 eventually. I believe this is a model which we can replicate for our own veterinary degree. Will the government be keen to introduce a locally offered veterinary degree? In addition to strengthening the supplies of veterinarians, which is crucial in addressing the manpower gap, I hope that the Council can look into plugging the brain drain faced by the industry. As of September 2025, Singapore had approximately 674 licensed veterinarians, rising to around 700 by end 2025. This is up nearly sixfold from just 122 in 2006. Demand for vet services have been rising alongside the rising incidence of pet ownership, yet every single vet in Singapore has been trained entirely abroad. Amongst the Singaporean veterinary students that study overseas, which comprise an overwhelming majority, only 50% or less choose to return home to practice, as many prefer to work in Australia or the UK, where opportunities abound with perhaps better work-life balance. A study conducted by James Cook University and the SVA highlights that veterinary professionals are 4 to 9 times more likely to experience depression, anxiety, and stress compared to their human healthcare counterparts. Improving our local talent pipeline would therefore help plug the brain drain within the industry by spreading out the workload more sustainably, thus reducing the likelihood of burnout. Another issue faced by the industry is the lack of career progression, especially amongst veterinary paraprofessionals such as nurses and technicians. When combined with burnout and wages incommensurate with their less than ideal working conditions, it has resulted in a high attrition rate and manpower shortage. According to the SVA, only 20% of veterinary nursing graduates remained in the industry after 5 years as of 2022, with many of them viewing this profession as unviable. With plans to regulate veterinary nurses and technicians in the works, I hope that the Council can develop structured opportunities for career progression and specialization, thus boosting their wages and job prospects. Furthermore, while Clause 4.3 of the bill specifies that the Council should minimally comprise of 4 fully registered veterinarians and 2 laypeople, there is no explicit requirement for veterinary paraprofessionals to be represented. Given their invaluable contributions to the industry, paraprofessionals should also have a seat at the table, thus providing an avenue for their concerns to be heard. Mr. Speaker, reforms to the vet sector should also protect consumers' interests. Big conglomerates and private equity firms have recently been heavily investing and acquiring pet care chains and veterinary practices. In fact, although dogs are allergic to chocolate, the Mars Corporation is ironically one of the biggest players in the veterinary scene. While such clinics benefit from a flush of capital, veterinarians might have to keep a closer eye on their bottom lines and the demands of upper management instead of their patients. Some years ago, our family adopted a dog from the SPCA. We named him Yellow. It was uncommon to find what appeared to be a purebred dog put up for adoption, but Yellow had physical deformities that required consistent and ongoing medical attention. Towards the end of his life, the costs of managing his condition was not far from what one might expect to pay for a human specialist. He was family, and we wanted to do everything we could to ease his suffering. But I'm acutely aware that not every family is in the same position. For some, the cost of treatment is simply prohibitive. And the cruelest irony of all is that euthanasia, the most unbearable option, may also be the cheapest one. During the consultation process of the bill, some respondents have also raised the issue of high veterinary fees and a lack of transparency. Although regulating clinic fees is beyond the remit of the Council, I believe that there is space for the Council to act in the interests of consumer protection and to prevent runaway healthcare costs in the veterinary scene. It will be instructive of us to study the approach taken by other jurisdictions. For instance, the UK recently started mandating veterinary clinics to publicly disclose their practice ownership structure and introduce price lists for common procedures to boost transparency for consumers. I do hope the Ministry and the Council can consider regularly publishing hospital bills and fee benchmarks, similar to how the Ministry of Health has done so, or even fee guidelines for starters. Finally, I return to the concern I've raised previously about pet groomers. Beyond veterinary professionals, there are others within the wider animal care ecosystem that play a key role in ensuring the health and well-being of animals, such as pet groomers and trainers. This bill creates full professional registration, practicing certificates, continuing education requirements, and a multi-tiered disciplinary framework for veterinarians, like pet groomers who handle animals daily, and a number of whom have been linked to dozens of investigated welfare incidents, and who in some cases have been responsible for animal deaths, remain largely unregulated. A parliamentary reply this year revealed that NParks investigated 54 cases of harm to animals involving pet groomers over the past 3 years. Following questions raised in this House, MND indicated in January 2026 that the Animals and Birds Act review would consider whether to include requirements for CCTV recordings. There's also been cases of mishandling involving dog trainers. For instance, 2 employees of a dog training firm were suspended in 2024 for physically harming 2 dogs under their care in preparation for a photo op. Currently, pet groomers and trainers are simply required to adhere to the Code of Animal Welfare, a set of minimum standards and best practices regarding certain aspects of animal care, such as housing, feeding, and transport. Back in September 2024, I asked the PQ about whether there are plans to implement licensing requirements for pet groomers in a manner similar to pet breeders and boarders. I understand the government is currently reviewing the Code of Animal Welfare with a focus on groomers, as well as introducing a new chapter for dog trainers. However, the aforementioned instances of negligence by pet groomers and trainers highlight the need for a tighter enforcement regime for this group of professionals, in addition to revising the penalties for animal cruelty and failure to fulfill duty of care to ensure that practitioners actually adhere to professional standards. Mr. Speaker, to care for animals is a labour of love. I support the passage of this bill, but there's more we can do to develop a fully functional animal health and welfare ecosystem. I hope we can do more by strengthening the pipeline of veterinary professionals, plugging the brain drain faced by the industry, recognizing the contributions of our veterinary professionals, enhancing consumer protection measures within the industry, and tightening the enforcement regime for pet groomers and trainers. This will nurture a thriving animal care ecosystem that is centered around the health and welfare of its patients, whether it's domesticated pets, community animals, or the wildlife in our garden city. Thank you.
Ms. Lee Hui-Ying.
Mr. Speaker, sir, I rise to speak in support of the Veterinary Practice Bill. This is a milestone for our vet community, a profession that has grown from just about 100 practitioners 2 decades ago to about 700 today. The industry is still ripe for greater growth. Pet ownership continues to rise, and Singaporeans are more sensitive to the care of their furry companions. Many neighbouring countries already have robust regulations for the vet industry, and it is opportune for Singapore to join the conversation. As we move towards a more sophisticated regulatory landscape, we must ensure this bill has the claws and teeth to protect not only the animals and their guardians, but also the dedicated professionals who serve and save them. I wish to raise 3 areas of clarifications for consideration. First, the introduction of a specialist register is a welcome move, strengthening the trust and quality of advanced veterinary services. We would not expect a general practitioner to perform complex orthopedic, eye, or soft tissue surgery on a human without a residency period and proper specialization. But these are common surgeries that general licensed vets do in Singapore. This blurred distinction between specialized and non-specialized treatment in the current GP-heavy veterinary landscape creates a need for deeper regulation. However, we must ask if the proposed 3-tiered system is sufficiently robust. Specifically, Clause 16 defines the specialist tier broadly and gives the Council greater statutory discretion to determine someone's place in this tier. There were concerns raised that the broadness of this tier cannot effectively motivate vet pursuits at the highest level. In contrast, the Australian and New Zealand College of Veterinary Scientists stipulates a highly stratified professional qualification framework that informs their registration, including 4 tiers, distinguishing general practitioners, members, fellows, and finally, registered specialists. The highest tier of registered specialists requires both a postdoctoral degree and years of clinical experience. This is similar to the residency system in human healthcare medicine. Moreover, there is a wide variety of postdoctoral degrees offered to prospective students, allowing them to upskill at the correct level of expertise and knowledge. Similarly, the UK distinguishes between GPs, between general practitioners, advanced practitioners, and board-certified specialists. Advanced practitioners have postdoctoral degrees and practical experience, but still might not meet the threshold to be considered board-certified specialists, who receive residency training similar to human medicine, contribute to published research, and are active in the specialty. Contrast this with our 3-tier system, which groups all levels of postgraduate expertise under a single specialist banner. This may risk the specialist tier being too blunt and not useful to consumers as a mark of trust and quality. Many vets in Singapore studied in Australia and the UK. They are already familiar with more detailed tiered systems. So it's not surprising that we have received feedback that proposed tiers could be more robust, especially in the specialist class. First, will the Minister substantiate the specific requirements for the specialist tier in the subsidiary legislation? Second, if we are to stick with these 3 tiers, how does this safeguard the public interest as effectively as more granular international models? Third, to complement the bill and encourage more stringent and continuous education requirements, will the Minister consider providing support and grants to vet professionals for continuing education? Second, another clarification desired on the ground is how will we protect our vets against death by process in possibly dealing with a double penalty of having to simultaneously defend a claim in the civil courts and a vet counsel inquiry for the same set of facts. I understand that both processes serve a different purpose. The civil courts serve to compensate for damages, and the vet counsel serves to discipline malpractice. However, vets who are likely to operate in smaller clinics will not have the resources to address 2 parallel processes. A single case could be a death sentence for the business, even if they are eventually cleared. For example, under Clause 56 of the bill, an interim order can suspend a vet for up to 18 months while investigations proceed. This is a staggering time frame to disrupt a person's livelihood. Accountability is important, but it must be balanced with trust in our professionals. However, otherwise, we risk increasing consumer costs from defensive medicine or deterring passionate people from taking up this specialized career. To avoid disproportionate punishment by process, can the Minister elaborate first, how does the government balance the potential proceedings vets may face? Would there be guidelines to limit the amount of investigation time? If there are concurrent proceedings, can civil cases be put on hold until findings from the Vet Council have been released? Lastly, we must talk about the abuse gap. In the UK and Australia, the British and the Australian Veterinary Associations have reported a surge in cyberbullying and physical intimidation by pet owners. In Singapore, vets often face de minimis claims, small, repetitive legal threats that constitute a form of harassment. The government has done a great job since COVID to prevent and protect our healthcare workers from harassment and abuse. We can do the same for our vets. In the UK, this protection is extended to vets under the Respect Your Vet Team initiative. Furthermore, the Royal College of the Veterinary Surgeons, which is the UK's equivalent of a vet council, provides additional support to vets that makes them more than just a regulatory and disciplinary body. RCVS provides a hotline for vets to discuss grey area issues, support vets through difficult disputes, and in recent years, launched numerous initiatives to champion the mental well-being for vets. One such initiative is the ProfCon Investigation Support, PCIS, that provides confidential peer support for those under investigation, and their flagship Mind Matters initiative that provides workshops to promote mental well-being and mental health in the industry. This is a small industry with high attrition rates. Vets tend to have lower comparative pay despite years of specialized study, while managing compassion fatigue and abuse. This is slated to worsen if individuals spend more time and money to upskill as specialists, but continue to receive similar pay and working conditions. This shortage, in turn, transfers to the consumers as a fall in the supply of vet services results in higher costs and fewer choices. Will the Minister consider extending the industry abuse protections to veterinarians under the Vet Council, similar to the RCVS in the UK, to provide them with better occupational support? Mr. Speaker, in Mandarin, please. 议长先生，这项法案对我国兽医行业是重要的里程碑。随着越来越多国人饲养宠物，并更注重宠物的护理，兽医行业呢预料将继续蓬勃发展。为兽医专家设立新的注册制度，将有助于提高和提升公众对高级兽医服务的信任和质量。我们不会期望一个家庭医生为人类执行复杂的专科手术。同样的，在兽医体系中，专科与非专科之间的界限模糊，因此更完善的监管机制是有必要的。澳大利亚和新西兰兽医科学院就设有4个阶级的专业资格体系。我国许多兽医曾在澳大利亚和英国受训，对这种分级制度并不陌生。正因如此，我们也收到反馈，认为现有建议的分级体系，尤其在专科类别方面，需要和仍有进步的空间。因此，我想问部长：首先，部长是否会在附属法令中进一步说明专科兽医类别的具体要求？第二，如果维持目前这3层分级制度，如何确保在保障公众利益方面也有同样的效用？第三，为配合法案并鼓励更严格与持续的专业进修，政府是否会考虑为兽医提供培训、支持与资助？兽医行业圈子小，但人才流失率高，他们通常需要多年专业学习，却面临较低的薪酬，还有承受情绪疲劳和辱骂的骚扰。如果从业者需要投入更多时间与金钱提升为专科兽医，但薪金和工作条件却未见改善，那这个情况可能会进一步恶化。人力短缺的代价最终将转嫁给消费者，因为兽医少了，不但费用上升，选择也减少。因此，我想问部长，是否会考虑为兽医提供类似英国皇家兽医学院所设立的行业骚扰保护，以加强对兽医从业者的职业保障？在艺术南，我认识一些从事兽医业的居民们，他们不仅仅照顾宠物，也用心帮助宠物的饲主。他们告诉我，遇到无法承担医药费用而被迫放弃宠物的情况，他们会继续治疗这些宠物，并为他们寻找新的家。兽医管理委员会会推动行业更上一层楼的潜力，但若缺乏对专科制度的清晰界定，或对从业者的支持，也是徒劳。因此，我期待看到一个既能提升行业标准，又不会打击从业者热忱的理事会。Mr. Speaker, vets do more than care for our animal companions. They are the first line of defense for zoonotic diseases and public health. In Yishun South, I have residents who are also vets, and they go the extra mile. They share with me, they help pet owners who cannot afford vet healthcare bills and end up surrendering their pets. The vets continue to treat the animals and even rehome them to another family. The Vet Council has the potential to help grow this booming industry. but a lack of specialist clarity or support for our vet can threaten the initiative's potential. We want a council that elevates standards without crushing the spirits of those who practice. These clarifications aside, I stand in support of the bill.
Order. I propose to take a break now. I suspend the sitting and will take the chair at 3:20 p.m. Order, order.
Order.
Item 2, resumption of debate on the Veterinary Practice Bill, second reading.
Mr. Mohaimin Malik.
Sir, as parent to 2 cats, I understand firsthand the importance of having qualified, trustworthy veterinary professionals caring for our animals. The establishment of the Veterinary Council, the creation of proper registration framework, and the introduction of disciplinary proceedings are long overdue. There are currently over 690 licensed veterinarians, which has increased almost 5.5-fold since 2006, serving an ever-growing population of pet owners who rightly expect professional, accountable care for their animals. This bill provides the legal architecture to meet those expectations. While I support this bill, my concern lies with what happens when it is enacted. Specifically, I wish to address 3 areas: public awareness of the new framework, the resourcing of enforcement, and the position of experienced but unlicensed animal caregivers. Sir, Clause 24 of the bill requires the registrar to publish on the Council's website the names, practice details, qualifications, and registration dates of all duly qualified veterinarians. This is a commendable transparency provision. For the first time, pet owners will have a single authoritative register to verify that the person treating the animal is properly qualified. But a register is only useful if people know it exists and know how to use it. The bill creates new legal categories that will be unfamiliar to most Singaporeans. A duly qualified veterinarian is defined in Clause 3 as a registered veterinarian with a valid practicing certificate, excluding those whose registration or certificate is suspended. There are 3 tiers to registration: full, restricted, and specialist. Each carries different conditions and scope of practice. Pet owners will need to understand that this distinction means it in practical terms. For example, that a veterinarian with restricted registration may only practice at specific establishment or under supervision. The bill also creates new offences. Under Clause 29, it is illegal for an unqualified individual to practice veterinary medicine. Under Clause 30 to 33, it is an offence to falsely represent oneself or another as a qualified veterinarian. But these protections are only effective if pet owners know that unqualified practice is now a criminal offence and know how to report suspected violations. I will ask the Minister 2 questions. First, beyond the standard communications, will the government work with veterinary clinics, pet businesses, and community organizations to bring awareness directly to the point of service? For instance, through mandatory display of registration status at clinics, or through pet licensing touchpoints where owners already interact with AVS. Second, will the government ensure that complaint channels are not only available but prominently publicized, so that the offence provisions under Clause 29 to 33 have real deterrent effect? The consumer protection promise of this bill depends not just on public education, but on the right kind of public education, one that reaches pet owners at the point of service and empowers them to use the tools this bill provides. Sir, the bill creates a robust enforcement toolkit. Clause 29(6) makes unqualified practice an offence punishable by a fine of up to 50,000 and imprisonment of up to 12 months. Clauses 30 to 33 criminalize false representation. Clause 79 empowers the appointment of investigators, and Clause 73 sets out their powers to conduct investigations. Clause 83 allows the composition of offences, that is, settling matters out of court with a fine. Clause 85 confers jurisdiction on magistrates, courts, and district courts. These are strong provisions, but provisions on paper do not enforce themselves. The bill does not specify who will carry out enforcement on the ground. The Animal and Veterinary Service under NPARKS will presumably continue in its existing regulatory role over veterinary clinics and animal-related businesses. but the new framework adds substantial responsibilities: investigating complaints of unqualified practice, supporting the Veterinary Council's disciplinary machinery, monitoring compliance with registration conditions and continuing education requirements, and building institutional expertise in a regulatory function that has not previously existed at this scale. I will ask the Minister 4 questions. First, what additional enforcement resources does the government intend to allocate to support the implementation of this bill? Second, will there be a dedicated enforcement unit, or will these functions be absorbed into AVS's existing operations? Third, how many investigators does the government anticipate appointing in the initial years? And fourth, will enforcement capacity be progressively scaled up as the framework matures and eventually extend to cover veterinary nurses? Sir, lastly, I wish to raise a matter that is sensitive but important: the position of experienced individuals in our community who care for animals but do not hold veterinary qualifications. Singapore has a dedicated community of animal caregivers. They include wildlife rehabilitators who nurse injured birds and monitor otters. They include community animal feeders who look after stray and community cats, sometimes treating minor wounds or administering basic medication. They include shelter workers and volunteers at animal welfare, organizations who provide day-to-day care and first response for animals in distress. Many of these individuals have developed significant practical knowledge over years, even decades of hands-on experience. They perform an invaluable service for animal welfare in Singapore, if often without compensation and at their own expense. The bill's definition of the practice of veterinary medicine in Clause 2 is broad. It covers diagnosis of disease or injury, medical treatment, the administration of anesthetics, drug prescription, and the issuance of professional certificates. Under Clause 29(1), it is an offense for anyone who is not a duly qualified veterinarian to practice veterinary services. Some of the activities currently performed by community animal caregivers could, on a broad reading, fall within this definition. I note that the bill does provide an important exception. Clause 29(5) allows non-veterinarians to perform certain acts within the practice of veterinary medicine, provided these acts are not excluded acts and are performed under the supervision of a duly qualified veterinarian and in accordance with prescribed conditions. The excluded acts defined in Clause 29(7), which include diagnosis, surgery, drug prescription, and the issuance of professional certificates, are strictly reserved for veterinarians. This is appropriate, and I do not have any qualms with it. However, the practical boundaries of this exception remain unclear. What constitutes supervision in the context of community animal care, where there is typically no veterinarian on site? What are the prescribed conditions that will govern this exception? Can a community caregiver clean and dress a wound on a community cat without breaching the law? Can a wildlife rehabilitator administer oral rehydration to an injured bird? These are not hypothetical questions. They describe activities that take place every day in Singapore. The answers will depend on the regulations that are eventually prescribed under this bill. I ask the Minister 4 questions. First, will the government engage the animal welfare organization and community caregivers in developing the subsidiary regulations under this bill? Second, will there be a transition period during which enforcement action is not taken against bona fide community caregivers performing basic first aid? Third, does the government intend to exercise the exemption power under Clause 86 to provide the specific carve-outs for community animal welfare activities? And fourth, will the government consider developing clear, practical guidelines distinct from the regulations themselves that explain in plain language what community caregivers can and cannot do under the new framework? The community animal care sector in Singapore operates largely on goodwill, compassion, and volunteer effort. We should regulate to protect animals, not inadvertently criminalize the very people who have been protecting them. Sir, as a cat parent, I want to know that the professionals caring for my animals are qualified, accountable, and held to high standards. This bill promises to deliver on that assurance. but assurance on paper must translate to confidence in practice. Pet owners must be empowered to use the register and recognize unqualified practice. Enforcement must be resourced to match the ambition of this framework. And the community caregivers who have been looking after Singapore's animals long before this bill, the volunteers who feed community cats, nurse injured wildlife, and staff our shelters must not find themselves on the wrong side of a law meant to protect the very animals they serve. Notwithstanding my queries and clarifications, I support the bill. Thank you.
Mr. David Ho.
Mr. Deputy Speaker, I'm speaking in support of the Veterinary Practice Bill. MPACS noted during a public consultation that Singapore has over 690 licensed veterinarians in October 2025. This is 5.5 times more than the number in 2006. This shows that the sector has grown in size, scope, and complexity since then. As pet ownership rises, the range of treatments also expands. Our laws must keep pace. And this is exactly what this bill is trying to do by ensuring that there's qualified care given. This bill matters because public concerns about animal welfare and accountability has sharpened over the years, including after high-profile incidents in the wider animal care ecosystem. But beyond individual incidents, I observe a deeper shift that is taking place in this country. As Singapore progressed beyond our first 60 years, our sense of compassion is also broadening. More people don't just only care about themselves and also just human outcomes, but they also care about the welfare of animals around them. And I see this in every single day setting. In Clementi, for instance, some residents are deeply committed to caring for community cats' well-being. In October 2025, I organized a convening between Clementi residents, NPACS, AVS, and town councils, where views were actively and passionately aired about how animal welfare can be better safeguarded. Their concerns are not abstract. They speak from daily caregiving experiences. They want to see animals live well, cared for, and a system that responds more compassionately and effectively. What stood out to me was that the residents weren't asking for more rules. They were asking for clearer processes, greater empathy, and a stronger confidence that the relevant systems would work well for the animal welfare's concern. It is against this backdrop I support the bill because it entails guardrails for animal welfare by ensuring baseline through needing prescribed qualifications for veterinarians. However, I have three broad concerns and I hope the government can address. First, it's about the accessibility and talent pipeline for the veterinarian profession. You see, when I speak to young people about their aspirations, their responses are highly diverse. Some want to be lawyers, some want to be doctors, some want to be pilot. But there are also some that tells me that I want to be a vet when I grow older. And this is also reflected in my recent Clementi community run, where you've shared with me when she was much younger. She aspired to be an animal doctor then. But this particular aspiration usually comes from something simple. When I ask, why? This aspiration is shaped by their lived experience, a visit to the zoo, caring for a pet at home, or even just wandering around neighborhood shops looking at the pet shops. You see, it is my belief that in Singapore, we must be able to tell every single child that their aspirations can be realized and is not a function of their family income. While I appreciate this bill providing greater clarity on the qualification and registration framework for those who want to practice as veterinarian in Singapore, I would like to invite you now to join me on a journey to realize what does it take to realize this aspiration. To be fair, the landscape has improved because before 2018, the only way that you can pursue to become a veterinarian, to pursue the relevant qualification, is to do this overseas. Now, today, NUS Life Sciences concurrent program with University of Melbourne Doctor of Veterinary Medicine, or known as DVM, is a pathway to be able to get such qualification. However, it is relatively costly in terms of time, commitment, and also finances. First, you need to first spend 5 regular semesters in NUS, then following a year in Melbourne to read the first year of DVM. Continue with 3 more years as a full-time international student in Melbourne to complete this DVM. The University of Melbourne international tuition fees for DVM is nearly 86,000 Australian dollars per year as of 2026. This means a student would typically have to pay 300,000 Singapore dollars or more in tuition fees to be able to complete this concurrent degree program. There are also other hidden costs as well, such as accommodation, transportation, and daily necessities. So, while this is a good thing that we have at least a local link pathway, the financial barriers are real. I say this not as a criticism of this bill, because after all, this is not a higher education bill. But once Parliament put a stronger statutory framework for this particular profession, then I think it's reasonable that we ask whether we can enhance our talent development strategy in this particular sector. I therefore ask MND, NParks, and also MOE, and as well as our Institute of Higher Learnings, whether we can study how to be more deliberate to reduce the financial barriers before enrolling into such programs. Now, this could take in the form of these few things: a bonded scholarship, bursary, enhanced study grants, structured sponsorship for Singaporeans prepared to serve in the sector after graduation. If deeper institution partnerships are explored over time, perhaps government and our IHLs can also study what are the ways to moderate cost burden for students on such concurrent program pathways. So the overseas component doesn't become a decisive barrier. For example, can they still pay local school fees while studying abroad? Because this is quite similar to students when they go overseas for exchange. I note positively that there are existing schemes. Let me share some. NParks Study Grants Program supports Singapore citizens pursuing a full-time veterinary program in an accredited overseas university. And also, NParks Peter Lim Scholarship explicitly support less privileged youths pursuing careers in veterinary and animal science sector. This, in my view, are good moves. But my question is, are they enough relative to the cost and the length of the pathways? And whether there could be more upstream support needed so that talent is not simply lost because this route is too expensive. NParks itself has said that pet ownership is on the rise, and Singapore's veterinary sector is expanding to meet this growing demand for high-quality animal care. At the same time, Singaporeans' households are keeping pets. Expectation of care have also risen. In fact, I also do know of a number of Clementi residents that recently just did a career switch to go into the animal care industry. So, when we talk about building pipeline to this profession, we are not planning for a shrinking sector because the demand looks to me like it's likely going to continue rising. Against this backdrop, I also wonder whether should we consider a full local DVM program hosted by one of our autonomous universities, as well as maybe degree partnership where we have more locally delivered components for our current local foreign veterinary program offerings, stronger clinical placement arrangement. More broadly, I want to be able to look at every single child in Singapore and say that your aspiration matters. We have the pathways and structures to enable you to realize your aspiration, and your aspiration is not a function of your family's income. I recognize that the points that I've raised cuts across the purview of several ministries, MOE, MOM, and it doesn't strictly fall under the purview of MND. But in the spirit of a whole of government collaboration, and since this bill established a legal framework that defines who can practice as a vet, then the broader question is how do we develop pipeline into this profession should also be considered. I kid you not, I hesitated for a while and I asked myself whether should I even raise this, because what I've just raised goes beyond the strict 4 corners of the bill. But I choose to do so because I believe Singapore must be a place where passion is made possible and not quietly limited by cost constraints. Second, I hope the Minister can also focus on developing wider talent pipeline for veterinary and animal care ecosystem broadly. This is because a strong animal care sector does not only run on veterinarians, it also requires veterinary technicians, nurse, animal care workers, and other support roles. In this regard, Temasek Poly already offer a diploma in veterinary technology, and SAF sector career page lists that this particular diploma is a full-time pathway into a broader agri-food and animal care space. However, at the ITE level, I realized that a publicly visible offering seems to be shorter courses or part-time animal care and grooming programs, such as basic aquatic animal care with a course duration of 7 hours and a certificate of competency in dog care and grooming with a duration of 14 hours. As it stands today, I'm really not sure whether there are fuller ITE pathways relevant to veterinary or animal care work. It would be helpful for the ministry to be able to clarify this. If the response is no or not yet, then I hope the government will consider more structured pathways to be developed over time, especially since NParks have already said in the longer term, the Veterinary Council will also regulate veterinary nurses, which will play an important role in supporting animal care. This matters because a good system allows people with different strengths, academic profiles, and financial starting points to contribute meaningfully. Not everyone will become a vet, but many can still play a part in this high-quality animal care ecosystem if we build proper pathways there. My third point concerns public assurance, governance, and how this framework will work in practice. I spoke at length about pathways. Now, let me move to Clause 18, which introduces a category known as restricted registration for individuals who may not hold qualification from prescribed university, but they demonstrate necessary training, knowledge, skills, and experience. For pet owners and animal lovers, this clarity of this area is important because when the Council is expected to also provide more details at a later point, clear public communication on what this restricted registration allow or does not allow to do matters because it gives pet owners that level of security to know who is giving their pet care and what can they do. I also support the composition of Veterinary Council, which include experienced veterinarians and layperson. However, I would like to have a little bit more of elaboration on what exactly are the expertise are we looking at the layperson? What are they expected to bring to the table? What are the broad considerations that will guide their selection? I would also appreciate some clarification on the requirement to have at least a fully registered vet on the council because it says that it must have at least 10 years of experience as a vet. Does this mean continuous practice or cumulative practice over time? And what reference point does experience start counting from? Why I ask? Because some vet or some animal doctors might take a career break at some point and return. So during the moment that they return and when they have first started, do we look at this years as part of the 10 years of experience as a vet? On disciplinary matters, I welcome the bill because it provides a more developed framework for complaints assessment, disciplinary committees, interim orders, investigation, appeals, and penalties. NParks has said that this framework has developed with reference on professional regimes in healthcare and the built environment, as well as overseas veterinary statutory boards. This is reassuring, especially because the bill itself says that for unauthorized practice and related misconduct also carry a significant penalties of 50,000 fine and or up to 12 months of imprisonment. However, I would like to clarify how did MND arrive at this and what benchmark were they using to determine this? At the end of the day, we want to be able to ensure that the cost of committing a crime is high enough that it will deter others from doing it. More broadly, I would also like to understand how the appeals framework will operate in practice. For example, if a certain appeal is routed to the minister or where decisions are made across different stages that involve the same bodies, there may be question on how independent and clearly separated the processes are perceived to be. In professional regulatory system, it is not only just actual fairness that matters, but it's also perceived neutrality. So it would be helpful if the ministry can clarify how the framework has been designed to ensure that confidence can be maintained on both fronts. Mr. Deputy Speaker, in closing, this bill, it plays an important step in building a stronger and a more credible veterinary profession in Singapore. It gives pet owners greater assurance, gives professionals clearer legal footing, and gives the public stronger grounds on what standards to expect. But the job doesn't end with regulation alone. We should also make pathways into this profession more accessible, make standards clearer for the public, and build a system done well in preventing potential harm to our pets and our animals. If we get this right, then I will be also able to say to a young Singaporean that if your dream, your aspiration is to be an animal doctor, there are clear pathways and structures for you to get there. And for you to achieve this aspiration, it is never a function of your family's income. Thank you.
Associate Professor James Lim.
So when I was a little boy, like so many children, I wanted a pet dog. Growing up with asthma, however, the doctors advised against it. Yet my family, especially my mother, loved animals. And when I went abroad to study, Mom seized the opportunity to adopt a mini schnauzer. She named her Carmel. Unfortunately, in 2018, Carmel suffered a heart attack. At the time, we didn't have a car, but lived about a half kilometer away from an animal hospital. I vividly recall carrying her trembling body and the two of us running in our flip-flops to the facility. Sadly, we were too late, and despite the best efforts of the vet there, we lost Carmel. My mother went into mourning for a month. For those of us that have loved and lost pets, you would understand how that feels. They aren't just an animal. They're part of the family. Mom would have spared no expense to save her beloved Carmel, even if she had been informed in advance that the chances were slim. In that instance, we had little reason to believe that the veterinary team wasn't trying their best to save our pet. And I'm sure this is the case for almost all cases handled by animal professionals. But complications arise whenever an animal dies. In cases like these, the grieving family may seek an outlet for blame, whether justified or not. Sometimes the vet may indeed have been negligent. Other times, they, as humans, may have made inadvertent errors. Yet other times, they may have done everything possible, but their interventions were simply ineffective. This is why I support the formation of the Veterinary Council, the principal focus of Part 2 of the bill. The Council appears similar to other professional bodies of this nature, such as the Medical Council, Law Society, or Board of Architects, and will go some way toward adjudicating cases that fall into the gray areas. This task currently falls to the AVA. However, I believe that most will agree that adjudication over sophisticated technical judgments is best undertaken by a jury of like-minded, comparably skilled peers. While the AVA can, and currently does, credibly perform this role, it will always be a continuous challenge to resource this capacity, rather than to decentralize the regulatory process to other expert voices, such as a council. There are, of course, residual concerns typical of all such self-regulatory settings that such a body may choose to protect their own. And even in the absence of explicit bias, the similarity of background and training may predispose such veterinarians to groupthink, imparting an implicit bias that would be more forgiving of otherwise unforgivable errors and mistakes. There is no perfect solution to this, other than to point out that there are actually well-understood mechanisms to mitigate such a risk. Common strategies include providing an alternative channel of appeal or an escalation mechanism should the first decision be deemed unsatisfactory. I believe Clause 20, Part A, 8 of the bill provides as a standard for this government's legislative approach for recourse via appeal to the minister. I would be interested to know if there are any plans for a second-tier peer review for Veterinary Council decisions prior to such appeal. Might the Interim Orders Committee, detailed in Clause 68, be such a body seeing that they are vested with the authority to revoke, vary, or replace orders. Another safeguard, which is currently implicit in the bill, is to ensure that not just the supply but also the demand side of the equation is being represented on the Council. According to NParks, the public consultation accompanying the bill did raise suggestions for broader representation. Now, Clause 4, Part 3b does stipulate that 2 individuals should be lay persons, but it is unclear how informed these members would be about consumer affairs. Will the minister commit to appointing consumer-side advocates for these positions, such as animal welfare group or pet owner association representatives? Relatedly, to prevent an overrepresentation of large holding groups or private equity-linked roll-ups, it may be wise to also ensure that 1 seat be taken up by a veterinary professional hailing from an independent clinic. A third channel for avoiding regulatory capture and conflicts of interest is to make clear what recusal protocols and conflict of interest mandates are in place to ensure that, in instances of investigative or disciplinary committee formation, the selected individuals do not have a clear pecuniary interest in the outcome. This is especially important given the small size of the veterinary fraternity, which numbers only in the hundreds. So, Part 5 of the bill is concerned with the investigation and disciplinary matters. In my view, this is the heart of the bill because a regulatory framework is only as strong as the practical implementation of fair and effective investigative actions, followed by reasonable and acceptable disciplinary procedures. I say this in part because, based on the experience of at least one of my residents, the prior regime may have fallen short. That resident has alleged that key documents submitted to AVS for investigation did not appear to be independently verified for authenticity. This, in turn, undermined her confidence in accountability of the whole process. To be clear, I am not insinuating that there was or was not lapses in her specific case. However, I'm sure that all in this House would agree that public trust and confidence in procedure is of utmost importance, regardless of whether these procedures associated with the investigation and disposal of cases are justifiable or defensible. I note that Part 6 of the bill does confer a substantial degree of independence and authority to investigators to go about their business, which I agree with. That said, I wonder if the minister would be willing to share how they expect investigators to proceed with the verification process for evidentiary documents submitted to them. Will there be some independent corroboration of the provenance of these documents? Will the investigators seek out other credible authorities and agencies, such as the Singapore Police Force, to support the investigation process if necessary? I will leave us with one final thought, albeit slightly outside the formal scope of the present bill. Beyond veterinary practice, we must also continue to refine our laws that protect the welfare of animals in line with the spirit of the bill. Recent events, such as the well-reported cases of abuse of cats at Everton Park in Punggol and the throwing of cats off high floors, hint at the disturbing rise in recorded cases of cruelty inflicted on animals. Indeed, even as confirmed cases fell from 961 in 2024 to 608 last year, the absolute number is not befitting of an educated populace and advanced society. Now I understand that MND is undertaking a review of the Animals and Birds Act, which was last amended in 2014. As of March this year, this is still ongoing. Would the minister be willing to share when this review is expected to conclude and when we might expect a bill to be debated in this House? Sir, I believe that nobody speaking on this bill is suggesting that animal welfare be placed at the same level as human welfare. There are many instances, especially when we go about our estate management matters, where we often need to take difficult decisions about prioritizing our residents' legitimate concerns about noise and hygiene against the desire to cherish animals that live alongside us. Still, in any advanced society, we must hold ourselves to a standard of how we treat other living things in our midst. This principle becomes even more stark when, as is often the case with veterinary services, we are dealing with the lives of animals that are often regarded as part of the household. This bill is a natural step in ensuring that our furry friends and family are treated right by those tasked with their physiological well-being. I support the bill.
Dr. Chu Pei Ling.
Mr. Deputy Speaker, I would like to declare that I am a registered allied health professional in both Singapore and the United Kingdom, regulated by the Allied Health Professions Council and the Health and Care Professions Council, as well as a member of the Singapore Physiotherapy Association and the Chartered Society of Physiotherapy in the UK. So, this bill speaks to something I have seen very clearly in healthcare: how trust in a profession is built and how easily it can be eroded if we are not careful. In Tengah, many of my residents are young families and many have pets. They tell me they want more places to walk with them, to sit with them after a meal, to let them run safely. It reflects something simple, that pets are part of everyday life. But when something goes wrong, the conversation changes. One Tengah resident told me she hesitated when her pet needed treatment, not because she did not care, but because she was not sure what she was agreeing to. And I think many people will recognize this. Because when something goes wrong, it's not just the bill that people worry about, it's whether they are making the right decision at all. And that is why this bill matters. Because at its core, this bill is about trust. But in practice, people don't read regulations. They read people, and they trust what they see in front of them. So if we want to build trust, we must make sure what they see is clear, consistent, and credible. That is why the direction of this bill is the right one: establishing a veterinary council, strengthening registration, requiring continuing professional education, and putting in place a clear disciplinary framework. These are not just regulatory changes. They are the foundations of a profession that people can have confidence in. But if we are serious about trust, then we must also be very deliberate about how we design it. The first is the Veterinary Council itself. The Council will shape standards, oversee conduct, and influence how the profession evolves. It must be credible to the profession, and it must be trusted by the public. That means having the right mix of expertise across different areas of practice and processes that are clearly fair and impartial. It also means that where serious disciplinary findings are made, that they are communicated with sufficient clarity so that both professionals and the public understand what is expected. Because if people cannot see how standards are applied, they will not feel assured that they exist. The second is clarity in qualifications and titles. For most people, trust begins with what they see: a name, a designation, a title. And the reality is this: most people will not know the difference between one qualification and another, but they will live with the consequences. So what matters is not just how qualifications are assessed, but how clearly they are understood. There should be transparency in what is recognized, how specialist titles are determined, and what these mean in practice. Because a title can reassure even when it should not. And if we are not careful, that reassurance can be misplaced. The third is how we approach restricted practice. Such pathways serve a purpose. They allow entry into the profession while maintaining safeguards. But we must be careful. Because if we are not careful, what starts as a pathway can quietly become a standard. So there must be clarity on scope, on progression, and on how competence is assessed over time. And we should think carefully about who is entrusted to train others. Because who we allow to train matters. That is how standards rise or slip. In healthcare, supervision is not a formality. It is a safeguard. And that principle applies just as strongly here. The fourth is continuing professional education. This is essential, but it is also where intent and implementation can diverge. If it becomes a matter of ticking boxes rather than strengthening practice, then we risk losing its purpose. So as this framework develops, it will be important to ensure that it remains meaningful, relevant, and reflective of how practice continues to evolve. Mr. Deputy Speaker, let me return to something residents raise often. It is not simply that veterinary cost is expensive. It's not just that care is expensive, it's that people don't know where it will end. Once they say yes, they feel that they have to keep saying yes. And that is a difficult position for any family. Not because they do not love their pet, but because they are unsure. And over time, that uncertainty changes how people feel about the entire system. While pricing may sit outside the scope of this bill, transparency is something we can strengthen. Clearer communication, better upfront estimates, and a more consistent approach across the sector would go a long way. Because when people do not understand the cost, they begin to question the care. And that is something that we should not allow to take root. Finally, this bill also points to the future of veterinary care. Care today is no longer delivered by one person alone. It is delivered by teams, veterinarians, nurses, rehabilitation professionals, and many others. If we want better outcomes, then we must think ahead in how we structure this wider ecosystem with clear roles, clear standards, and clear accountability. Because good professionals matter, but the system around them matters just as much. Mr. Deputy Speaker, this bill reflects how our society has evolved and how expectations of care have grown. But the real measure of its success will not be in what we pass today. It will be in what people experience tomorrow. Because in the end, how we treat animals says something about us. But how we organize care, that says even more. I support the bill and I look forward to the Minister's response on these points. Thank you.
Associate Professor James Lim, do you have a clarification of your previous speech? Please go ahead.
Sir, I was informed earlier that when I said Everton Park and Pongo, it came across as Everton Park in Pongo. I just wish to state for the record that it was an and as a conjunction and not in.
Anything else?
No, sir. Thank you.
Mr. Kenneth Tiong.
So I have 3 points to clarify on the veterinary practice bill. First, the bill sets up Singapore's first veterinary council, and the aim to raise standards is welcome. But every council member is picked by a minister who can remove any member for any reason and hears a final appeal against the council's recommendations. The Medical Council and the Dental Council both have, by statute, elected members from the profession, 12 out of 27 for the Medical Council and 5 out of 13 for the Dental Council. Why depart from that statutory elected member model here, and what safeguards ensure vets have a real voice in their own oversight? The consultation outcome did promise to include veterinary professionals on the council, but unlike the Medical Registration Act and the Dental Registration Act, the bill does not make that representation statutory. Second, smaller practices will likely bear a heavier burden from future council rules than chains like Mars Veterinary Health, which runs at least 19 out of Singapore's 121 licensed vet centers, about 1 in 6. Regulatory costs that are marginal for a large chain can be more significant for a small practice. Section 87.3 states, quote, regulations made under this Act may make different provisions or prescribe different fees for different classes of persons or different circumstances, end quote. And all regulations require the Minister's approval under 87.1 and 87.2. Will the Ministry commit to using the differential fee power in Section 87.3 to ensure that regulatory costs do not accelerate the consolidation the vet profession is already experiencing? Since no regulation the Council makes can take effect without the Minister's approval, I would urge the Ministry to assess, before granting that approval, whether compliance costs fall proportionately on small practices relative to their fixed cost base, and to require the Council to invoke Section 87.3 where they do not. Third, the bill sets a standard, but there can be multiple paths to meet it. Singapore has no veterinary degree program. All 690 plus practicing veterinarians trained overseas.
When member Ms. Valerie Lee asked MOE in February 2026 about introducing a local veterinary science degree, the reply was that MOE would monitor and assess. I, like my colleague Mr. Louis Chua and member Mr. David Ho, support the idea of a local vet degree. If the goal is higher standards, why not build a local training path that can better guarantee those standards and give Singaporeans who want to become vets a route that does not need a costly overseas degree? There is a strong regional case for this. No veterinary degree program in any ASEAN member state currently holds accreditation from the American Veterinary Medical Association, the Royal College of Veterinary Surgeons, or the Australasian Veterinary Boards Council, the three bodies whose recognition permits practice in North America, the UK and Europe, and Australasia respectively. A Singapore-based program that secures any of these accreditations, taught in English within a globally recognized university system, would be a unique regional asset. I look forward to the Ministry's reply. Thank you. And in advance of 25th April, I'd like to wish all our vets, vet nurses, and everyone who works with animals a happy World Veterinary Day.
Ms. Diana Pang.
Mr. Speaker, sir, I rise in support for the Veterinary Practice Bill. As a fellow pet owner, I believe this registration is both timely and essential. It rightly acknowledges the critical role the vets play, not just in safeguarding the animal health, but also in providing a peace of mind to families who entrusted beloved pets to their care. With the increasing prevalence of pets ownership and our rising expectation for animal welfare, establishing a clearer and more robust framework for this profession is necessary and forward-thinking step. I commend the government for bringing this important bill forward. As this field continues to evolve, it is crucial that we ensure law enhances standards without inadvertently placing undue pressures on the sector. For many Singaporeans, practical concerns loom large. The affordability of the bill, the meaningful and insurance options, the adequacy of local training for future vets, and the presence of a reliable safety net for severe complications. Therefore, while I wholeheartedly support the bill, I urge the government to use this opportunity to think more brightly about the sector. First, a significant concern for many pet owners is the escalating cost of the bills. While most owners are committed to providing responsible care, the cumulative expenses of diagnostic tests, surgeries, hospital stays, and follow-up treatments can lead to unexpected and substantial bills. For some families, this presents a genuine affordability challenges, sometimes forcing them to delay or decline necessary treatment, or to struggle financially even they wish to do the best for the fur child. As we elevate professional standards, it is equally important to explore ways to make the care more accessible and manageable. I hope the government will investigate strategies to improve affordability and price transparency, ensuring that the pet owners are not left feeling shocked, helpless when critical medical interventions are required. Second, insurance and whether there should be a compensation fund. The role of insurance in mitigating the financial impact veterinarian care is undeniable. However, many pet owners may lack clarity on the available policies, their precise coverage, or the practicalities of making these claims. Some may even believe they are adequately covered, only later to discover the exclusions, limitations, or when the treatments become absolutely necessary. So while educating the public about the pet insurance is vital, I propose a more comprehensive approach. Do consider the establishment of a compensation fund, potentially pooled across the profession. This fund could serve as a crucial safety net in serious cases where a veterinarian's negligence results in loss, where insurance proves inadequate, unavailable, or has lapsed. We see similar concepts in other professions. For instance, the legal profession has a compensation fund. The Motor Insurance Bureau of Singapore provides compensation for victims of uninsured or untraceable drivers. I believe the veterinarian sector should explore a similar industry-wide pool fund as a last resort, ensuring that pet owners are not left without a practical remedy when unforeseen circumstances arise. Third, as a profession involved, advertising should also be approached with care. With some degree of advertising may be acceptable, It should also be governed by stringent ethical guidelines. Veterinary services are not mere commercial commodities. They involve professional judgment, public trust, and the welfare of animals. Advertising should therefore be free from misleading claims, exaggeration, aggressive techniques, and this could pressure clinics into prioritizing commercial competition over professional standards. I propose that the government implement an advertising framework that ensures fairness to all vets, avoiding any tilt in favor of larger corporation entities with greater marketing resources. Such a move would help prevent smaller independent practices from being disadvantaged, thereby preserving the diversity, sustainability, and competition balance among the sector. Furthermore, an uncontrolled increase in marketing competition would inevitably drive up the business costs, which may ultimately be passed to pet owners. So I urge the government to ensure that any framework for the vet's advertising is underpinned by robust ethics safeguards, maintaining the professionalism, fairness, long-term sustainability for the sector. Fourth, the pipeline of future vets and whether Singapore should move towards a local vet school. As spoke by many of my colleagues in this parliament, if we want a strong veterinarian profession in Singapore, we must not think just about regulations. We should also think about training, about future pipelines of the vet. Today, Singapore still relies heavily on overseas education, while NUS is a pathway linked to University of Melbourne. It is not the same as having a fully local veterinarian degree training system here in Singapore. Studying overseas is costly, and this may not put the profession out of reach for many capable Singaporeans. So I ask the Minister whether the government has done a study on the demand for the studies in Singapore and how many local students each year have to study overseas if they want to become vets. I also ask whether the statistics support opening a full-time vet school in Singapore, and if so, how would such a school or course be regulated, and how clinical training would be supervised, and how specialist training will fit within the registration framework under the bill. If we care about the standards, access, and long-term resilience, then the pipeline matters. A stronger local pathway can help Singaporeans and Singapore build a deeper bench of veterinarians with local knowledge and long-term commitment. I also want to raise one specific issue on the disciplinary framework under the bill. The bill allows Interim Orders Committee, or the IOC, to suspend or restrict a vet for up to 18 months, even before the disciplinary matter is finally decided. This is serious stuff, affecting livelihood, reputation, and the right to practice. Yet, unlike the disciplinary committee, there does not appear to be a requirement for the legal profession to sit on the IOC itself. I therefore ask why no legal profession is specifically required at this stage. Where powers of this seriousness are exercised, it would be good to have a legal profession on the IOC to provide safeguard against procedure, substantive irregularities and errors, and to uphold rules of fairness, procedure justice during disciplinary proceeding for vets. 6, pro bono and community veterinary support. Every profession has a role to play in social responsibility. In a sector that intersects with both animal welfare and the well-being of household, we should explore the potential for pro bono or community veterinary support, particularly for low-income pet owners, urgent welfare cases, and rescue organizations. I'm not suggesting obligatory burden on every clinic, but the sector, in collaboration with the government, could explore more structured support mechanism for genuine cases of need. One practical step could be involving the vets declaring their pro bono hours during their annual license renewal, or consider this as part of the CPE. This would enable the ministry to track such contributions and foster a stronger culture of service, community engagements among the veterinarians. Mr. Speaker, sir, while I support this bill, I hope we will not regard this as the end of the conversation. A truly effective veterinary service system is one that not only regulates professions adeptly, but also one that ordinary Singaporeans trust, understand, and assess. It must provide robust protection for the public in serious situations, strengthen our local pipelines for future vets, ensure disciplinary powers are wielded with appropriate safeguard, maintain a fair and sustainable professional landscape as the sector continues to evolve. This is for all these reasons I support the bill. Thank you.
Hold on, Mr. Dr. Hamid Razak. MOS Elvin Tan, you have a clarification of a member who has spoken before you. Who, please?
Thank you, Deputy Speaker. I just wanted to clarify with member Associate Professor James Lim with regards to the statements he made earlier on about Part 5 of the bill. I quote that the member had said that based on the experience of at least one of my residents, the prior regime may have fallen short, and that the resident had alleged that the key documents submitted to AVS for investigation did not appear to be independently verified for authenticity. This in turn undermined her confidence in the accountability of the whole process. This is an important clarification because it also calls into question the standard of the AVS and our officers. And so I would like for the member to qualify this, because you also mentioned that it is at least one resident. Thank you.
Associate Professor James Lim, would you like to reply to that invitation? Please proceed.
Thank you, Speaker. So this was an incident where the resident had filed multiple appeals. I'm sure that you can check with the ministry with regard to the chain of events. To be clear, I represented her case, and I also said in my speech that I was not insinuating whether there were any lapses in her case or not by the AVS. But the point I was trying to make, and I'll repeat it here, is that public trust and confidence in procedure is really important. And that's why I supported Part 6 of the bill, which confers a degree of independence and authority to investigators to go about their process of investigation, which I'm sure in her case would lend her greater confidence. I also wanted to share a point that she had also asked me to share about ensuring that the verification process for evidentiary documents submitted to the authorities would also involve some degree of independent corroboration about the provenance. So I mentioned those in my speech, and I'll reiterate that here.
MOS Elvin Tan, would you like to respond to that?
Yeah. So I thank the member for clarifying. Indeed, we will go back and check with AVS and any correspondence between the member representing your resident and ourselves. And I agree with you that public confidence and trust is important. At the same time, we will have to substantiate any of these allegations to ensure that public trust is withheld, of course, with AVS as well as other public institutions. So we'll get back to the member, and if the member has any further queries, please feel free to direct them to me, and so we can verify. Thank you.
Associate Professor James Lim, to be fair to you, is there anything else you wish to add in response?
No, Speaker, other than to just point out once again that I was not taking a position on whether that questioned the professionalism of AVS, but rather representing her sentiments, which, as I mentioned in my speech, when you are a grieving parent to a fur baby, you might understandably be aggrieved and wish to look for an outlet.
No further clarifications? Then we will move on. Dr. Hamid Razak.
Mr. Deputy Speaker, sir, I rise in support of the Veterinary Practice Bill. This bill is timely because veterinary care today sits at the intersection of animal welfare, public trust, and public health. As we have seen, as pet ownership rises, so too does expectations of care. Our regulatory frameworks must keep pace, not just to deter poor practice, but to protect good professionals and strengthen confidence among pet owners and the wider community. Mr. Deputy Speaker, Sir, NParks conducted a public consultation from 31st October to 28 November last year and received 103 responses. This number reflects a sector and a public that both care deeply about standards, fairness, and clarity. This bill, too, advances that direction in a very structured way. I will raise 3 points in the spirit of strengthening implementation so that the bill uplifts standards while preserving access and trust. Mr. Deputy Speaker, sir, the first point is on workforce sustainability. Official consultation materials note that 690 or over licensed veterinarians as of October 2025. Now, beyond veterinarians, there are around 1,000 to 1,500 veterinary nurses and technicians in Singapore. Mr. Deputy Speaker, sir, we've also seen encouraging progress in responsible pet ownership. Since the cat management framework began on 1st September 2024, about 41,000 pet cats have been licensed and over 41,500 people completed the online pet ownership course required for first-time applicants. These efforts work best when they are matched by a professional framework that keeps the standards clear, trusted, and consistent. As we raise standards, we should also keep a close eye on a very simple reality. If standards rise while supply tightens, the lived outcome for pet owners may be longer waits, higher costs, and delayed care. This, of course, is not the intent of this bill. This bill provides levers for calibrated professionalization. It allows the Council to impose conditions on registration, including supervised practice, performance review, limits to setting, and limits to scope for defined periods to support safe entry and progression. In this regard, I would like to seek the Ministry's clarification on 2 practical areas. First, how will recognition pathways, including for overseas trained veterinarians, be made clear and predictable while maintaining standards? The bill provides for prescribed qualifications and also for Council assessment of other qualifications and competence, including examinations where appropriate. Clear published guidelines will reduce uncertainty and support consistency. Now, this is similar to the first and second schedules of the Medical Registration Act, where both local and overseas qualifications are listed. Now, second, what complementary measures will support retention and career development? Regulation is not only about disciplining errant practice, it is also about sustaining the workforce so that good professionals can stay and grow. I would not like to belabor the point, but like to echo the points made by colleagues in the chamber earlier, that for the longer-term pipeline, I really hope that MOE and the relevant agencies can keep under review whether there may be a case for a locally administered veterinary degree. Mr. Deputy Speaker, sir, good regulation should not only raise the bar, it should also widen the pathways for capable people to meet that bar safely and fairly. Next, Mr. Deputy Speaker, sir, my second point relates to affordability and consumer trust. The consultation feedback reflected public concerns about transparency and the pricing of veterinary services. NParks has also been clear that this bill or the scope of this bill does not cover pricing and fees matters, and that separate measures may be considered to address these concerns. Well, I do agree that the Veterinary Council itself should not be the price setter, but affordability is shaped by more than just price controls. It is shaped by transparency, clear communication, and the confidence that pet owners have when making often difficult decisions under time pressure. When treatment plans are especially complex and costs are uncertain, asymmetry between the provider and the consumer can lead to disputes, mistrust, and delayed care. That certainly does not help animal welfare, and it does not help the profession. So even if fees are outside this bill's scope, I encourage the Ministry and the Council to consider what can be done through professional standards and guidance to strengthen transparency in practice, clearer expectations around communications of options of treatment, informed consent, and upfront cost discussion, especially in urgent or high-stakes situation. This is again similar to the medical practice where financial counseling requirements come under the Haksa Act. This is not about policing fees, but it's about strengthening trust through clarity. Mr. Deputy Speaker, sir, my third point is a system-level one, the development of the whole animal care ecosystem. This bill defines what constitutes the practice of veterinary medicine. and draws boundaries around key acts that require professional judgment, such as diagnosis, surgical treatment, prescription, and certification. At the same time, the consultation outcome makes clear that specified groups, including students and other persons such as nurses, may perform a specified scope of activities under prescribed conditions and supervision. This is the right principle. It protects animals and the public by keeping core judgment where it belongs, while allowing team-based care to scale safely in a protected environment. But implementation will matter. I suggest two practical considerations. First, provide clear and plain guidance on safe delegation and team-based workflows, including what may be done under supervision, what documentation is expected, and how accountability is preserved. Second, I note the stated longer-term intention to regulate veterinary nurses with an adequate transition period. A phased approach is sensible, allowing engagement, capability building, and continuity of services while raising standards across the wider care team. Mr. Deputy Speaker, sir, I close with one guiding standard. Good regulation is not only how strongly we deter misconduct, it is how confidently good professionals can practice and how clearly citizens can navigate that system. I also note the importance of clarity in the roles of institutions. The consultation materials make clear that AVS would continue to regulate veterinary clinics and animal-related businesses and remain the first responder for animal feedback, while the Veterinary Council itself will regulate professional standards for veterinary practice. This division of responsibility should help the public know where to go to and help the sector operate with greater clarity, purpose, and confidence. With these observations, Deputy Speaker, sir, offered in the spirit of strengthening the implementation and preserving trust, I support the Veterinary Practice Bill. Thank you.
Mr. Lee Hong Chuang.
Mr. Deputy Speaker, I rise to support the Veterinary Practice Bill. I am delivering my speech in Mandarin. 在过去的10多年里，新加坡社会出现了一个很明显的变化，尤其在疫情期间跟疫情过后，越来越多的家庭开始养宠物。无论是在主屋社区，还是在公寓、私人住宅，我们都可以看到越来越多的居民带着他们的宠物散步、看诊或参与社区活动。对很多家庭来说，宠物已经不仅仅是动物，而是陪伴生活的重要成员。有人把宠物当成朋友，有人把它们当作家人。我认识一位养中型犬的朋友，曾经跟我分享他的故事。他说，自己去剪头发只花了几十块钱，但家里的小狗一次的剪发和护理需要花上100多块钱，每年还给小狗买保险，也花了几百块。平时买零食、买用品、做基本护理，样样加起来都是一笔不小的开支。但即使如此，还是有很多人愿意继续养狗、养猫、养其他的宠物，因为对他们来说，这已经不是单纯的养一只动物，而是真正把它们当作自己的家人。俗话说，人有情，动物亦有情。当社会对动物的态度逐渐改变时，我们的制度也需要与时俱进。副议长先生，随着养宠物家庭的增加，宠物医疗需求也明显的上升。从基本疫苗、健康检查到外科手术、专科诊疗，新加坡兽医的服务行业正在不断的发展和专业化。在这样的背景下，建立一个清晰、完善并具有公信力的兽医监管框架就显得非常重要。这项法案的 核心目标就是建立一个更加系统化的兽医行业监管制度。首先，法案设立了 Veterinary Council， 也就是兽医理事会，作为行业的专业监管机制，负责兽医注册、执业证书管理、行业标准制定以及纪律监管。其次，法案建立了更清晰的注册制度，包括全面注册、限制注册以及专科注册，并规定兽医必须持有有效的执业证书，才能从事兽医医疗活动。第三，法案明确规定，只有具备资格的注册兽医才可以进行诊断、手术、开具药方、处方或出具医疗证明，从而保障动物医疗服务的专业性与安全性。同时，法案也建立了完整的投诉与纪律机制，使公众在遇到专业问题时有明确的渠道可以提出投诉并获得处理。副议长先生，在我看来，这项法案的意义不仅仅在于行业监管，更是提升公众对兽医行业的信任。当宠物成为家庭成员时，人们对兽医服务的期望也自然的提高。一个清晰、公正、专业和监管的制度，不仅能够保护动物的健康和福利，也能够保障宠物主人的权益。古人说：“制度立，则人心安。”当公众知道行业有明确的标准、有监管、有问责机制时，社会对整个行业的信任度也会随之提升。副议长先生，在支持这项法案的同时，我也想提出几点思考，并请部长进一步说明。首先，在建立更严格、更系统化监管框架的同时，我们是否也有足够的人才储备，去支持行业未来的发展？随着宠物数量增加以及宠物医疗服务日益专业化，新加坡未来对兽医人才的需求，相信还会继续的增加。除了监管，我们是否也应同步思考，如何通过教育、培训和专业发展机会，吸引更多年轻人进入兽医行业，并支持本地兽医不断提升专业能力，甚至鼓励本地学府设立兽医学位。第二，法案通过后，政府是否会进一步加强公共教育，让宠物主人更清楚知道什么是合格兽医，如何识别注册类别，以及在遇到专业问题时，应该通过什么渠道求助或投诉？很多时候，制度已经建立，但公众未必完全知道如何使用。若公众不清楚 full registration、registered registration 和 specialist 之间的差别，法案的保障作用在现实中可能会打折扣。第三，随着宠物医疗技术不断的发展，行业在逐渐出现专科服务和高端医疗。政府未来是否会关注如何鼓励行业专业发展，同时也兼顾服务的可及性与合理的透明度？我想这也是不少宠物主人关心的问题。很多人愿意为宠物付出，也愿意为他们承担责任，但他们也希望在面对诊疗和医疗建议时，能够更清楚地沟通、更透明地说明，以及更强的信任基础。第四，除了规范兽医本身，未来是否也继续检视与动物护理相关的其他业服务，确保整个生态更清楚地区分专业、医疗、基础护理 和其他补助服务的责任边界。因为今天的宠物行业的发展已经不只是诊所而已，还包括护理、美容、寄养、康复以及其他相关的服务。边界如果不分得清楚，公众有时很容易混淆哪些服务属于专业医疗判断，哪些又不属于。副议长先生，人与动物的关系往往反映了一个社会的文明程度。当我们愿意为动物提供更好的医疗照顾，愿意建立更专业、更负责任的行业制度时，其实也体现了社会对生命的尊重。这项法案正是这样的社会背景下提出的。它不仅完善了兽医行业的制度基础，也为新加坡未来宠物医疗行业的健康发展拟定了更稳固的框架。In summary, the Veterinary Practice Bill provides a much-needed framework to strengthen the regulation and professional standards of veterinary practice in Singapore. As more Singaporeans welcome pets into their homes, animals are increasingly regarded not merely as companions, but as a member of the family. This shift in social attitudes means that the public rightly expect a high level of professionalism, accountability, and trust in veterinary services. This bill helped meet the expectation by establishing the Veterinary Council, setting clear standards for registration and practicing certificate, and putting in place a structured process to address complaint and disciplinary matters. In doing so, it strengthened both public confidence and integrity of the veterinary profession. At the same time, I hope we will continue to ask how the framework can be supported in practice. Do we have a sufficient pipeline of veterinarian talents for the future? How can we better help pet owners understand the system and identify dual qualified veterinarians? And as the sector continues to grow and specialize, how can we balance professional advancement with accessibility, transparency, and trust? These are important questions as we move forward. Notwithstanding all this, I support the bill.
Mr. Chai Yin Cho.
Deputy Speaker, I rise in support of the bill. It strengthens animal welfare by ensuring vets are held to high professional standards. It builds public trust through mandatory licensing and clearer processes for managing feedback and complaints. Nevertheless, I would like to raise 5 points for the Ministry's consideration. First, I would like to ask what steps the Ministry will take to attract and retain talent in our vet industry. The supply-demand gap is stark. The number of licensed vets in Singapore has grown significantly from just 122 in 2006 to 674 as of September last year. Yet demand has grown even faster. We have an estimated pet population of about 700,000, including some 114,000 dogs and 94,000 cats, with about 1 in 3 households now owning a pet. That's a lot of pets, and this translates to roughly 1 vet for every 1,186 animals, with many of the 674, some of them not working full-time. The profession has expanded, but it has not kept pace with demand. It also suffers from high stress, long hours, and burnout, driving many local vets to work in Australia or the UK. The brain drain has a direct knock-on effect on costs. Vet fees rose up to 20% in 2022. The bill's additional regulatory requirements risk compounding this, adding compliance burden that may deter talent from entering or staying in the profession. Will the Ministry consider expanding the list of recognized overseas vet qualifications and explore Singapore-based pathways to licensing so that aspiring vets are not compelled to study abroad and potentially settle there? Secondly, staying on the topic of costs, I would like to ask whether the Ministry will consider targeting vet subsidies for specific groups. There's currently only one non-profit community animal clinic in Singapore run by SPCA, serving pet guardians in financial hardship, supplemented by ad hoc free house screenings for lower-income households. This is insufficient for our growing pet population. I would like to highlight two groups that we might consider subsidies for. First, rescue and shelter pets. Adoption rates at SPCA have decreased sharply from 979 in 2019 to just 250 last year, while rescues have climbed from 2,813 in 2023 to 3,763 last year. Vet bills have risen over 30% since 2022. Subsidized vet care for adopted rescue pets from approved rescuers could incentivize adoption and relieve pressures on overstretched shelters. Animals serving an assisted function deserve some considerations too. Guide dogs for visually impaired or therapy animals that provide genuine medical and social value. While Guide Dogs Singapore subsidizes some routine care, some financial burden on dog owners remains significant. Will the ministry considering formalizing support for these animals? Third, I would also like to ask the ministry to clarify the scope of practices that must be performed by a licensed vet. In particular, whether the regulation of pet groomers or practices in the ornamental fish industry can be considered alongside the bill. There is currently no legal requirement for pet groomers to be professionally trained or certified. We have also heard about the tragedies, the death of Fendi the Corgi who choked during a grooming session, and the ACRES white paper last year had also flagged concerns about the unregulated industry. There's a growing grey area where grooming shades into vet practice. For instance, when a groomer handles a pet with an existing skin condition or infection. Fish cosmetic surgery is also another example of invasive procedures carried out without medical oversight. In Singapore, arowana fish are routinely subject to eye lifts, chin jobs, scale shaving, and swim bladder repairs by non-vets. A Singapore Aquarium magazine also once published a step-by-step guide to tail amputation on flowerhorn cichlids using scissors without anesthetics, and dye injections into parrot cichlids using hypodermic needles. Many of these aesthetic services continue to be openly publicizing in the ornamental fish industry. Will the Ministry of Vet Council issue clear guidelines on which procedures might need a licensed vet and consider a basic certification framework for pet groomers? A related concern is the rise of non-conventional animal therapies, from stem cell treatments to administering horse injections, medications to dogs and cats, amplified by social media. The AVS and SVA in this regard have jointly published the vet therapeutic guidelines in response, and these remain voluntary. Will the ministry consider empowering the Vet Council to enforce minimum standards for non-conventional therapies, protecting pet owners from treatments that are unproven or potentially harmful? Fourth, the bill will first apply to vets before eventually extending to vet nurses. I welcome this. However, the Vet Council was originally slated for establishment last year and was delayed. Will the ministry provide a concrete timeline for when vet nurses will be brought under the framework so the profession can anticipate and plan accordingly? This also aligns with pricing transparency, where the vet therapeutic guidelines already recommend that vets provide clinics with cost estimates and disclose the evidence base for such treatments. But this is currently voluntarily. Given that vet fees rose by up to 20% between 2022 and 2023, will the bill consider adding further compliance costs? And that this bill may add further compliance costs. Will the ministry therefore consider making pricing transparency and informed consent on costs a statutory obligation under the bill? Notwithstanding these clarifications, I support this bill and look forward to the ministry's response. Thank you, Deputy Speaker.
Mr. Yip Hon Weng.
Mr. Deputy Speaker, sir, during my house visits, I often meet residents who are deeply devoted to their pets. Miss C, a Yio Chu Kang resident, is one of them. She has even helped to organize pet shows and events in our constituency. A few years ago, when her dog passed away, it was a very difficult time for her. When I visited her again recently, she showed me photos, paintings she had kept, and even a tattoo of her dog's name on her arm. For her and for many Singaporeans, animals are no longer just pets. They are family. When a family member falls ill, we do not ask for the bare minimum. We expect care that is modern, professional, and accountable. This bill reflects that shift. It marks an important transition from a licensing regime to a professional regulatory framework, recognizing that the veterinary sector has grown in scale, complexity, and public expectations. I support this bill's intent. The establishment of the Veterinary Council with powers to register vets, set standards, accredit training, and enforce discipline is a significant step towards professionalizing this sector. The tiered registration system and continuing professional education requirements will raise standards across the board. However, residents will ultimately judge this bill not by its structures, but by whether it gives them the confidence at the point of care. I have several clarifications on the bill. First, Mr. Deputy Speaker, sir, vet services must remain affordable and accessible. Pet ownership today is not a luxury. Pets are a source of emotional support for seniors, children, and families with special needs. Beyond households, community caregivers, independent rescuers, and animal shelters pay out of their own pockets to care for animals, which may not even be their own. Yet the cost of veterinary care has become a growing concern. Prices vary widely. There's no clear benchmarking. There's little predictability for families. A consultation may cost $50 to $70. Pre-surgery blood work can exceed $300. Hospitalization can cost hundreds of dollars a night, and emergency care can easily exceed $500. For chronic conditions such as kidney or liver failure, it is not uncommon to see caregivers crowdfunding five-figure sums to save an animal. To be fair, vets face rising costs in commercial rent, diagnostic equipment, and imported medicines. But recognizing these pressures does not resolve the burden on residents. Affordability was one of the most prominent concerns raised during the public consultation, yet veterinary fees fall outside the scope of this bill. From the residents' perspective, regulating quality without a concrete affordability and transparency roadmap feels incomplete. Pet owners experience quality and price at the same counter, often during a stressful emergency. Why should they wait for a future policy response when this concern is already well established? If stronger regulations increase compliance and operational costs, what assurance do we have that households will not face even steeper bills? I have 4 specific questions on this. First, will the ministry commit to a clear timeline for these separate affordability and transparency measures? Second, while we wait, can we mandate fee transparency immediately? Will the Council require clinics to provide itemized billing, written pre-treatment estimates for non-emergency procedures, and clearer financial consent before significant treatments? Will the Council also publish fee benchmarks so that people know the sort of ranges to expect and for other vets to benchmark themselves, like in the medical sector? Third, will the Ministry actively monitor whether the implementation of this bill correlates with rising consumer costs? Fourth, will the Ministry work with the industry to help manage the underlying drivers of these costs, such as commercial rent and medicine procurement? Mr. Deputy Speaker, sir, a well-regulated sector is not enough if residents cannot afford to say yes to critical treatment. Access does not begin at the clinic door. Access begins at the bill. Second, Mr. Deputy Speaker, sir, residents want a competent team to treat their pet. When a family hands over their pet for a major procedure, they face a sobering reality. There is always a risk that the animal may never wake up. Because the stakes are high, they want assurance. The bill defines the practice of veterinary medicine broadly, but allows certain acts to be performed by non-vets under supervision. Importantly, high-risk procedures such as the administration of anesthesia are not excluded. Yet the regulatory framework for veterinary nurses and paraprofessionals is not yet in place. This creates a regulatory gap. The Council is tasked with setting standards and requiring continuing professional education for vets, but the paraprofessionals assisting them remain in legislative limbo. I have several questions. What does under veterinary supervision mean in practice for high-risk procedures? Is this supervision direct, on-site, and immediate, or merely general supervision or consultation should any issue arise from another room? If a veterinary nurse is permitted to administer anesthesia under supervision, what competency assurance exists right now before their regulatory framework is in place? Can the Ministry clarify when these additional provisions relating to paraprofessionals will be introduced? Will the Ministry commit to publishing the supervision guidelines before the main operational provisions of this bill commences? Will the Council provide a clear public list of high-risk acts requiring tighter direct vet involvement? Finally, do residents have the right to know exactly who is clinically responsible at each stage of their pet's treatment? When the risks and corresponding costs are high, clarity cannot be left to interpretation. Third, Mr. Deputy Speaker, sir, residents need clear and accessible information to make informed choices. The bill introduces a structured registration system of full, restricted, and specialist categories. This is a positive step. However, the information currently made available to the public is limited to name, place of practice, qualifications, and registration date. This is not enough. As Vice Chair of the Health GPC, I've seen how transparency builds trust. In human medicine, the Singapore Medical Council, or SMC, provides a clear benchmark. The public can check a doctor's registration type, specialist branch, practicing certificate status, and active conditions or restrictions. If we treat our pets like family and vets like professionals, residents deserve a similar level of clarity. A public register should be a tool for informed choice, not just a list of degrees. Hence, will the Veterinary Council's public register be aligned with the SMC standards? Will it include specialist branches, practicing certificate status, and active conditions or restrictions? Pet owners should not need specialist knowledge just to understand who is qualified to do what right now. Fourth, Mr. Deputy Speaker, sir, when things go wrong, residents must have confidence that they can seek redress. The bill establishes a structured disciplinary process with safeguards like layperson involvement and conflict of interest rules. But from a grieving resident's perspective, the process may still feel intimidating. I have 4 areas of concern. First, the entry barrier. A disciplinary case must be supported by a statutory declaration. For an ordinary resident, this is not a mere administrative step. It is the start of a formal legal process. Will there be clear guidance and simpler templates so genuine grievances are not deterred? Second, the timeline for justice. When the bill sets a 3-year limitation period, what are the indicative service timelines for triage, inquiry, and final decision? Relatedly, what are the expected processing times for complaints assessment committees and disciplinary committees, and are there clear service standards? Furthermore, given that individuals may still pursue civil claims through the courts, what role does this disciplinary framework play in practice? And what would encourage the public to use this process instead of going directly to court? Third, transparency of investigation. Will there be a firm commitment to publish disciplinary workflows and final outcomes so complainants are not left feeling shut out? Fourth, independent appeals and independence. Appeals against certain council decisions go to the minister, who also appoints and may remove council members. I do not doubt the integrity of our institutions, but how does this structure ensure perceived independence in the eyes of the public? In particular, why do appeals from the Complaints Assessment Committee need to be heard by the minister? Is there scope for these to be adjudicated by an independent tribunal instead? Fifth, Mr. Deputy Speaker, we must ensure inclusivity for vets for easy compliance while maintaining high standards. I seek clarification on the registration framework. What are the fees required for vets to obtain and maintain their registration? How frequently must practicing certificates be renewed? And what criteria will be used to assess renewal? Will the Council continually review the list of accredited qualifications and recognized schools to ensure standards remain current and internationally benchmarked? Further, how will older vets transition into this new system? If processes are primarily digital, what supports will be provided to ensure senior practitioners are not left behind? Also, how would representation within the Veterinary Council reflect the diversity of the profession? In conclusion, Mr. Deputy Speaker, sir, let me return to Ms. C. For her, caring for her dog was never just about fun. It was about love, responsibility, and trust. Her deep love for her pets is not uncommon. In Singapore, pet owners have parted with life savings to save their pets, hired help or sacrificed travel or career opportunities to care for ill and aged pets, as they would for their family members. So the question before us is no longer just about animals or pets. It's about how we care for those we consider family. And if that is the case, then the questions raised in my speech are not abstract. They're about whether care is affordable so families can say yes without fear. They're about whether care is competent so families can trust those treating their pets. They're about whether care is transparent so families can make informed decisions. They're about whether care is accountable so families know the system will be fair when something goes wrong. This bill moves us forward, it strengthens standards, it builds a framework, it raises professionalism. But a framework alone does not create confidence. Confidence is built when access is real, when responsibility is clear, when information is transparent, and when accountability is trusted. Because trust is not created by regulation alone. It's created when systems work for people, when processes are clear, and when outcomes are fair. So let us take this opportunity to do more than regulate. Let us ensure that no family hesitates because of cost, and that no resident is left uncertain about who is responsible. Let us also ensure that no one feels shut out when seeking accountability, and let us build a system that residents can rely on, not just in principle, but in practice. Mr. Deputy Speaker, sir, I support this bill.
Mr. Melvin Yong.
Deputy Speaker, I rise in support of the bill, which seeks to provide for the registration of vets and the regulation of individuals practicing veterinary medicine. This bill reflects how we as a society value animal welfare, professional standards, and consumer trust. As Singapore's pet scene evolves and grows, our vet care systems and regulatory framework must evolve in tandem. In this regard, the bill is both timely and necessary. However, I would like to raise several questions and suggestions, particularly from the perspectives of workforce development and consumer protection, and at the same time to draw on relevant practices from other jurisdictions. Sir, Singapore's vet landscape has changed significantly in recent years, driven largely by the rise in pet ownership. Pets today, as many members of the House have mentioned, are no longer just companions. For many households, they are family members. With this shift has come a corresponding rise in expectations. Owners seek not only competent care, but also high standards of professionalism, communication, and accountability. Many pet owners are also prepared to invest more to ensure the well-being of their animals. As a pet owner myself, I can certainly relate to this. We all want to do our best for our pets, especially when they are unwell or they are vulnerable. In this context, the establishment of a veterinary council is an important step forward. It will strengthen governance, uphold standards, and enhance public confidence in vet services. So while this bill focuses on vets, veterinary care is delivered by a team. Vet nurses, technicians, and allied professionals are integral to diagnosis, treatment, and recovery. They are often the first point of contact for pet owners and play a critical role in ensuring continuity of care. From a labor movement perspective, it is important that these workers are not treated as peripheral, but as professionals in their own right. This means having clear standards of practice, structured training and certification pathways, fair wages and working conditions, and meaningful career progression. Without this, we risk a situation where demand continues to grow, but the workforce remains stretched, under-recognized, and difficult to retain. If we look at developments overseas, the direction is clear. In Western Australia, veterinary nursing has been formally recognized as a regulated profession. In Hong Kong, the authorities are studying a framework to regulate veterinary nursing practitioners. Similarly, in the United Kingdom, reforms are moving towards stronger recognition and oversight of allied veterinary professionals. This development suggests that a modern vet system does not focus only on vets, but also on the entire care team. In this regard, I'm glad to note from MOS opening speech that there are plans to develop a more formal framework for vet nurses and technicians in Singapore. But the question is whether it will be done through accreditation, registration, or other mechanisms. And the more important question is, when will it take place? Such a framework would not only uplift the profession, but also give consumers greater assurance about the competency of the entire care team. Sir, beyond standards, we must consider the sustainability of our vet workforce. Today, the pathway to becoming a vet remains largely dependent on overseas training, such as the concurrent program between NUS and the University of Melbourne. While this has served us well, it may not be sufficient to meet growing demand, particularly as vet services become more specialized. There are also barriers in terms of cost and accessibility. Not all aspiring Singaporeans may have the means to pursue overseas education. From a workforce development perspective, we should consider whether more can be done to strengthen local pathways, whether through expanded partnerships, local clinical training opportunities, or in the longer term, a local degree option. At the same time, we should continue to support and to develop our local pool of vet nurses and technicians who form the backbone of our day-to-day care. A strong, well-supported workforce across all levels is essential if we are to deliver consistent, high-quality vet services. Sir, I now turn to the consumer perspective. Vet care can be a significant and sometimes unexpected expense for households. Pet owners often have to make decisions under emotional stress with limited information and time. This creates a situation of information asymmetry, where consumers may not always be able to fully assess treatment options or costs. In such circumstances, trust becomes critical. However, trust must be supported by systems, by transparency, accountability, and fair practices. Feedback from the public has highlighted concerns about the lack of upfront price clarity, wide variations in fees, and difficulty in comparing services across providers. In this regard, we should look at developments in the United Kingdom. Recent reforms there have placed strong emphasis on consumer protection, including requiring clinics to publish price lists for common treatments, disclose ownership structures, and strengthen complaints and redress mechanisms. The rationale is clear. Vet care is a complex service, and consumers need better information to make informed decisions. I would therefore like to call on AVS to consider similar measures, such as clear fee disclosures for common services, provision of estimates for higher cost procedures, and more consistent itemization of bills. Sir, beyond pricing, another important area is informed consent. In Hong Kong, the regulatory body has introduced clearer expectations on client communication, including guidance on what should be conveyed to pet owners before treatment. This includes information on diagnosis, treatment options, risks, and estimated costs. Such practices recognize that consumers should be properly informed before making decisions, especially where procedures may be complex or costly. I would therefore like to ask whether similar guidance or professional standards on informed consent will be developed here in Singapore. Sir, trust in any profession also depends on transparency in how misconduct is handled. In jurisdictions such as Canada and Hong Kong, disciplinary outcomes and practitioner information are made publicly accessible to varying degrees, enabling consumers to make more informed choices. I would like to ask whether Singapore's framework will similarly provide a clear and accessible way for the public to verify practitioners' registration status and assess relevant disciplinary information where appropriate. In addition, Western Australia's model includes a consumer representative within its veterinary practice board, helping to ensure that public interest considerations are incorporated into regulatory decision-making. In this regard, I would like to ask whether the composition of our own Vet Council will similarly incorporate or formally consult consumer or public interest perspectives. This will help ensure that the regulatory framework is not solely profession-led, but also grounded in the needs, expectations, and protection of consumers. So, while strengthening regulation, we must also ensure that it remains fair and proportionate. Internationally, there is increasing recognition that regulation should not only be disciplinary, but also developmental, supporting professionals to improve and maintain standards. For example, data from Canada shows that many complaints are resolved through advice, remediation, or education rather than disciplinary sanctions alone. This is particularly important in a manpower-constrained sector where we must retain and support skilled professionals while at the same time upholding standards. Mr. Deputy Speaker, this bill is a significant step forward in strengthening Singapore's animal health and welfare ecosystem. However, as we raise standards for vets, we must also take a holistic approach, one that uplifts all members of the vet care team, strengthens workforce pipelines and local pathways, and at the same time enhances consumer protection, transparency, and trust. International experience shows that a modern vet system goes beyond regulating individuals. It builds a professional, accountable, and consumer-centric ecosystem. By moving in this direction, we can develop a vet sector that is not only professionally robust, but also fair, sustainable, and trusted by the public. So with that, I support the bill.
MOS Alvin Tan.
Mr. Deputy Speaker, I thank the 14 members for their support of the bill, and I learned many different things. Members' love for their pets and animals, including caramel yellow, and also about fish cosmetic surgery, including eye lifts and chin jobs. Please allow me to address members' comments via 4 broad themes. The first theme is on representation of the Veterinary Council. Now, the Veterinary Council will perform an essential role to regulate our vet sector. Its primary duty is to register vets, set and maintain high standards for the practice of veterinary medicine in Singapore, and appoint necessary bodies for disciplinary proceedings to safeguard animal health and welfare, as well as the public interest. In that regard, I agree with Dr. Chu Pei Ling that council members should have the right mix of expertise to fairly and adequately represent the vet sector and to set the high standards that is expected of the vet sector. And this is why the bill provides for the minister to appoint a balanced composition of members. I shared earlier that the council may include ex-officio members from the public and private sectors. In this regard, and to respond to Mr. Kenneth Tiong's question, the council must also comprise at least 4 other vets, including one with at least 10 cumulative years of experience as a vet, which may include the duration licensed by AVS or registered with the council. Considering public feedback that we've received through the consultation process, we intend to also appoint suitably experienced vets from diverse sectors rather diverse areas of the vet sector. Now, this will allow us to strengthen the development of professional standards that enhance and advance the vet sector. On Mr. David Ho and Mr. Melvin Yong's queries, the bill provides that the council must comprise at least 2 laypersons who are non-vets. Now, we intend to nominate legal professionals from the start, because this helps provide wider perspectives and ensure the reflection of broader public interest in the council's work. There will also be government oversight of key aspects of the council for alignment and public interest and accountability, and I will elaborate on these later. Now, over time, we will review the Veterinary Council's operating needs and adjust its composition accordingly. This may include appointing other vet professionals, such as vet nurses, further down the road. Now, the Council may also appoint committees. This could include key representatives of animal groups to share feedback with the Council, as Mr. Henry Kwek and Mr. James Lim suggested. The second theme of questions surround the new Registration and Practicing Certificate Framework, PC framework, which Mr. Tsai Ying-zhong, Ms. Li Hui-ying, and Dr. Chu Pei-ling raised questions on. Now, every vet that practices veterinary medicine must be registered with the Council and have a valid PC. The bill defines the practice of veterinary medicine, which can only be performed by duly qualified vets. The bill also introduces a new specialist registration, which is not part of the existing licensing framework for vets under the ABA. But in line with feedback that we received from the vet sector, the Council intends to recognize specialist vets primarily based on postgraduate degrees or qualifications, and will publish the requirements on its website when ready. So we will start with this new 3-tiered registration framework and then monitor its effectiveness. We are also open to exploring other approaches to further recognize, as well as to differentiate vets where necessary. Now, with regards to Ms. Diana Pang's suggestion, the bill will not require vets to declare their pro bono hours as part of the PC renewal requirements. But we appreciate that vets regularly volunteer their time and efforts, such as in sterilization and microchipping drives on a pro bono basis, and we will explore other ways to recognize their goodwill and their generosity. Mr. Lee Hong Chuang, Dr. Chu Pei-ling, Ms. Diana Pang, Mr. David Ho, Dr. Hamid Razak, Mr. Melvin Yong, and others had also raised questions about the veterinary workforce. Now, I shared earlier that the Council will continue to implement continuing professional education requirements for vets to renew their PC, to equip them with up-to-date knowledge, skills, and experience. AVS also provides scholarships and study grants for students to pursue vet programs and contribute to our pipeline of vet professionals. Beyond this, AVS and the Council will partner stakeholders such as MOE and the Institutes of Higher Learning to strengthen veterinary-related formal education programs or training provided locally, including those that may allow mid-career entrants into the sector. And our review also includes manpower projections and resource requirements to study the need and feasibility of a local vet degree program. Ms. Li Hui-ying also asked about occupational support. Now, while the Protection from Harassment Act protects all individuals, including vets, from harassment, AVS will also work with the Council to explore other initiatives to improve workplace practices and professional development opportunities to better support our vets. We also intend to eventually extend registration to other vet professionals, such as vet nurses. While they are not currently licensed by AVS today, we will continue to engage our vet sector before developing the regulatory framework for them. And in line with Mr. Henry Kwek and Mr. Ip Hon Wing's suggestions, we will also monitor the impact of the enhanced set of regulations to vets. We will update on the registration timeline for other vet professionals when we are ready. Meanwhile, the bill will clarify the scope of vet activities and circumstances where non-vets may perform them. For instance, vet nurses will be allowed to perform certain vet activities under supervision by a duly qualified vet and in accordance with any prescribed conditions. This requirement to be supervised is already in place today. The Council will also publish guidelines before the commencement of the relevant provisions next year, setting out the broad principles of the appropriate supervision. To Mr. Muhaimin Malik's questions, we share your concerns about community animals and their caregivers. I have many of them in my constituency as well. And to our community caregivers, please continue to care for your animals as you already do, but please also exercise judgment when you need to refer them or to bring them to a vet. The third theme of questions that members have raised relate to penalties and disciplinary proceedings provisions as prescribed by the bill. First, Mr. David Ho asked how penalties under the bill were derived. Compared to what is provided for under the ABA, this bill raises the maximum fine for offences relating to unlawful practice of vet medicine or misrepresentation as a vet from $10,000 to $50,000. Now, this is to provide sufficient deterrence against profit-driven motives. There is no change to the existing 12-month maximum imprisonment term. And the $50,000 fine quantum is benchmarked against the human healthcare sector, including the dental and allied healthcare professions. AVS will continue to regulate animal health and welfare, and offences involving animal welfare and cruelty will continue to be dealt with under the ABA. As members know, and I have said that in public and in this House, we are reviewing the penalties for animal welfare offences and the licensing regime for pet sector activities, including pet grooming businesses under the ABA, and we will share more when ready. Second, we have established a robust disciplinary framework, including a range of disciplinary orders that may be imposed on errant vets to strengthen deterrence against professional misconduct. I shared earlier how the bill establishes clear escalation thresholds in handling complaints and how the various committees can make orders to deal with professional misconduct. To Mr. Yip Hong Weng's question about the completion timeline for the disciplinary inquiry, clauses 48 and 54 provide that the Complaints Assessment Committee, CAC, and the Disciplinary Committee, DC, must complete its inquiry by 3 months and 6 months, respectively. This is unless the Council, on application by the CAC or DC, allows otherwise. To Mr. Muhaimin Malik's questions about resourcing for enforcement, NParks currently undertakes the enforcement of the existing vet licensing framework and will continue to support the VC as we transition to the new framework. We also wish to assure Mr. James Lim that NParks has strict protocols around evidence gathering and investigations and works with other agencies where practical and necessary to gather information to support its investigations. Third, Ms. Diana Pang asked why there is no requirement for a legal professional to be in the IOC or the Interim Orders Committee. Allow me to explain. Where necessary, legal professionals can be appointed to the IOC, as clauses 4 and 39, respectively, provide for laypersons such as legal professionals to be represented in the Council and the Complaints Panel. Clause 65 also provides for the Council to appoint an advocate and solicitor to prosecute the disciplinary case or to advise the IOC on any legal matter relating to the inquiry or review. There are also safeguards for vets before the IOC. Before the Council appoints any independent expert, it must give the registered vet concerned an opportunity for him or her to make representations on the proposed appointment. That the vet may also appeal to the General Division of the High Court against the IOC's decision. And all interim orders are also subject to periodic review to ensure no order remains in force longer than is necessary. Mr. Henry Quek asked if the enhanced disciplinary proceedings could result in the sector become overly litigious and if vets may feel pressured to adopt defensive practices to protect themselves. Now, the bill addresses this concern. First, while any member of the public may submit a complaint against vets, every complaint must be made in writing and also supported by a statutory declaration. The limitation period for complaints also ensures that cases brought before the Council are supported by timely and reliable evidence. Second, there will be clear escalation thresholds in the handling of complaints. The registrar will objectively assess and triage each case and can recommend dismissal of frivolous complaints to the Council so vets are not unduly burdened by cases without merit. Now, third, the bill also allows for conciliatory measures, such as mediation, as well as voluntary cancellation or suspension of registration where there are concerns on the vet's fitness to practice. These measures, subject to the Council's approval, help to address issues through negotiation without defaulting to formal disciplinary proceedings. Sir, the fourth and final theme of questions members have asked relate to safeguards for pet owners. Mr. Henry Craig rightly said that the framework must guard against misuse while preserving confidence and fairness. I agree with him. The Council is first and foremost a regulator. Its primary duty is to maintain professional standards and not to promote or advocate the profession's interest. There are thus safeguards and clear lines of accountability back to the government, which will ensure alignment with the broader public interest. Now, the Vet Council President and members are appointed by the Minister, who can also remove members where necessary. The Registrar is also appointed by the Minister and must be a public officer or an officer or employee of a public authority. The Minister's approval must also be sought when the Council makes regulations, such as those relating to qualifications and continuing professional education requirements for registration. I also want to assure Mr. David Ho and Mr. James Lim that the disciplinary council, that the disciplinary proceedings likewise incorporate multiple safeguards to mitigate conflict of interest and to ensure impartiality. Let me elaborate further. First, disciplinary proceedings must also include non-vets, such as legal professionals, to provide balanced and objective oversight. Members with conflict of interest must also recuse themselves from proceedings. Second, the bill prohibits certain individuals to review the same case along various stages of proceedings. For instance, the registrar who reviewed and referred the case to the Council must not be appointed to a CAC, a DC, or an IOC. A member of the CAC who conducted an inquiry in respect of a disciplinary case must not be appointed as a member or observer of a DC on the same case. Third, aggrieved parties may also appeal to the Minister or the General Division of the High Court. Appeals do not return to the Council and the committees for reconsideration, ensuring that disciplinary decisions are subject to independent review and safeguarding the interests of both vets and the public. Now, this appeal mechanism takes reference from disciplinary framework of the human health care sector, including the dental and allied health professions. Some members have also mentioned about raising awareness. I think Mr. Muhaimin mentioned that earlier. AVS will work with the Council to raise awareness and educate the public on its requirements and processes. This includes information on the Council's webpage, which will contain information such as the vet's class of registration and place of employment. This can help the public identify vets with restricted registration who may only practice in establishments recognized by the Council. Now, the Council will also publish disciplinary findings of key cases when concluded to facilitate awareness and uplift standards within the vet sector and for public education. The Council will also publish a guide to support complainants seeking redress. And this will include steps on how to file a complaint, including how to make a statutory declaration. This guide will also address Ms. Li Huiying and Mr. Yip Hong Weng's queries on when a complainant should file a complaint with the Council or otherwise commence a civil proceeding. A complainant may pursue either or both, as the circumstances warrant it. And this is consistent with how other professional regulatory frameworks in Singapore operate. Ms. Diana Pang asked about the advertising standards for veterinary services, and Mr. Cha Ying-zhou asked about minimum standards for non-conventional therapies. Now, the Code of Ethics for Veterinarians includes advertising standards for veterinary services, such as requiring information to be factual and not comparative. Under the Code, a vet is also responsible for choosing the treatment regimens for his patients based on sound evidence-based science and practice and/or diagnostic test results. Now, this is applicable to non-conventional novel therapies as well. Now, many members also raised concerns about the affordability of care and transparency of costs. I've heard that as well in my interactions with vets and also the broader public. Now, this code also requires vets to clearly explain treatment options, risks, and costs to obtain consent from owners for the treatment of the animal and avoid unnecessary procedures. Vets should also provide pet owners with an estimate of fees. Now, these standards ensure better pricing transparency and help to build trust between pet owners and vets by promoting professionalism and fairness. And under this bill, while vets will be subject to regulatory requirements, they will be similar to those under today's licensing regime under AVS. Furthermore, provisions are in place to ensure a smooth transition for current practitioners into the new regime. Notwithstanding, AVS will partner the Council to review the Code of Ethics and will study members' suggestions for cost structures to be more transparent, such as to provide itemization of bills and clearer fee disclosures. We are also looking at other measures to address this. This includes listing fees to promote greater transparency, and we will update on the timeline when ready. In addition, there are also pet insurance schemes available in Singapore to help pet owners with the cost of vet services. There are also professional indemnity insurance schemes for vets to cover legal defense and settlement costs arising from allegations of professional negligence or misconduct. We share members' concerns on the need to be mindful of costs to animal owners and are closely monitoring the trends. To Mr. Kenneth Tiong's questions on fees for registration and PCs, we will consider various factors, including current cost trends and the impact on existing practices in determining the prescribed fees. While we understand that many Singaporeans see pets as a member of their family, mine included, and we understand concerns around vet costs, we must also recognize that pet ownership is a personal choice and a long-term commitment that comes with responsibilities. Owners are responsible for providing for their pets' needs, including medical care. So we strongly encourage prospective pet owners to thoroughly consider the full cost of raising a pet before committing to becoming a pet owner. Mr. Speaker, sir, Mr. Deputy Speaker, sir, vet professionals form an important pillar of our animal health and welfare system. Under this bill, there will be fair and adequate representation of the vet sector in the Veterinary Council to drive the refinement of professional services. The Veterinary Council will also be equipped to effectively deal with malpractice to safeguard animal health and welfare. Finally, this bill is intended to benefit the public by raising the professional standards of our vet sector. I seek the House's full support for the bill, and Mr. Speaker, Mr. Deputy Speaker, I beg to move.
Mr. Kenneth Tiong, do you have a clarification arising out of MOS's speech? Please proceed.
Thank you, sir. Thank the MOS for the assurances of vet representation on the council. So can I just ask the MOS to clarify why vet representation is not codified on a statutory basis, unlike the Medical Registration Act of 1997 and the Dental Registration Act of 1999?
MOS Alvin Tan, would you like to respond?
So we are starting on a new slate, setting up the Veterinary Council, and we've already took dressing with other health care professions, and we will evaluate over time and see whether these are necessary over time.
Any further clarifications? Mr. Henry Kwek.
Deputy Speaker, sir, I thank the MOS for this comprehensive response. I would like to check whether MND is open to providing more funding to AVS. 10 years ago, I made a speech on MPARCS, and I noted then that MPARCS' annual budget is less than half of an acute care hospital. And I checked the figures just now, I think it's still around the same. It's basically MPARCS is operating a very, very lean budget. It's very efficient. I have a lot of respect for MPARCS staff, but they have to handle a lot of things. And now with public expectations and from what we hear from the chambers, this new regulation is a step up. I do hope that the government can provide a bit more resources to AVS to discharge what the public expects of this new regulation regime. Thank you.
MOS Alvin Tan, would you like to respond?
So I thank Mr. Henry Craig for his questions. I think my AVS colleagues will be very encouraged by your appeal. We will resource our AVS and NPARTS colleagues as necessary for them to conduct their important mission. Thank you.
Mr. David Ho, you have a clarification. Please proceed.
I thank the MOS for the response. I'm specifically heartened to hear that we will explore a possible VET local degree. I would like to clarify if MND will be working with MOE to explore the possibility of an ITE pathway in the veterinary sector. Specifically, could we consider a higher NITEC cost that could then feed into the polytechnic diploma related costs?
MOS Alvin Tan, would you like to respond?
So I thank Mr. David Ho for his questions. As I mentioned earlier on, we're looking at manpower projections as well as resource requirements to study a local program, and that we already have programs with some polytechnics as well, and we'll take his suggestion into consideration. Sir, if I may clarify my response to Mr. Kenneth Tiong, in fact, the VET representation on the VET Council is already codified in the bill. My apologies.
No further clarifications? If that is the case, I'll pose the question. The question is that the bill be now read a second time. Those who agree say aye. Those who disagree say no. I think the ayes have it. The ayes have it.
Veterinary Practice Bill.
Committee stage what day?
Now, sir, on behalf of the Minister, I move that Parliament will immediately resolve itself into a committee on the bill.
The question is that Parliament will immediately resolve itself into a committee on the bill. Those who agree say aye. Those who disagree say no. I think the ayes have it. The ayes have it. The question is that clauses 1 to 90 stand part of the bill. Those who agree say aye. Those who disagree say no. I think the ayes have it. The ayes have it. Bill to be reported. Minister for National Development.
Mr. Speaker, on behalf of the Minister for National Development, I report that the bill has been considered in committee and agreed to without amendment.
Third reading what day?
Now, sir, on behalf of the Minister, I move that the bill be now read a third time.
The question is that the bill be now read a third time. Those who agree say aye. Those who disagree say no. I think the ayes have it. The ayes have it.
Veterinary Practice Bill.
Leader of the House.
Mr. Deputy Speaker, that is rising today, Parliament do now stand adjourned to a date to be fixed.
The question is that at its rising today, Parliament do stand adjourned to a date to be fixed. Those who agree say aye. Those who disagree say no. I think the ayes have it. The ayes have it. Leader of the House.
Mr. Deputy Speaker, I move that Parliament do now adjourn.
The question is that Parliament do now adjourn. Dr. Neo Kok Beng.
Mr. Deputy Speaker, sir, yesterday I mentioned I was a telco engineer. Today I'm going to state that I am an aerospace engineer. Well, I actually work on the Super Skyhawk A4SU on data bus networking. But I'm also a fellow at the Royal Aeronautical Society. My topic today is on drone, but actually more than drone. It's a bigger drone, or we call eVTOL, electric vertical takeoff and landing. First, I'd like to declare that I'm the founder of eVTOL company that designs manned drones, or eVTOL, in Singapore, and it's flying. So what is eVTOL? Common people will say that it's flying car, air taxis. Those are interesting stuff that makes kids very excited, including adults, I think so. For this motion, I will explore this emerging and high-growth market, dissect the opportunities and challenges that we face in Singapore, and propose some strategies and also what initiatives that we can have into building eVTOL industry going forward. So the first thing, or the first factor, is the emerging high-growth market. Sometimes we call it the low-altitude economy. Now, there are two terminologies that we need to be very clear here. Is the Western perspective and the Eastern perspective. The Western perspective call it advanced air mobility. It's defined by NASA 5 years back. The Eastern perspective is, we call it the low-altitude economy, or in Chinese, 低空经济. I actually find that the LAE, or the low-altitude economy, is more encompassing, and that's why I use the terminology LAE. The drones that we see in Singapore and regulated by CAS for UAPL, or drones pilot license, up to 25 kilogram is Cat A, and then up to above that is Cat B. Now, we don't have a lot of huge drones in Singapore, so mostly our drone pilots are actually Cat A. So in AAM, or Advanced Air Mobility, it actually doesn't have a lot of presence in Singapore. Now, the drone economy, let's talk about how this LAE is important for Singapore. Just imagine, right, that whatever is on the road, whether it's buses, cars, vans, trucks, bicycles, we lift it up like maybe 50 meters, 100 meters into the sky. Then we have a completely different set of economy, and that is low-altitude economy. So the definition of low-altitude economy, actually up to what height? Actually, nobody knows, right? It depends on individual country. I used to have a private pilot license. I can fly up to 10,000 feet in Singapore, but maybe you should not fly that high. But I think 1,000 feet or 300 meters is really good enough. Covers on top of all the buildings. Now, so this can actually generate new innovations, and I will explain it later, have higher or greater productivity, and completely disruptive business model. Now let's take a look at the market itself. The global drone market, of course, including military, is about US dollars, about 30 billion today. And eVTOL, in the commercial side, is probably about 3.1 billion. That's research from President's Research in 2025. It's projected to reach 216 billion by 2035, with a CAGR, or a compounded annual growth rate, of 51.8%. Now, if you look at the figures from different research agencies, they're all completely different. Some will say 200 billion, some will say 100 billion, but you get the numbers, right? It's big. So should we tap on this opportunity to develop a new innovation system, create better jobs, and that is highly tech intensive? President Trump last year noted that US has to catch up. in the AAM, this is US, right? Sorry, in AAM, and therefore there's executive order signed up for DOT and FAA to foster innovations. So 36 states is already starting to implement, whether it's between the airport or within the states. Now, the other player is really aggressive, China. 2 years ago, I went to Suzhou Industrial Park, and with SMS Kopokun, and someone handed me a name card, and the title is Director of Low Altitude Economy, Suzhou Industrial Park. It has gone down to such details. And now what we have seen is that there are 30 provinces in China actively rolling out LAE solutions. I visited a couple of them in different provinces. I heard that in Guangzhou, there are already 15,000 LAE companies dealing with parts, not really the full craft, but you can see the size. Well, so we can see how big the market is. The question is, what are the opportunities and challenges that Singapore can work on? A couple of years back, I think about maybe 4 years back, there's a report by a private company, no more in existence, that said that Singapore actually, and when they plan to actually sort of deploy here, there is an output of about $4 billion, Singapore dollars, contribution to the economy with about 1,500 jobs. I do not know whether this number is valid, but I think it warrants some research to see how big is this economy. Now, what are the opportunities? Well, Singapore is highly urbanized. And do we really need air logistics? Yes, within Singapore. But it's going to be difficult, and of course, the safety factor is one of the most important part. But actually, we can look at air mobility business, where there's flying, bringing people from one place to another on a regional side. Singapore and Johor, Singapore and Batam, regional pathway that we can do hop from one place to another. Well, Singapore prides itself as we don't have domestic destinations for aircraft, but we are international from day one. So I think from the view of low altitude economy, we should be regional from day one. So that is air mobility business, air tourism business. Well, we don't have a lot of land, but actually, I think we do have interesting stuff that we can explore within Singapore. Well, the typical areas for air tourism is like a good bird's eye view of the Marina Bay, Sentosa. I was thinking that even the ports would be interesting to tourists too, with all the container ships floating around. And I also think that Mandai Zoo will be a great destination for us to look from the top. So when I was flying when my PPL time, I do fly a little bit lower to visit the zoo without paying tickets, right? The other thing I think really important is air logistics. Cross-border logistics is really interesting. There are a lot of disruptive business models we actually can work on, and I will elaborate on this. What really are the challenges? Well, highly urbanized space, very good integrated logistics, so we don't really need to do most of this stuff in Singapore. Our island is slightly more than 700 square kilometers. Our airspace is limited. And for us actually to develop or test such a craft, I give you a recent example. In the recent air show, NTU unveiled the design of an eVTOL that done its initial hover test in Singapore, but beyond that, the trials has to be conducted in Germany for really the flight. So I think, therefore, we really need to overcome these constraints in order to build a low-altitude economy or industry. How to do that? I think we first need to have a national initiative involving a triple helix of government, industry, and of course the research institutes and universities. The current activities that we have right now in Singapore is, of course, ST Engineering. I used to be from ST Engineering. ST Engineering has a 100-kilogram payload logistic drone due for certification in, I think, 2028. My company, New Aeronautics, we have a 100-kilogram payload for sports and recreation. It's designed for the US FAA market, Part 103. Actually, it's ready now. That's not flying in Singapore. NTU, the 200-kilogram eVTOL prototype unveiled in 2026, led by Professor James Wang. And of course, in SIT, 80-kilogram moving to a 200-kilogram payload led by Professor Victor Wang. So we should have a strategy, Mr. Deputy Speaker, a national strategy for LAE. And I think the triple helix forming a consortium of the government agencies such as CAS, the EDB Enterprise Singapore, even MPA and Singapore Tourism Board can come in to make it much more comprehensive. And that's, I would like to talk a little bit about how can we then grow this industry. I think the first thing of growing any industry is really to have talents. And we never have design talent, or sorry, design engineers or design aerospace engineers in Singapore. We have lots of MRO engineers maintaining aircraft. And we're glad that we achieve 10% of the total MRO market in the world, which means we can do it if we put our mind to it. So for this intellectual capital, we need to have more manpower and talent, and that goes to the research, to the universities or the polytechnics. Currently, there's no specialization in such LAM or AAM technology in Singapore. SIT do have a degree program, but it's much more aerospace. So I think that we should look in detail, diploma and degree with specialization. I wouldn't say a pure degree, but a specialization, and have quite a bit of conversion programs for assisting engineers to convert, or technologies to convert to drone technology or eVTOL technology. The infrastructure capital is really, really the important part here. And when I talk about infrastructure capital, I'm also looking at the regulations. Well, CAAS, or it's the Civil Aviation Authority of Singapore, has spearheaded the development of the AAM regulatory standards in Asia Pacific. That's a very good move. That's trying to harmonize our standards with the rest of Asia-Pac countries. MPA has launched a Singapore First Maritime Drone Estate, or MDE, in April 2021. I understand that they are also upgrading it, but actually is actually for small payload. So if we want to go for a bigger payload, I think we really need to have a bigger test facilities. And therefore, we have progress, but we really need a turbo boost with much more resources and aggressive plans. And therefore, a dedicated sandbox, which the facilities, testing drones or eVTOL in Singapore is really difficult. You can ask for a field, which is like a football field, and then you try to fly around, and then the rains come, and it's hot, and there's no dedicated place for you to have your workshop. So I suggest that we should identify a location, whether in a university or a research institute, to have at least half a football field with at least 20 meters for flight tests. And everyone can go to there, because I don't think we can afford a lot of such flight test center. But we need to think out of the box, because that itself allows us to just hover. So a dedicated sandbox or flight test facilities just allow us to hover. What is really important is the test flight, and that needs space. So I think we should think without the box. What is without the box? Means if the box is Singapore, we should get out of Singapore, and therefore have regional sandbox. And if we have regional sandbox, that means our authorities have to work with the authorities, maybe in neighboring countries, for joint certification, joint flight tests, joint recognition. And I think that will allow us to harmonize our standards and allow us to actually work with different authorities and facilitate cross-border drone flying or eVTOL flights. And the other thing, and the last part is on an innovation capital. China is really good in the hardware. And where are we, right? In manufacturing, we will not be able to compete based on the manufacturing capacity. But we should focus really on what we do best, highly value-added jobs. And I think that's in applications and also business model. For example, we can have purposefully built drones for oil spill disbursement. And we can do it for our ports. And it can be extended to many, many ports in the world. So there's one application with the right business model. Another example, our neighbors have many lands, plantations. And if you plug container ports or storage facilities or logistics center in such location, which is really cheap, and you can airlift it out. So you can actually store seasonal goods, you can store expensive value-added materials where the storage space is really, really cheap. And therefore, you can airlift it out when it's necessary. You don't need to build infrastructure, you don't need to build roads. Give us a completely different way of operating a business. So moving facilities or bus or trucks or bicycles into the air is not just simply moving into the air. It's also coming with different business model. And therefore, I would recommend that NRF consider this to be a white space and really aggressively allocate some good money for the industry and the universities and research institutions. Mr. Deputy Speaker, Singapore does not design and build aircraft, but we have attained 10% of the world's MRO market. This is the chance for us to have aircraft design engineers, providing good jobs and also generate good economic outputs for people. Thank you.
SMS Sun Chue Ling.
Mr. Deputy Speaker, I thank Dr. Neo for raising his motion. The government pays close attention to the development of the low-altitude economy. Indeed, drones and electrical vertical takeoff and landing aircraft, or eVTOLs, can be viable options for economic, transport, and logistics users. We agree with Dr. Neo that these technologies provide opportunities to enhance safety and productivity, enable new operational capabilities and services, and support innovation across multiple domains. In particular, Dr. Neo spoke at length about eVTOLs, which his company, Neo Aeronautics, focuses on, and mentioned air mobility, air tourism, and air logistics as areas of opportunities for Singapore. Unfortunately, it may not be viable to deploy eVTOLs extensively as a domestic transport option. eVTOLs are similar to helicopters and are more viable in places with severe traffic congestion and where point-to-point flight can cut down travel time considerably. They would have marginal utility in Singapore, where airspace is congested, and given that we already benefit from a well-connected ground transport network. However, eVTOLs could eventually become a viable option for cross-border travel to adjacent offshore islands or even cross-border cargo transfer with neighboring countries. We will continue to monitor the progress of eVTOL technologies and its safety and cost considerations. In contrast, drone technology is at a more mature stage with more viable and developed use cases. In Singapore, public sector agencies and commercial players are already using drones in practical, beneficial, and meaningful ways across numerous domains. For logistics, we are already trialling the use of drones for ship-to-shore deliveries at our port to transfer and turn around high-value or essential items. By reducing the need for frequent boat trips, drones alleviate manpower demands and minimize risk faced by maritime workers when operating in challenging sea conditions. For land transport, drones already help to inspect Singapore's train and road tunnels. They allow our engineers to carry out their inspections more efficiently and with greater precision, while reducing the need for manpower to operate in potentially hazardous or hard-to-access environments. For aviation, commercial firms are exploring the use of drones for visual inspections of aircraft to complement existing maintenance processes. This allows for faster checks, enhanced accuracy, and improved safety outcomes, freeing up our maintenance personnel to focus their expertise where it is most needed. For the built environment, BCA and HDB already use drones to conduct periodic facade inspections in a faster and more efficient manner. In October last year, the MND also trialled the use of drones to conduct high-rise ledge cleaning in Punggol, which would otherwise need to be conducted by workers on gondolas, which incurs higher safety risk. We hope to scale up such operations so that more buildings in Singapore can be assessed and maintained using drones. For security, SPF deploys drones to monitor crowd numbers in real time during major events like the National Day Parade or the Marina Bay Countdown. As you can see, there are many use cases that our various public sector agencies are already using drones for. The government has sought to create a conducive ecosystem in Singapore for the safe experimentation, development, and deployment of drones. First, we support research and innovation through trials, sandboxes, and funding. We agree with Dr. Neo that these are important for rigorous testing within safe and controlled environments. This helps us determine the viability of new use cases and figure out how drone technologies and operational processes can be further refined to meet desired outcomes. For example, PUB worked with ST Engineering to use drones to monitor water quality and activities at 6 reservoirs, which is a faster and more accurate alternative to the traditional method of in-person patrols. Using drones in this manner can potentially reduce the required man-hours by up to 70%. We also identify areas that we can temporarily use as sandboxes for flight trials. In the case of the NTU research team, which Dr. Neo mentioned, CAAS facilitated the initial hover test of their prototype eVTOL at the former Turf City racecourse in Kranji last year, ahead of its public unveiling at this year's Singapore Airshow. We will review how we can expand testing sites, including exploring overseas sandboxes in partnership with regional neighbours, as Dr. Neo has suggested. These can be located further from urban areas and provide a safer and larger environment to trial larger drones and eVTOLs. Second, we adapt and streamline our rules regularly to allow a wider scope of low-altitude operations. In 2025, we allowed some commercial drone operations to be conducted at higher altitudes in designated areas for all days of the week for facade inspections. This increased the flexibility and productivity of these inspections and reduced operating costs. We have also facilitated trials for beyond visual line of sight flights, and these flights can safely operate over larger areas and longer distances away from the drone operator, potentially with reduced manpower. The MHA is exploring using BVLOS drones to deliver automated external defibrillators during emergencies. We have also revised our regulations to allow commercial operators to seek approval on a per-activity rather than per-drone basis. In particular, this has benefited drone light show operators who handle thousands of drones at a go to create visually stunning spectacles. In 2025, we also enhanced real-time airspace clearance processes to expedite approval of drone activities, such that operators can now obtain immediate clearance for drone operations at certain heights and locations. Third, we are investing in talent and manpower, as Dr. Neo had suggested. We are intensifying education efforts to promote the responsible use of drones, develop suitable technical skills, and nurture interest in low-altitude technologies for Singaporeans of all backgrounds and ages. We are working closely with our educational institutions to integrate drone-related courses into formal curricula. Dr. Neo suggested creating specializations in AAM technologies, especially at the tertiary level. Those taking aerospace engineering courses at university can today access an increasing variety of drone-related modules. 4 out of our 5 polytechnics are also approved as unmanned aircraft testing training organizations. Let me repeat that. 4 out of our 5 polytechnics are also approved as unmanned aircraft training organizations and conduct practical courses in drone operations. Several primary and secondary schools have also introduced drone flying with their curricula or as part of the applied learning program. Beyond our educational institutions, there are a wide range of facilities, workshops, and courses available to the wider public. CAAS has launched 2 unmanned aircraft flying areas at Pandan Reservoir and Dover Road, where enthusiasts can gather and conduct their own recreational operations. At the same time, CAAS partners with vendors such as Just Fly It to conduct hands-on workshops. Members of the public may also use their Skills Future credits to attend short-term drone operation courses by institutions such as SMU and ITE to ensure that their skills are kept up to date. While we have made considerable progress thus far, we know that more can definitely be done. And this will require overcoming certain constraints, which Dr. Neo had alluded to. Let me repeat that. This will require overcoming certain constraints, which Dr. Neo had alluded to. First, Singapore's airspace is limited. With multiple airports and air bases and flights coming and going constantly, the use of our low-altitude airspace will need to be managed carefully between civil and military aircraft and drones and eVTOLs. Second, Singapore has a dense and highly built-up urban environment, and this gives rise to complex issues relating to security, safety, and privacy due to the dense high-rise residential areas and closely co-located security-sensitive locations across our island. Third, Singapore's unpredictable weather and tropical climate pose practical challenges for aviation. This is something that we already need to manage carefully for large planes at Changi, let alone smaller and more unstable low-altitude aircraft. It is essential for overall aviation safety that we test new technologies rigorously and work out robust operational processes prior to development. Against this backdrop, we have generally adopted a conservative approach in the past. But with drone technology becoming more mature, we can do more. We are studying the approaches in overseas jurisdictions and will adapt what is relevant to Singapore's operating environment. Dr. Neo mentioned China as an example, and we agree that there are aspects that Singapore can learn from. Chinese cities are trialing drones for a multitude of urban use cases, including food and parcel deliveries, high-rise facade inspections, traffic monitoring and enforcement, and search and rescue operations, many of which Singapore may also wish to explore. The Chinese government has also provided strong support for companies involved in drone development and production in the form of tax reliefs, subsidies, and industrial parks. In the US too, there has been significant progress. Commercial companies like Wing, a Google spin-off that our acting Minister of Transport visited just last month, have commenced delivery operations across the country. In these cities, regulatory frameworks are evolving rapidly. For instance, some cities in China have recently tightened their regulations for recreational and civilian drone operations. And in the US, the regulatory frameworks vary considerably depending on the state and the city. In Singapore, the government, as I mentioned, will continue to closely monitor the evolution of this space. Dr. Neo proposed a national strategy on advanced air mobility and the low-altitude economy. He mentioned a triple helix approach involving the government, industry, and research or educational institutions. We agree with Dr. Neo.
Could I kindly request you to wrap up, because we do have a 30-minute time frame for this AM. Thank you.
Thank you. We agree with Dr. Neo that it is important to bring together the wider ecosystem, and we will consult all stakeholders. MOT's immediate focus is to drive the usage of drones more extensively, especially by the public sector. And this is because we already have many potential use cases. And we will also continue to work with the private sector on commercial use cases while continuing to emphasize safety and being cognizant of our unique operating environment. Allow me to end off by assuring the House that we will continue to work together closely to safely and responsibly harness the benefits of low-altitude technologies for our transport sector and Singapore's wider economy. Thank you, Mr. Deputy Speaker.
Order. The time allowed for the proceedings has expired. I adjourn the House pursuant to the standing order. Order. Order.